Good morning, everyone. The January 7th, 2022 virtual emergency legislative meeting of the Anne Arundel County Council is now in session. Madam Secretary, please call the roll.
Good morning, Mr. Volke.
Here.
Mr. Pruski.
Here.
Ms. Fiedler.
Present.
Ms. Hare.
Present.
Ms. Lacey.
Present.
Ms. Pickard.
Present.
Ms. Rodvian.
Present.
Ms. Schuett.
Here.
Madam Chair, we have all 7 council members in attendance and Legislative Council.
Thank you. Please pause for the invocation and Pledge of Allegiance will be led by Councilwoman Hare today.
Thank you. Good morning, everyone. Let us be thankful for this day that we have been given, for its blessings, its opportunities, its challenges. May we appreciate and use each day that comes to us to the best of our abilities through collaboration and kindness. Let us seek strength and guidance for each day's duties and problems and be challenged to give our best always. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Madam Secretary, please read the Open Meetings Act statement.
The county attorney has asked that I read the following statement. The Maryland Open Meetings Act is a state law that requires public meetings to be open to the public and be held in places reasonably accessible to individuals who would like to attend these meetings. In addition, provisions of the county charter and the rules of procedure of the county council require meetings to be open to the public and held in Annapolis as the county seat. The virtual format of this meeting of the County Council includes alternate accessibility features that the Open Meetings Act Compliance Board and the courts have reviewed and approved, such as having a call-in phone number that allows anyone with a telephone to call and listen to the meeting, broadcasting the meeting with video and audio on cable TV and the web, allowing written comments from the public to be filed with the clerk and considered by the council, and now allowing the public to call in via Zoom and testify live. The public access provided by this technology makes this virtual meeting reasonably accessible to the public as required by the Open Meetings Act. In addition, it is not necessary to suspend the rules of procedure for the council that apply to public participation and reasonable seating for the public and media or the location of council meetings. These rules have been deemed satisfied and do not need to be waived in order for this meeting to be held.
Thank you, Madam Secretary. Please read the ethics statement.
The Ethics Commission has asked that I advise you that under certain circumstances, members of the public may qualify as lobbyists when they testify before the County Council. If so, the law requires that certain information be filed with the Ethics Commission. The chairman of the Ethics Commission has asked that those who wish to testify in any form review the general information on lobbying sheet located on the ethics website under forms and publications. If there are any questions about lobbying requirements, please contact the Ethics Commission at 410-222-4413.
Thank you. Is there any item any council member would like to place on the agenda? Hearing none, I would actually like to offer a motion to consolidate public hearings into one. We have a very large number of speakers today, and many have signed up to testify on both bills. And this will allow us to hear from more people, as hopefully people will not have to leave the meeting for fear of missing their spot. Do I have a second?
Allison Pickard, second.
Mr. Volke.
Thank you, Madam Chair. Nathan Volke, District 3. I just want to understand the practical effect of this motion. So if it passes, then instead of each person having 2 minutes to speak about Bill 6-22 and 2 minutes to speak about Bill 7-22, people will now be required to consolidate all testimony that they have on both Bill 6-22 and 7-22 within 2 minutes. Is that correct? You're not proposing that they get 4 minutes, right?
That is correct.
Okay, all right. So just wanted to make sure I understood what was going to happen. Thank you.
Ms. Hare.
Thank you, Madam Chair. Jessica Hare, District 7. I'm just curious, as a practical matter, do we have a lot of folks signed up twice?
We have a fair number signed up twice. Madam Secretary, please call the roll.
Mr. Volkey,
Nay.
Mr. Pruski,
Aye.
Ms. Fiedler,
Nay.
Ms. Hare,
Nay.
Ms. Lacy,
Aye.
Ms. Pickard,
Aye.
Ms. Rodvian.
Aye.
That's 4 in the affirmative, 3 in the negative. I do need to ask our legislative council as parliamentarian very fast. Is that, does this need 5 votes or 4 votes to pass?
4 votes.
Okay, thank you. So with 4 in the affirmative, the motion to consolidate and join the public hearings on bills 622 and 722 has been adopted.
Thank you. May I have a motion that the partial reading of any bill, resolution, amendment to bill or resolution or minutes constitutes the reading of the whole?
So moved, Allison Pickard.
Second, Sarah Lacy.
Thank you. All in favor?
Aye.
Aye. Any opposed? The motion carries. We have some local hospital representatives here this morning to share some brief information and updates. Please welcome Dr. David Marcosi, Dr. Taner Goodwin-Vanima, and Dr. Barry Meisenberg. We will start with Dr. Marcosi.
Good morning. Thank you. Anne Arundel County Council members and fellow Marylanders. I am honored to speak to you this morning. My name is Dr. David Marcosi. I'm a professor of emergency medicine at the University of Maryland School of Medicine, a colonel in the U.S. Army Reserves, and for the last 2 years, I've served as the University of Maryland Baltimore, University of Maryland Medical System COVID-19 Incident Commander. Proudly serving Anne Arundel County and a premier hospital within our system, the Baltimore Washington Medical Center was caring for 119 COVID positive patients, of which 20 of those patients were in intensive care and 20% of those patients were in intensive care and 25% of those patients were on life support. That means that BWMC actually needed to open up additional ICU space to care for critically ill patients. Here are 2 important facts. 95% of those 119 individuals were not fully vaccinated with a booster, and 75% of those patients requiring intensive care had chosen not to receive vaccination at all. When we see a fellow Marylander in the ICU on a ventilator because they chose not to get vaccinated, it breaks our heart for them, their family, and their children. I want to be very clear on this. Hospitalization from COVID-19 is largely now a preventable problem if you get fully vaccinated, which includes getting a booster. Unfortunately, we believe that things will become more challenging, not less, over the next few weeks. The majority of cases in our health system are the Omicron variant. It transmits exceedingly easily between us, and although it is milder in some individuals, it is still causing severe illness in others. BWMC is doing everything in its power and is using all available staff and resources to care for the surge of patients in their hospital. Unfortunately, on December 27th, BWMC needed to declare a hospital disaster and implement crisis standard of care protocols due to the overwhelming number of patients needing care. These protocols are in place right now. What that means is this is not just a COVID-19 problem anymore. Patients suffering from COVID-19 are limiting our ability to care for many other illnesses and surgical problems too, from broken ankles to asthma to heart problems. This is absolutely an avoidable situation. I want to be sure we take a moment to recognize the nurses, therapists, doctors, pharmacists, paramedics, and essential workers in Anne Arundel County who have demonstrated unyielding determination and selfless service throughout this crisis. They are true heroes. All Maryland hospitals across the state, and especially within our county, are doing everything they can to care for us through this pandemic. Unfortunately, health providers are increasingly frustrated and fatigued, having been in this fight for nearly 2 years, and feel that many of us are fighting against them, not with them. They are nearing a breaking point, and most of them are exhausted, and some are leaving healthcare altogether. If you visit an emergency department for care, remember to have patience with your caregivers. Theirs and my request is simple. Fight with us. Simple things can slow the spread of COVID and will help us get through the next few difficult weeks. We need to all, number one, get vaccinated for COVID and flu. These vaccines are safe and doing exactly what they are designed to do, keep us from becoming sick and dying. That said, even if vaccinated, you can still carry and transmit COVID to a family member or while you are out and about at the supermarket, at church, or at work. We need to continue to own the responsibility to protect each other and ourselves even after vaccination. Second, wear well-fitting masks over your nose and mouth in public indoor spaces, regardless of vaccination status. If you're concerned or high risk, use a KN95 or N95 mask as they afford you greater protection. The CDC clearly states this, and interestingly, in 2021, a study published in the American Journal of Medicine by Dr. Zach Desmond looked at the effects of mask wearing in Maryland that actually weren't related to COVID. The study found that in our state, an increase in the prevalence of community masking was also associated with a decrease in emergency department visits for non-COVID related viral illnesses, and also a decrease in exacerbations of asthma and chronic obstructive pulmonary disease. Lastly, get tested for COVID-19 if you have had contact with symptoms who is positive, or if you have any COVID-19 symptoms, and stay home if you're having any of those symptoms. I want to wish you and your families the very best this new year. Thank you for the opportunity to speak this morning.
Thank you very much, Dr. Marcosi, and thank you for your service. Next, we have Dr. Goodwin Vanima.
Good morning, everyone, and thank you for the opportunity to speak with you today. It's an honor and a privilege to be here to help you think through the policies that you're evaluating this morning. My name is Dr. Tenor Venema, and I am a research scientist and professor at the Johns Hopkins Center for Health Security. I co-chaired the Healthcare Worker Protection Research Program over the past 2 years on behalf of Johns Hopkins University. And I've also participated in 2 National Academy of Medicine standing committees and consensus studies looking at respiratory protection, not only for the healthcare worker, but for the public at large. Let me first start off my remarks by echoing and confirming everything that Dr. Marcosi has just reported to you. And I have several points that I would like to elaborate on as you consider moving forward with your initiatives. Later this morning, I will be spending most of today on phone calls with the Maryland Board of Nursing and the Maryland Center for the Nursing Workforce at the University of Maryland. The state of Maryland is experiencing an unprecedented nursing crisis, and we have a nursing workforce that is physically, mentally, and morally exhausted. They feel a sense of betrayal in their relationship with the public, in terms of the public not being willing to do the vaccines that we know save lives, and something as simple as masking, which is the least intrusive and most effective public health action that we can take now to stop the transmission of illness. It is so critical to maintain indoor mask mandates when we think of the children who are unable to be vaccinated, elderly, immune-compromised individuals, and those others who are at such high risk, in order to maintain the economy and daily business of school and work. An indoor mask mandate helps stop transmission of disease and allows us to maintain human contact and our activities of daily living. Beyond that, the main reasons that I ask you to consider in supporting and extending your indoor mask mandate. Again, healthcare providers are literally and figuratively at the end of their rope. They have been working nonstop for over 2 years now. And the Omicron surge is once again putting every healthcare worker in jeopardy in terms of their physical and mental health. As Dr. Marcosi said, COVID-19 hospitalizations are a preventable occurrence at this point. We can stop this with affirmative and decisive action in order to protect the health of the public, the health of those most vulnerable, and the health of our healthcare providers. We are in influenza season, and so now we are seeing complications of COVID occurring with influenza, further providing evidence to have an enduring mask mandate. And finally, I would ask you to urge caution in the information that the public is circulating that Omicron, while it may not be as severe as the Delta variant certainly was, we still do not have a full and comprehensive scientific evidence-based understanding of what the long-term impacts of having COVID-19 infection are. So this remains to be seen in the future as we study those individuals who are experiencing longer sequelae from the COVID-19 infection. So when you put all of these things together, I like to reduce science down to what is simple and makes sense. Indoor mask mandates, again, work, they're effective, they're not intrusive, and I urge you to continue yours. Thank you very much.
Thank you, Dr. Venema, and also thank you for your service. Finally, we have Dr. Barry Meisenberg.
Good morning, and thank you for the opportunity to speak to the public and to the council. I am the chair of the Department of Medicine at Luminous Health, Anne Arundel Medical Center. I'm also the director of the Research Institute. And in those roles, I oversee most of the COVID care delivered to both outpatients and on the inpatient side. I've personally treated hundreds of people with COVID as part of our outpatient and research efforts. And I oversee the care of thousands. I've looked into the issue of mask wearing myself personally, because I like to look at the data, and because mask wearing has been challenged almost from the beginning. And as it was challenged 100 years ago during the what's known as the Great Influenza. And I can tell you, I believe the preponderance of studies show a benefit, a very significant benefit in slowing community transmission in various settings. And the key thing to remember about this Omicron, in fact, most viral infections, is that there is a pre-symptomatic shedding period. In other words, people shed virus way before they feel badly or have any symptoms. In fact, they shed the most virus on the day before they get they get symptoms of COVID-19. So mask wearing has to be not just for sick people, it has to be universal. And it protects in both directions, protects people from inhaling viral particles and from expelling viral particles if in fact you're symptomatic or pre-symptomatic. So I support any action that will help with the uptake of mask wearing and other prevention strategies which have been mentioned, like vaccination, like physical distancing, and so on. The numbers at Luminous Health Anne Arundel Medical Centers are also very worrisome. 130 patients in the hospital this morning who we didn't have 2 years ago. Major expansion of bed capacity, of ICU capacity, ventilator capacity, as you all familiar with it. But what I want to say to you is that these are not just numbers that you see on the crawl of your TV screen or in the department in the county's Department of Health website. These are people with families and jobs and roles in our community that are very, very important. And everyone is a loss. Everyone who's sick and becomes sick for months, and we have many like that, and every person who dies is a loss to our community. So I share some of the frustration that you heard expressed earlier. And what I would point out is to the public is, the healthcare workers have been rightly praised, I think, for their duty, for doing their duty and their duty to care. But duty to care is reciprocal, and it requires a reciprocity on the part of the public to do what they can do to both protect healthcare workers and also to reduce the severity of the illness when we can. And we know that mask wearing bends the curve. And if we bend the curve, it will slow the crisis at the hospital and allow us to deliver care to everyone who needs it, and allow us to do elective surgery and help the people who need that, and allow us to treat the heart attack patient far more promptly. So the public is the ones also being hurt by the crises at the two local hospitals. And I think we should realize that, as we said early on, we're all in this together, and mask wearing will help everyone. I just want to return to this issue of the healthcare workers, because I've been very concerned about this phenomenon that you've heard already twice discussed. And whether we call it compassion fatigue or empathy exhaustion or frustration, what you're hearing is people who are working really, really hard in a perpetual state of crisis at some risk to themselves, or fortunately much less than we started this. But they're not seeing this reciprocity on the part of the community, because the numbers, as Dr. Marcosi said, are profound in terms of who's admitted into the hospital. In terms of unvaccinated and certainly unboosted individuals. And this can cause a hollowing out of our sense of mission. Most people in healthcare were attracted to the profession because they're healers. And they pride themselves in answering the call, no matter the time of night or the extent of the crisis or the severity. And it's a very uncomfortable feeling to find that sense, that commitment being eroded. And I worry about these folks long term, because that really is an identity. And although it may not be the most important aspect of this crisis, I can tell you that the men and women of these hospitals, and actually the entire healthcare workforce, because lots of people are involved in COVID care, those thousands of people are looking to the public for reciprocity, and they're looking to their leaders for leadership. And I hope that they won't be disappointed. Thank you so much. And I would just conclude with a shout out to District 5, because I've lived in District 5 for 25 years. Thank you.
Thank you, Dr. Meisenberg. I would like to keep this next portion of our meeting somewhat brief, but I would like to offer my colleagues the opportunity to ask questions. If we could try and limit it to 15 minutes, because we do have over 100 folks waiting to testify today. So if there are questions, I see Ms. Fiedler has her flag.
Thank you, Madam Chair. Amanda Fiedler, District 5. So I'm wondering, and this is for, I guess, all three or whoever can best give an idea of the answer. How many people presently on average each day for COVID testing are going to the two county hospitals in, let's say, the last 2 weeks, 14 days, just for testing?
I think that the appointment of the National Guard to organize and run on our campus testing has taken a lot of the burden off the hospital. Prior to that, we were seeing hundreds of people a day, and it was a mixture of the public wanting tests for whatever reason, symptoms or travel, plus the patients who need testing before surgery, elective surgery, plus the patients of our health system who were symptomatic and the tests were ordered by their doctors. And so it was quite a complicated operation and long lines and so on. But the National Guard has definitely helped. And, we're also hoping that will relieve some of the burden of people going to the emergency room for testing, which thank you for the opportunity to say, please don't do that. Emergency rooms are busy enough. So, yeah, but there still is quite a big demand, as you are aware, for testing for a variety of reasons. And I think all the epidemiologists would say testing is good. That helps us understand who should be isolated.
Thank you.
Thank you, Ms. Fiedler. I looked down at my notes for just a second, and then when I looked back up, there were 3 hands. So I'm not certain who was first. If you know who was first among you, otherwise, okay, Sarah, Councilwoman Lacey, you have the floor.
Thank you, Madam Chair. And thank you all for coming to speak to us today and enlighten us on what's going on. I have kind of a theoretical question. Would any of the crisis response protocols or the effectiveness of care provided during this crisis be improved if we were to be able to separate out the vaccinated who need care from the unvaccinated who need care, so that they're not in the same facility, or perhaps they get directed to go to a particular facility, so that essentially people hopefully don't have to be turned away when they urgently need care, whether it's for COVID or not?
Yeah, I can start. Healthcare providers care for anyone who comes through the door, whether or not you've chosen to be vaccinated or not chosen to be vaccinated. And if you're ill or injured, our emergency departments across the state are ready to receive you. What we're trying to have a conversation about is, it's our expectation and hope that the public engages with us, gets vaccinated, protects themselves and others. But if you need help, we're there to make sure you get the care you need.
Yeah, I would like to second that, and I will do it briefly, because there's been some talk about this, not from physicians, but from columnists, editorialists, and so on. And it's harsh talk. Our profession relies on a 1,000 or several thousand year history of trust by the public. And it's actually across cultures that trust exists. And if we were to say that certain people are not worthy of our best efforts for whatever motivation or behavior, I think it's a direction that we just could not tolerate, and we would lose our sense of trust. So, you know, as long as it stays loose talk, it's one thing, but I think no physician organization would consent to that.
Thank you all.
Ms. Hare.
Thank you, Madam Chair. Jessica Hare, District 7. Dr. Breisenberg, I think this may be best directed at you, but honestly, for any panelists who may be able to answer the question, I'm trying to understand a little bit about patients admitted because of COVID symptoms versus patients who are in the hospital for other reasons but test positive for COVID. So if someone presents to the emergency room, they've been in a car accident, they have a broken leg, and they are tested because they're there and they happen to test positive for COVID, although obviously they came in because of the car accident. Does the hospital, I don't know what the correct term is, but do they code it as a COVID admission or as a broken leg? And then because of the COVID, the second part of this is because of the positive test, do we in our healthcare dashboard, when we're looking on the state of Maryland's health dashboard or the Anne Arundel County health dashboard, do we see that patient's admission as a COVID hospitalization?
Yeah, well, thank you. I'll start. I think David might have some comments as well. So what you're describing is what we call incidental finding of COVID. However, a patient in broken ankle, fine. How about pregnancy? That's a fairly common one. We think it's no more than 15% of all these admissions. And sometimes it's hard to tell because symptoms can be mixed. So someone coming in with an exacerbation of their kidney failure or heart failure, who's also COVID may well be part of that. In other words, had they not got COVID, they might not have ended up in the hospital. But the impact on the hospital is the same because they still need isolation. They still, everyone needs to gown and mask and glove when they go in the room. And so the only difference is they may not need all the medications that we have available. So I'm not sure it's a useful distinction to make in terms of policy or how we treat people. And I don't think there's a code for incidental COVID at this time. David?
I'll chime in. Dr. Meisenberg's spot on. We have about 20% that is described as incidental, but I'll ask this group the question: if a person falls down, is weak, falls down the stairs, comes in because they fractured their ankle and was weak because they were not able to, they were COVID positive and feeling too weak and fell down the stairs, is that a fractured ankle diagnosis, or is that COVID being the underlying etiology to their problem? Fundamentally, at the ground where we are treating patients doesn't make a difference. We're going to treat them all, and we're going to make sure we protect ourselves, and give the best care we can to the patients who are COVID positive or not COVID positive.
Thank you.
Thank you, doctors. Mr. Volke.
Thank you, Madam Chair. Nathan Volke, District 3. This question is specifically for Dr. Meisenberg. So I had a chance to review a quote that you had in the Baltimore Sun last month, where you said, if you're infected, we're looking at fluid intake, Tylenol, similar medications to control a fever. We're concerned about overrunning the ER, so don't go unless you have a significant medical emergency or you're short of breath. Setting aside masks for a moment, in light of the comments that you made previously about where we stand with the COVID situation, what other steps can the county be taking to alleviate ER overcrowding associated with COVID testing, separate and apart from a mask mandate? What other steps can be taken?
So let me sort of unwind that question so I understand it. You're asking, so the preface about my excerpt from the Baltimore Sun, notwithstanding, it's about what else could be done to alleviate the emergency room crowding, right? And it's not just the emergency room crowding, it's the hospital crowding and so on. Well, so yeah, we want so that instruction, and we're pushing information out through our electronic record and social media, is to try and guide people without knowing the details of the medical history about what's the appropriate use of the emergency room, so that we can, fix the crowding and avoid congregating and so on. So that advice stands. I'm satisfied with that advice. In terms of what else, well, sure. Well, you mentioned not going to the emergency room just for testing, and that would be very helpful as well. With regard to COVID, the prevention strategies that have been mentioned, vaccination, physical distancing, what people sometimes call social distancing, and mask wearing will reduce the likelihood of acquiring the disease and developing symptoms that needs evaluation. So I think that's what we can do, in addition to the expansive testing.
Madam Chair, may I follow up briefly?
Go ahead.
Thank you. Yeah, the reason I had prefaced it with your quote, doctor, was just to ensure that I understood when you were talking about COVID patients and testing, you were basically saying, look, unless it's a really severe case, at least the way I interpreted it, don't run to the ER to get tested, because we don't want to overrun the ER. It sounds to me from your answer like the number one most important thing, and I think this is consistent with what Dr. Marcosi said in his opening remarks, was get vaccinated. That's what I'm hearing kind of as the number one thing, is get fully vaccinated. Then after that, masks and social distancing are sort of a secondary piece of this, but that sounds like the number one thing to help with hospitalizations. Am I understanding your statement, and maybe even Dr. Marcosi wants to weigh in? Am I understanding that correct?
Well, I prefer to make my own statement about that. And, excerpts from the Baltimore Sun, as you probably well know, I may have been addressing an entirely different issue. And the issue I was addressing was the loss of effectiveness of the monoclonal antibodies. And the question, became, well, what else can we do if we don't have monoclonal antibodies and, oral drugs were not yet available? And it's a separate discussion. So, as a health system, it's hard to give individual counseling, because I don't know every medication a person takes. So I gave just general advice about when to use the emergency room at this time of heightened attendance. And by the way, the numbers are historically high in our emergency room. So, but if you're asking about the relative merits about vaccination versus masks, I'd say, yeah, we want them both. I think all the panelists have been pretty clear about that. Because even with vaccination, you can still acquire the virus and pass it. And you remember, I hope everyone remembers that in the initial studies of the vaccine that were so positive, that 95% reduction, that was about serious COVID illness. It wasn't about viral transmission. And no one ever said that the vaccines were going to eliminate viral transmission. So you still need the mask, even if you're vaccinated.
I believe Ms. Fiedler was next.
Thank you, Madam Chair. Amanda Fiedler, District 5. I was going to actually ask about the capacity because it's been challenging to find more detailed county hospital data versus state, but I do want to piggyback on the mentioning of the monoclonal antibodies, since you mentioned it, Doctor. We know that the federal government miscalculated some of the numbers for Omicron for about 2 weeks, and then they adjusted. And in that 2-week time, the monoclonal antibodies were not allowed to be given to patients across the country. I know here in Anne Arundel County, at least one location that was giving those antibodies had to turn away 250 patients who had appointments for those treatments. And I've heard of wait lists at least one of the hospitals that had to then be canceled. Do we have any information on the number of patients in that 2-week period of time that had to either receive emergency department treatment, including admission, or had some serious outcomes from not receiving those monoclonal antibodies?
So I don't know that I know the numbers in the sense of what was the outcome of that move, but let me just address the issue. So we've learned, unfortunately, for a variety of different ways that the mutations in Omicron prevent the two workhorse monoclonals from doing their job, the Regeneron drug and the Eli Lilly drug, with an unpronounceable name that everyone just calls BAM. So they don't work. And a decision was made that once the Omicron level gets above a certain level, say 80%, there's no point in continuing to give the drug. So what happened was the CDC put out an estimate for our region, and by the way, that's a multi-state region, and said it was over that threshold with a confidence level, above and below, and the program was closed down. That's what led to that newspaper article that Mr. Volke was referring to, right before Christmas. Then it got recalculated with a little more precision, and you weren't quite at 80%, you were only 57%, so go ahead and turn it back on. And so some of us turned it back on. But when you think about it, even at 60% Omicron level, that most people would be getting a drug that's not going to benefit them. And now the governor mentioned the other day that both data from maybe Dave can comment on, and also I think a private lab is somewhere between it's around 90% Omicron. So I wouldn't continue to push that strategy if the drugs don't work. And by the way, they worked. You've heard about 80% reduction in admission. That's true, but the numbers were you had to treat about 20 people to prevent one hospitalization. Although that's not the only goal of antibodies. They do make people feel better very often and faster. But that leaves us with one active antibody currently that is an extremely short supply. And the infusion network that the state has set up, we've been meeting regularly about this. We've worked on some understanding that needs to be some sort of prioritization for the people who are most at risk for bad outcome could get that very limited supply. So that's going to be really, really hard to do. We hope that supply will expand. Same time, these two new oral drugs have come available. The state has been messaging everyone who's a practicing or is a practitioner in the state about how to order them, where to find them, and which patients should receive them preferentially. Again, prioritizing those who have the most to benefit, who are at highest risk of a bad outcome. So I hope I've answered your question, probably created 2 or 3 others. David, did you want to comment on the antibody?
No, I know we have a long agenda. I'm glad that I think, Barry, you're spot on. Key things are, number one, number needed to treat for monoclonals is 1 for 20. So you're going to avoid 1 hospitalization for 20 treatments. So realize that that is not the solution set that we're all looking for. You don't look to become or think you're going to become ill and then have a rescue treatment. You actually prevent the illness in the first place. But both what Barry mentioned around some of the therapeutics and the monoclonals, helpful, but won't get us out of this predicament that we're in presently.
Yeah. If I could make a trite, maybe weather appropriate, you don't fail to shovel your sidewalk and your front steps because you know you've got a good orthopedic surgeon who can fix your hip. Prevention.
Thank you, Ms. Hare. And also, I just want to let my colleagues know we've passed 15 minutes, so I do want to try and move on as quickly. I'll let everyone that's got their hand up ask an additional question, but I do want to be mindful of our time schedule here. So, Ms. Hare.
Thank you, Madam Chair. Jessica Hare, District 7. I'm trying to understand the percentage of people in Anne Arundel County who have been either vaccinated or who would have antibodies because they contracted COVID. Do we have a number on a percentage basis or a total number of people that we are estimating at this point based on all of the data available to us?
Well, I think that's a question best directed at the county health officer. I've only read the reports of somewhere around 70%. I wouldn't equate vaccination with a natural infection as achieving the same level of immunity, however.
No, certainly. Sorry, Madam Chair, may I ask a short follow-up?
Pardon me, yes.
Okay, thank you. The reason I ask is about a year ago, we did sit in with the county health officer here and asked specifically about mask wearing and its relationship to herd immunity and things like that, and had a number from the health officer where he said we would reach this herd immunity. And your comment about Dr. Meisenberg preventing viral transmission caught me a little bit off guard because I don't think as a general population, we ever really prevent viral transmission. I think, viruses are alive and well. And so that caught me as a kind of at what point are the masks in your estimation not necessary, right? Because if we are reaching that herd immunity point, I do believe the vaccination number is about 70%, but then there is certainly on top of that, a number of folks who have contracted COVID and have the antibodies themselves. And so I'm just trying to get an understanding of where we're at in that herd immunity conversation.
So, so the 70% was an estimate, and it, speaking abstractly in epidemiologic terms, the percent of the population that needs to be immunized depends on the potency of the virus, how good it is at infecting people, but also on human behavior. And that's the so-called R value that you've heard about, the reproducibility. And Omicron's a different animal. It's not an animal. Virus is neither plant nor animal. Omicron's a different entity, and it has a higher R value biologically. And so, the highest the virus that we talk about is that, top of the table is measles, which has an R value of something like 12 or 18. Dr. Vanima, you may know exactly. But this is beginning to smell like it has an R value of that level. It's so transmissible. And so the estimates of herd immunity would rise.
I can just add, if I can add one moment onto Dr. Meisenberg's comments too. I think it's important for us to recognize that immunity is not an entire yes or no situation, that people's immunity increases with vaccination, but can wane over time. And then we're also seeing people with repeated COVID-19 infections. So I think it's really important to recognize that you're not necessarily completely immune or not immune. It really is more of a spectrum.
Thank you. Mr. Volke.
Thank you, Madam Chair. Nathan Volke, District 3. So this question is specifically for Dr. Marcosi. I understand that you're a senior medical advisor to Governor Hogan, and I found an article dating all the way back to July of 2021 when there was no statewide mask mandate, where you were advocating for a statewide mask mandate even at that time. Notably this week, Governor Hogan has done a series of press conferences and he's come out with certain things, but he has not actually implemented a state mask mandate. I was just trying to understand what, if any, other factors went into the governor's decision to not implement a statewide mask mandate, knowing that you're very likely in the room advising for a statewide mask mandate. Obviously, there were more considerations. So I'm curious what the governor thought about or what that discussion was.
No, thanks for the question. And obviously, I would defer to the governor on his decision on how where he landed on this. But I'll simply say this: to me, I am an end game guy. It doesn't make a difference if we mandate or if we encourage it or if we need mask wearing in the public. How we get there from here is dependent upon either county or businesses or churches or government to achieve that goal and the public to embrace it. I remember after 9/11, the Department of Homeland Security came out with these, if you see something, say something. And the public embraced that and said, you know what, I'm going to call because I think that there's a little bit of a concern here with regard to our threats in our nation with regard to terrorism. The current threat is COVID-19, and engaging the public, just as DHS did for see something, say something, is exactly what we need right now for COVID-19 and vaccination and mask wearing.
Thank you.
Ms. Fiedler.
Thank you, Madam Chair. Amanda Fiedler, District 5. So when I go on the state's website and look at their bed capacity across the state, it's pretty easy to see when we're talking about COVID versus non-COVID, that across the state, the large majority of staffed beds are non-COVID related patients. It's a little more difficult, if not impossible, to get that data on the different hospitals within the county. It looks like we have about 689 total licensed beds between the two hospitals. I don't know if that reflects the amount of staffed beds. So my question is, of the staffed beds, what is that number? And how many of the staffed beds are currently consisting of COVID patients? Because I believe that 64.2% or the majority are non-COVID patients. I think you may have touched on this at the very beginning, but I just want to confirm for clarification.
So the numbers change every day, but I think you're approximately right. About a third of our hospital census is COVID-related illness. People that weren't in the hospital 2 years ago at all. And of course, we've expanded our capacity. We've turned all unused wards into units into patient care areas and are prepared to do even more. We have the state delivered to us some annexes, prefabricated annexes that were put together and available for emergency care. So right now it's about a third, and I would say about half of the ICU population is COVID. More of the ventilated population is COVID, even a higher percentage of that. And we're working very hard on protocols to allow people to go home faster once that they're stable, maybe with home oxygen and whatever they need to to relieve the burden. But it is very, very substantial. Now, we're also doing less elective surgery as a result of staff issues and the governor's announcement. And more of those beds are being, made available for sick COVID and other medical ailments. But, we still are, as our OB program chair likes to say, we deliver a kindergarten worth of babies on a regular basis, and they need space at the inn as well, and do other people with illnesses and emergency surgery and heart attacks and stroke and all that other urgent care continues.
Ms. Pickard, you will get the last question of the day.
Thank you, Madam Chair. I want to first really thank these three panelists, experts, medical professionals, for being here this morning and taking up really important time. to be clear, what I'm hearing is that each of you, with your medical expertise, agree that masks are an important part of us getting through this surge. And with that, and it's an important tool to fight against this virus. I just want to give you one last opportunity, because I really would like each of you on my D2 team, as we look to respond to some folks who still have any remaining questions out of everything they've heard today. You've answered all of mine, and I'll be using some of your information to share with my constituents. But one last time, masks are good?
Yeah, I didn't think this was the right time or moment to go through the details of the study, and maybe that would help influence a few people who like to dig into the data themselves. There have been scores of studies and reviews and so on, and that's what I referred to when I said I dug into the data myself. But yes, masks will definitely help. We said bend this curve, slow the transmission, and all the other good things that will come from that.
All right, I just want to say thank you very much to the panelists. We greatly appreciate your time. We know you have enormous work ahead of you today and every day. I've definitely learned some new things today, and a lot of things that I thought I knew you emphasized for me. So again, I greatly appreciate your time. I think I have also understood that if we have additional questions that we want to follow up with later, we can hopefully connect with you by email. Okay, and I'm seeing at least one nodding head, so I greatly appreciate that. And at this time, we're going to move on to actually our public testimony. So thank you again so much for your time today. Madam Secretary.
Thank you very much.
Yes.
Thank
Yes.
you. I do have to leave for clinic, but I'm available certainly for email discussions if that's what you'd like. Thank you.
Greatly appreciated.
Thank you very much.
Thank you. Madam Secretary, please read the titles of Bill number 6-22 and 7-22.
Bill number 622, an emergency ordinance concerning COVID and the use of face coverings. Bill number 722, an emergency ordinance concerning extension of proclamation of civil emergency.
Thank you, Madam Secretary. Since I'm the sponsor of Bill 6-22, I want to just give a little bit of an explanation, and then I'll allow admin to respond and discuss the bill that we are, or that they are entering today, or that they have sponsored. Bill 622 is a little bit different than 722 in that it does not actually extend the county executive's emergency order. It basically implements a mask mandate, but it keeps the council in the driver's seat. And I really tried to create this in a way that I believed could get bipartisan support in that, throughout the COVID pandemic, there has definitely been interest from all of my colleagues that the council continue to have input on the direction of any measures that our local government takes with respect to addressing the pandemic. And so Bill 6-22 starts with a 6-week mandate for masks. It can under this bill, the county executive could encourage any type of mask, such as an N95 or a surgical mask, but it cannot require. I think we all recognize there are practical difficulties of actually requiring a certain type of mask when you think about the very large number of people that would be impacted by such a rule. So it leaves that flexibility. It leaves flexibility in other places where mask wearing can be difficult, but still would add enough mask wearing in the community to make a noticeable difference in some of the in the hospitalizations, which for me today is my biggest concern. Looking at those record hospitalizations, we are absolutely at record high numbers in the county for the entire pandemic and record numbers at the state for the entire pandemic. And Unfortunately, I should have asked this when the doctors were still here, but I believe these are all-time hospitalization records for the state of Maryland and for Anne Arundel County. At no point in our state's or county's history have we had a higher number of hospitalizations. So it will give us a tool to help bring that number down and support the hospital staff, which the doctors mentioned have been fighting this pandemic on the front lines for close to 2 years straight now and are exhausted. In order to continue the mandate after a 6-week period, the council would have to vote by a 5-vote majority to extend it in 3-week periods. Again, crafted to keep the council in the driver's seat with respect to implementing this public health measure. And with that, I will allow, Mr. Barron is here for the administration today. You can respond and discuss Bill 7-22.
Thank you, Madam Chair. Pete Barron with the administration. Joining me is our health officer, Dr. Colleen Noraman, our county attorney, Greg Swain, our deputy county attorney, Lori Blair Klausmeyer. I want to thank Councilwoman Ravian for her bill. I'll talk briefly about our bill, but I just want to point out, I'm not going to pretend here to be an expert on the science behind the use of masks. We just heard from experts, and I think it's important as we're deciding which way to go as policymakers, we listen to the experts. Last week, the county executive signed an executive order requiring face coverings in public. This was in direct response to the alarming rise in cases, hospitalization rates, and deaths over the last few weeks. He's consulted with many experts on this, including some that you just heard from today. We've had 21 deaths in a week, 5 in a day. Those are numbers that are way higher than we've seen before. We don't want to be here today asking for an extension of our emergency powers, but we must recognize the reality of our situation. We have more tools, though, to fight this than in previous surges. We have vaccines and boosters, so we can take less disruptive measures than we did before. The bills before you do not grant any powers beyond authorizing a county rule that would require the wearing of the damn mask. We are not asking, nor do we want to mandate any shutdowns or closures. I'll say it again, we're not seeking the powers we were seeking before previously in this pandemic when we did not have the tools that we have today. You just heard from our hospitals. The council has a copy of a letter from the Maryland Hospital Association, the League of Life and Health Insurers, MedChi, Lifespan, and HFAM asking the governor for a statewide mask rule. The governor has instituted a rule for state buildings, and every large county in the state has a mask mandate, many passing theirs in bipartisan fashion. We urge this council to put aside partisanship, stop stoking division, listen to the science and our healthcare professionals, and lead. I'll turn it over to Dr. K for a few comments from our health officer, and then happy to answer any questions council may have.
Thank you, Chairwoman Ravi and members of the County Council for having me here to talk about our situation with COVID. For nearly 2 years, we've been tackling the COVID pandemic in its ever-shifting dimensions, and we've made a lot of progress with vaccines, at-home testing, treatment, and education. But at this time, we're facing a challenge we have not faced at any other time during this pandemic. So we are compromising the integrity of our hospitals with a large number of people with COVID needing care. You heard from Dr. Marcosi, Dr. Bienema, Dr. Meisenberg, what they are seeing. Hospitals are essential civic institutions, and we have talked a lot about the fact that part of our goal is to protect those institutions so that they can care for everybody. Every one of us has needed the services of the hospital, and we rely on their availability and take it for granted. In return, it's our responsibility to ensure that they're able to function and take care of the sickest and those in greatest need. A month ago, December 3rd, our case rate was 19.4. There were 45 people hospitalized with COVID at our 2 hospitals, Anne Arundel Medical Center and Baltimore Washington Medical Center. On December 20th, about 17 days later, the health department, we put out a public health alert that due to the rapid rise in COVID, all people should mask in indoor public spaces and that businesses and organizations require that. We did that because of the alarming rise in hospitalizations. They had risen from 53 to 95 in that time span, nearly doubling. And we anticipated continued rise due to entering the worst of cold and flu season and the holidays. And indeed, that situation has gotten worse since then. On December 30th, our situation had continued to worsen, with hospitalizations more than doubling again to 193 and a case rate that had skyrocketed to 124.6 per 100,000 per day. In response, county executives Stuart Pittman put into place, starting on December 31st, an indoor masking requirement. On January 4th, earlier this week, Governor Hogan declared a state of emergency and a catastrophic health emergency that will last for 30 days in response to the increasing number of hospitalizations in the state, as the number of those hospitalized has exceeded 3,000 for COVID. Our previous high statewide had been 1,900 for COVID. And with that 3,000, it continues to grow. Some data for you, just to contextualize this. In the period from December 5th to January 5th, that 1 month time span, we've seen hospitalizations for COVID increase from 53 to 236, a 345% increase. We've seen ICUs for COVID go from 11 to 37, a 245% increase. Case rate has gone from 22.6 to 167.5, a 641% increase. Our percent positivity has increased from 6.17% to 30.32%, a 391% increase. We've had 59 deaths in the past month compared to 25 the prior month, a 136% increase, and deaths lag hospitalizations. We anticipate seeing many more than that. Our 7-day average ICU occupancy has increased to 86.4%, up from 69.9%. Well above the 70% occupancy threshold. Anne Arundel Medical Center has declared a crisis standard of care. Baltimore Washington Medical Center has declared a crisis standard of care. The effect is that people needing care are deferring care. Hospitals are postponing urgent surgeries to care for those with COVID. And while the people who are admitted for COVID are both displacing others from needed care, it's not one-to-one. The total volume in the hospital is increasing. And there aren't more staff to get. We just keep asking more of our current staff. And while the governor has put into place some relaxations to increase staffing, that is not going to be enough. We also have to prevent people from getting hospitalized. Right now, between 65 to 70% of the people who are hospitalized are not vaccinated. About 30% are vaccinated but not boosted. It's less than 5% of people who've been vaccinated and boosted, and they tend to have significant chronic disease. Fundamentally, hospitalizations are largely vaccine presentable. And what we're seeing is that while the decision to mask or vaccinate may be an individual one, we have to acknowledge that each decision has a collective impact. And so if you don't get vaccinated, you're at greater risk of being hospitalized or even dying. When enough people don't get vaccinated or boosted, the collective impact is that they overwhelm our hospitals. That affects everybody else. And when a person doesn't mask, they increase their own risk of getting COVID. But they also increase the risk to others because they could transmit it as well. That affects others. And that's why we're here, is we're talking about taking collective action. We've been aggressive in promoting and making available the vaccine. We have the second highest rate of vaccine uptake of any county in the state. We've been aggressive in providing at-home testing kits, and we lead the state in this effort. We have promoted mask wearing. We talked about monoclonal antibody treatment has been key, but 2 out of the 3 are not effective against Omicron, as Omicron grows to be the majority of the cases. And we're looking at an anticipated increase over the next 4 to 6 weeks in hospitalizations. And so we need time-defined measures to address the surge and blunt the impact on hospitals. Masks have been demonstrated time and again to be effective. There are numerous studies that are effective. Even against Omicron, masks are effective. Because Omicron is more transmissible, yes, we do need better quality masks. And more people need to mask to ensure that we are decreasing transmission. Mask mandates have also been shown to be effective in reducing transmission and hospitalization, above and beyond people deciding it for themselves. You know, honestly, if every single person wore a mask every time in public areas, we wouldn't be taking this issue up. But not everybody is, and our hospitals are being impacted. And when the collective impact of individual decisions ripples out, we have to take collective action. It's why I implore you to extend this masking requirement in public settings for a fixed period of time. Thank you.
Thank you very much. I know ordinarily this would be the time where my colleagues and I would ask questions, but because again, out of respect for the public that is here to testify, I would like to request that we hold questions until after the public testimony. I do see Ms. Hare's hand. Would you be willing to wait until after the public testimony?
Jessica Hare, District 7. Absolutely, Madam Chair. I just wanted to be sure that Dr. K will be available after public testimony.
I will.
Okay, then yes, absolutely.
Thank you. I appreciate that. All right. So we will now open the joint public hearing on bill numbers 6-22 and 7-22. Madam Secretary, do we have any testimony received from the public? Oh dear. Do we have any testimony received from the public?
Yes, Madam Chair, we received significant submissions of testimony through the online testimony tool, also phone calls, emails, and 1 or 2 letters. I want to begin by making an important note. All of the testimony has been shared with the council. It is still in the process of being organized so that we can provide that summary and post it on the website. Due to the high number of submissions that we received, I was unable to get it posted to the website before the start of the meeting. But I am prepared with numbers, so let me get to that. For bill number 622, there was a total of 1,491 submissions. For bill number 722, there was a total of about 270 online testimony submissions. If it would help the council, I have broken that out into the no position, opposition, and support, but those are the totals.
Madam Chair, would you share those numbers, the opposition, support, and no position?
Yes, Madam Chair. So
I'm elevating you.
Okay, I understood. Bill number 622, there were 9 submissions where the person chose no position. 352 submissions, the position of opposed or opposition was chosen, and 1,130 of those online submissions were support was selected. And again, that's for bill number 622. Jumping to bill number 722, we just had opposed and support. There were 91 submissions that were listed as opposition to bill number 722. There were 179 submissions listed as in support of bill 722.
Thank you, Madam Secretary. Part of the notes didn't print out properly on my notes here, so I actually don't have the total number of speakers, but I know that we have, I think, over 100 speakers today. Go ahead.
Sorry. I thought you were asking me to answer the question. My apologies. Because we have switched to the joint public hearing, I see about 120 people registered to speak. And we will begin going through those names. I will note, I do see we have about 150 attendees in our virtual waiting room.
All right, thank you, Madam Secretary. I just realized on my page, I don't know, the first person I have to testify is number 17. So
it's okay. There is, if the council, you do have access to some testimony sheets in the shared folder for this meeting. There is a Google sheet that is called Registered Speakers for January 7th, 2022. What I'm going to ask you to do is to go down to the bottom of that sheet. There's several tabs. The third tab says both bills, and that has all of the registered speakers in order of priority based on when they registered. And I'm happy to call those names out to help you, Madam Chair, but if you can see that, that might help too.
I found it in my Google Drive. So thank you so much for providing it in multiple ways. I don't know what, maybe this is an error with my printer just not working properly. So at this point, let's begin the public testimony with Mr. Jimmy Glenn. And as a reminder, all speakers have 2 minutes. Please state your name and address for the record.
All right. Hello, Council. My name is Jimmy Glenn. I live at 1614 West Bancroft Lane in Crofton. You know, I thought I had something prepared in my head, but then we just listened to 4 experts. I'm not an expert in, you know, any of this, but, you know, we just listened to 4 people say who have studied for years and years and years and have studied the data and have said, hey, let's extend this, you know, do the right thing. You know, it's crazy that this pandemic has become a partisan issue. And, you know, it's been really nice to see that this council, you know, for the majority of the things that come across this council's desk, do things in a bipartisan manner. So I just hope that, you know, based on the testimony of the doctors and, you know, the people that are at the forefront of this is what's really sticking in your mind, and not the, you know, misinformation that has been published out there time and time again from multiple different sources. So, you know, I just ask that this council do the right thing and keep the public safe, you know, and just mandate that people wear the damn mask. And that is all. Thank you.
Thank you, Mr. Glenn. Next up, we have Laura Calise.
Hello, can you hear me?
Yes, indeed. Go ahead.
Okay. Hi, Laura Calise, 12 Row Lane in Arnold. I am pleading with the council to continue the temporary masking order while we're in this emergency. It's an emergency that our hospitalizations in Maryland are now 50% higher than the previous high last winter and rising. It's an emergency that AAMC has enacted crisis protocols for the first time ever. It's an emergency that we now have so many cases that the law of large numbers has caught up to us. And now one of our school students, a 4th grader, has died of COVID. We need to get out of this emergency, and we don't get there by listening to loud contrarians who tell us that it isn't there. Studies and health organizations throughout the world, not just our local experts, have reached the same conclusion that masking works to reduce community spread, and it works best as source control and when it's universal. While people may complain about the burdens to their, quote, liberties, a truly free society has rights and responsibilities as well. Our individual choices can easily adversely impact the freedoms and choices of others, and this is abundantly clear with a fatal infectious disease. Masking is the best shot we have of fulfilling our obligations to our vulnerable neighbors, hospitals, and first responders while causing the least disruption to our lives, schools, and economy. Masking is not an undue burden. The undue burden is what our hospitals and first responders are facing. The undue burden is being hospitalized and unable to work. The undue burden is trying to run a business without healthy staff. We all wish the pandemic were over and there were no other disruptions, but this isn't reality. Wishful thinking isn't governing. You have a moral obligation to your constituents to operate in reality, even if it upsets them, even if they deny it. Have the courage to do your duty and look reality in the face, and please continue this temporary indoor masking order. Thank you.
Thank you very much. Next, we have Casey Breslin Murphy. You may unmute yourself and begin.
Sorry, I was washing a dish. So hi, yes, I am a resident in Savannah Park. I live in Chartwell, and I have 3 young kids, 2 of which are too young to be vaccinated. So I really appreciate this opportunity to speak, and I just want to speak out in support of both of these emergency pieces of legislation, because it's so important to the health of the vulnerable people in the community who are ineligible to be vaccinated, like my 2 children. Or that are under 5. Additionally, I am pregnant with my 4th child. My 3rd child was born during the first wave of the pandemic. I labored and delivered a large for gestational age baby wearing a mask. That baby this fall was able to wear a mask for the entire duration of his flu shot visit, which was a half an hour. So I really struggle to believe that it's, a really big hardship for people to wear a mask. But I am begging also, in light of the context of my experience delivering a baby while COVID negative during this pandemic, it's so important for those people that need care, because the healthcare providers have to put on PPE, and it takes time to get from patient to patient during this crisis. And that time and resources affects care tremendously. So please, I'm begging of you to please extend the mask mandate. The testimony from the doctors was extremely compelling. It sounds like most of the community has weighed in favor of extending the mask mandates. Nobody wants this pandemic to go on any longer, and this is a way that we can stop it as a community. We have an obligation to each other to abide by certain rules as part of a society, whether we like them or not. We don't always want to stop at a red light, but we do because it's the right thing to do. And I believe that mask wearing and extending this civil emergency so that you guys can continue to make choices based on what's actually happening is really helpful. So thank you all for your service to our community, and please extend the mask mandate. Thank you.
Thank you, Ms. Breslin. Ms. Breslin Murphy. And next we have Carrie Selner.
Madam Chair, we do not see Ms. Selner in the waiting room. Also, we have about 8 call-in numbers, and we cannot match any of those numbers to her registration.
Okay, thank you. Then we will move on to Sharon Larkin. And I believe she may not be here today as well.
It appears that Ms. Larkin canceled her registration.
All right, then moving on to Jenna Mondora. Ms. Mondora, you have the floor.
Can you hear me?
Yes, go ahead.
Thank you. This morning I'm testifying in support of proposed Bill 6-22 that it was passed will return the mask mandate in public spaces in Anne Arundel County. I should add I'm at 1009 Shore End Drive, Crownsville, and Arden. The past 2 years have been difficult for everyone, and many are growing tired of this pandemic. However, when we look at the data in hospitals, specifically in Anne Arundel County, we have to recognize that actions need to be taken. Our hospitals are overwhelmed, and many in our county are so vulnerable to COVID-19, including my 2 young children, one of which is immunocompromised. I loved how Dr. Marcosi put it earlier that these children and people are not just data points, they're humans. We can't expect our overcapacity hospitals to be able to manage other health conditions if their staff members are sick, ailing, or in isolation themselves. We have to take action to slow the spread while being mindful that we do the least harm possible. We're trying to keep schools open, businesses afloat, and give people a sense of normalcy. So we need to do something to maintain that. The simplest and least invasive way to slow the spread is by ensuring that people wear masks. If we don't slow the spread, we'll likely see more reduced business hours. I know my coffee shop already had some staffing issues, reduced school staff, and other outages. Pediatric hospitalizations are particularly heavy on my heart as a mom of 2. Pediatric rates are rising nationwide. Even if it isn't severe, a minor hospitalization can be traumatic. I've seen my daughter hospitalized for a different virus that you may know of, RSV, at just 7 weeks old, and it was terrifying. Anything we can do to limit the risks for our youngest children who can't manage their own is worth it. And just as importantly, when and if our youngest need care for COVID or any other situations, that their hospitals are equipped and staffed well enough to do so, because they're not as overburdened as they are now. I'm not asking for shutdowns or vaccine mandates. I'm asking for a simple yet effective face covering that will help us slow down the spread of COVID-19, buying us more time. Thank you.
Thank you, Ms. Mondora. I need you to wrap up. I appreciate your testimony. All right, going on next, we have Allison Durbin. Ms. Durbin, you may unmute yourself and state your name and address for the record.
Hi, can you hear me?
Yes.
My name is Allison Reisinger Durbin. My address is 422 Forest Beach Road, Annapolis, Maryland 21409. And I live in District 5 with my family. And first, I actually ask that you heed the medical experts' advice that we have heard for the past hour and 20 minutes, because I'm a PhD student at the University of Maryland, but we just heard experts who have spent their entire lives and careers studying this virus and stopping the spread. But I am speaking in favor of extending the mask mandate, Bill 622. I have a 10-month-old child that you hear in the background who's too young to be vaccinated. And because of this, my husband and I always stay at home with him to protect him from community spread. And with a mask, we would be able to go to the grocery store or run an errand or have a peace of mind. Right now, we're extensively in lockdown again, trying to prevent his possible contraction of this deadly virus. And it can be prevented if you fight with us, as Dr. Marcosi said earlier, by just wearing a simple mask. I also labored for 33 hours in a mask during the height of the virus last February. And if I can bring a child into this world wearing a mask, we can wear a mask when we go to Sam's Club. Thank you so much.
Thank you very much. Next, we have Bonnie Fitzpatrick.
Hi, I'm here. Can you hear me?
Yep, go ahead.
Hi, my name is Bonnie Fitzpatrick. I live at 1043 Situate Harbor in Pasadena, Maryland. I'm not in favor of the mask mandate because, for one, most people speaking today seem like they're stay-at-home moms. I work with the community at a local tavern, and this last week has been nothing but awful. I've had things thrown at me for asking somebody to put a mask on. I've had to call the police, have somebody taken out of the bar because they wouldn't wear a mask. And it's just troubling. I wish one of you guys will come in and work with me one day and see how the mask mandate affects us that are working with the public. I have to wear it for 8 hours, but if they come in and sit down and have a drink, they don't have to wear it, but they're sitting right next to someone else. That makes no sense whatsoever. I can see wearing it in the grocery store, yes, wearing it in hospitals. But when you're out eating or drinking and the person waiting on you has to wear it, but the other people don't, who is that helping? It's helping no one. And then when you're sitting there constantly arguing and policing people, it keeps me from doing my job. And then when people start to leave or I have to force people to leave, we're losing money. We can't make a living. It's almost like we're in lockdown again. If Mr. Pittman would like a mask mandate, then I suggest he send someone in to work and mask the people and police them, not us. I'm not a police officer, not someone's mother. I shouldn't have to tell somebody, put the mask on, put the mask on. Then I'm getting cursed at and yelled at. And on another note, most of these people asking for the mask mandate are hypocrites. I've seen them out in public without their mask. It's okay for them to not have a mask, but they want us to wear one. And another thing, staffing shortages at the hospitals are because they were mandating nurses and doctors to get the vaccine. And that's why we have a shortage and so much trouble in the hospitals. Not everyone is going to get the vaccine. Not everyone's going to wear a mask, but forcing small businesses and people who work at these businesses to police other people, adults, to wear a mask is ridiculous. It's not safe. It's not fair to anyone. We're losing business day by day. This week, I have lost so much money having to tell people to put masks on that don't want to put masks on and then being yelled at and screamed at. And then when I have to call the police because someone won't leave.
Patrick, I need you to wrap up your comments.
Okay. But having to call the police because someone won't leave the premises is another emergency that's being used in my car instead of helping somebody on the road that might need a police officer. I don't believe in the mask mandate, especially in eating and drinking establishments, because I have to wear it, but they don't as long as they're sitting down. The virus must go away when you sit down because you can take your mask off.
Thank you, Ms. Fitzpatrick. All right, our next person is Mr. Russell Ryle.
I am scanning the list here. We do not have that gentleman by name in our waiting room, and I cannot match any of the telephone numbers to him either.
All right, then we will move on to Jeffrey Stramella. And go ahead.
Hi, good morning. I am opposed to extending the mandate, Bill 622. So when COVID hit, governments panicked, created fear. The CDC actually still estimates a survival rate of 99.997% for people younger than 50. The damage created by this panic was too much to undo. The masks dehumanize and demoralize us. They serve as a constant reminder that we should be afraid. They have become a cruel device on young children everywhere, feeling isolated and struggling to understand social expressions of their friends, and they're causing harm to the American psyche. The masks had issues from the beginning. The U.S. Surgeon General and CDC both previously stated they are not effective in preventing the general public from catching coronavirus. That's a quote. They were already starting with credibility issues. Many officials throughout the country, including several occasions here in Maryland, were frequently caught without masks when they think the cameras are off. Even the always right Dr. Fauci has been caught several events on several occasions. Governor Tom Wolf was caught off camera laughing about masks and said, quote, "It's an act of political theater." He was one of the strictest enforcers of masks since 2020. This type of misrepresentation is exactly why this should be left up to the individual, not our local government. California required masks in June 2020, and then again several months later, and cases still climbed over 300%. As we all know, Hawaii was hit with one of the most strict lockdowns of the US, mandating masks indoor and out first, but still cases rose over 1,000%. Our use of face coverings is closer to medieval superstition than it is to science. All in all, this is a virus. They don't just disappear. We must learn to live with it. In the end of this, it will be the loss of the credibility in our scientific institutions and unnecessary division they've created among us, for which we will remember these masks. Thank you all for your time.
Thank you, Mr. Stramella. Next, we have Terrence Byrne.
Good morning, and can you hear me okay?
Yep.
Thanks for taking my call. So yeah, the last two callers, I'd definitely like to echo their sentiments as well. I stand in opposition to this measure, although I support the council's meetings to, kind of take the driver's seat away from the county executive. I think that's a good thing. However, these masks need to go. We do need to live in the reality. The reality simply is that we're all going to get Omicron. It's so ridiculously contagious. I think all the data that any of the experts are going from is probably for maybe the original coronavirus or even some of the, the other pathogens that float around, like a common cold or your flu. And I think, sure, for the flu, I think the masks might be useful, but not for something like Omicron. It's so ridiculously contagious. We're all going to get it. All of us know people who are fully vaccinated, who mask, who double mask, whatever, and they've caught it. We're all going to get it eventually. So what's the point in masking? Is it going to slow the spread again? Probably not. It's just going to be, it's going to be more than an inconvenience. I echo the sentiments about the previous callers. And it's just, ultimately, it's not going to do what it's supposed to do. Also, I think that the mask mandate, it really does push people against each other in a way that's not helpful for our society. The story that comes to mind is the Pennsylvania Dutch market over in Laurel. It was in PG County. They had to shut it down. Why? Because they still had the mask mandates over there. And the Amish were apparently not compliant. The Amish, I mean, my goodness, if you are persecuting the Amish for not wearing a mask, you have lost the plot. So I urge you, please, this is nonsensical. Please vote against this. Thank you.
Thank you, Mr. Byrne. It appears that Mr. Ferris is not here. So is that correct? Okay, we will move on to Ms. Cheney. Go ahead.
Hi there. My name is Anna Cheney. I am a CFNC certified functional nutrition counselor. I appreciate the opportunity to speak today. I'm trained by the Functional Nutrition Alliance, which teaches the Cleveland Clinic's functional medicine protocols, which address the root causes of symptoms, illnesses, and disease. I honorably request that you consider the perspective of educating the masses for the prevention of illness and hospitalization. My certification requires continuing education. I spend hours and hours poring over current random controlled studies, and I agree that people are looking for solid information and guidance from their leaders. The current threat is the lack of knowledge of how to care for one's immune system. We're not in a fight against COVID. We are victims of ignorance as how to properly care for and boost our innate and adaptive immune systems. We need positive, clear healthcare leadership as to realistic and doable strategies to keep people out of the hospitals. When we instill fear into people, decisions are made with our reptilian brain as in fight or flight instead of the prefrontal cortex. When we supply scientifically proven strategies to fortify the human body's optimal physiological function, we enhance the body's natural immune system to perform the way it was meant to. Stress is our number one killer. I suggest that the way we are forcing one strategy only and the fear, shame, and blame encourages more stress, anger, frustration, which increases morbidity and mortality due to any illness. Immunity, we have innate and immune adaptive systems. When we are exposed to an antigen, our immune system launches a process in which antibodies are produced. Once we have recovered, our immune system does not continue producing the antibodies, and therefore it is expected that the antibody presence decreases. However, our adaptive immune system is now informed, armed, and ready. Natural immunity works exactly as it was meant to. So here are some government provided statistics. VAERS reported vaccination injury is known to have 1 to 10% of all adverse effects reported. Today, there are over 21,000 vaccination deaths and over 1.5 million vaccination injuries. And going on the conservative side, at 10% reporting, this would equivalent to over 210,000 deaths and 15 million injuries. On the liberal side, that would equate to 2.1 million deaths and 150 million injuries just in our country. Why are we turning our heads to this? Pardon me?
I need you to conclude your remarks. Your 2 minutes have expired.
Okay, my concluding remarks are teach and lead people offer scientifically proven choices, which include D3 oral nasal washes, which could have prevented about 85% of the deaths from COVID, according to epidemiologist Dr. Peter McCullough. I hereby respectfully request that you vote against mask mandate, educate people, and allow them to make educated choices and decisions to keep them out of the hospitals. There's not one only strategy here. We have many strategies that are scientifically proven right now, current. Happy to send that information. Thank you so much. I really appreciate your support.
All right, next up we have Chikaori Okoro.
Can you hear me? Good morning.
Yes, go ahead.
I live at 775 Elmhurst Road in Severn, Maryland. This morning, I'm in support of the mask mandate. My kids, I have 2 kids, 5 and 8 and 10, both fully vaccinated since December. My husband works in law enforcement, and I'm begging you, because I've listened all morning. I set my alarm and I listened all morning. I listened to the experts, and I know deep down, and I know that people keep saying you have the vaccine, you don't get COVID. It helps your immune system. It introduces the antigens to your immune system so that they know what to fight against. So please extend the mask mandate. I have a 2-year-old niece. I have, my husband on Christmas Day got COVID. Since Christmas, we've been locked down indoors because he had COVID and he hasn't gotten a negative test. So we've been indoors. So please, I am begging, I am in support, because I know that Max, because for me, because of Max, he tested positive and we are all negative in this house. This is the second time that I have been able to prove that Max do actually help, because my sister was with me. She got COVID and I didn't get COVID. So please, and while we argue about the semantics of masks, let us please bear in mind those people who are working, who are over fatigued at the hospital, the healthcare workers. My mom is one of them, who are so perpetually tired. If we keep playing politics with the masks, what about them? They have families too that they need to get home to. A 12-hour shift is not a joke. They have families. I know that, but wearing a mask is not that big a deal. As opposed to what would happen if I have a friend who lost her husband. I know a lot of people who have died and they're all healthcare workers. And we have a crisis, and then we can't put on a mask. Like the governor says, please wear the damn mask. Thank you.
Thank you, Ms. Okoro. All right, next up we have Natalie Benjamin. Ms. Benjamin, you may unmute yourself, state your name and address for the record. Go ahead.
Hi, can you hear me?
Yes, indeed.
Okay. Good morning. My name is Natalie Benjamin. I live at Bay Hills Drive in Arnold, Maryland. I'm here to speak against the passage of Bill number 6-22. The request that masks be reinstated based on data from December 27, 2021. Luminous Health reported that it has experienced a 325% increase since December 1st of 2021. This data is insufficient to provide an overall picture of where Anne Arundel County stands in managing COVID. According to an opinion piece that appeared this week in Annapolis, this brings us to hospitalizations. On December 30th, 2021, despite 300% increased cases from last year, COVID patients occupied 191 hospital beds in Anne Arundel County out of 634 acute care beds. That's about 30% statewide. COVID patients occupied 2,454 of the 7,123 beds, about 35%. In other words, 65 to 70% of hospitalizations are non-COVID, and we have 10,300 beds available statewide. Yes, hospitals are crowded and staff is working hard. This happens during winter. A 2018 Time magazine headline read, "Hospitals overwhelmed by flu patients are treating them in tents." Masking is a Band-Aid. It has not considered the other options for treatment. Such treatment as described by Dr. Ron Elfenbein, the medical director and CEO of First Call Medical Center in Gambrills, Maryland, who, according to an article by Paul Best, said he had to cancel potentially life-saving monoclonal antibody infusions for about 250 people over the last week after the federal government stopped distributing treatments by Regeneron and Eli Lilly because they aren't effective against Omicron, even though the Delta variant, which the drugs are effective in treating, was still dominant at the time. Mask mandates in Prince George's County and Montgomery counties reinstituted indoor mask mandates on August 8th, and as of December 29th, their 7-day case rates per 100,000 were 198 and 142 respectively. Anne Arundel County with no mask mandate was significantly lower at 124. I'm sorry?
I need you to conclude your remarks. Your 2 minutes is expired.
We need to get through this surge hurdle and allow for herd immunity. I'm hearing the same Band-Aids being repeated. Masking, social distancing, etc. I implore masks to remain a personal choice and to encourage health preventions, and to give the public their sense of autonomy and to make their decisions based on assessing their own risks, as we have throughout all respiratory pandemics and epidemics, most recently the H1N1 pandemic prior to COVID. In all things related to health, it should remain a personal choice to do what is.
Your time has expired. All right, our next speaker is Lena Stennett.
Madam Chair, this is another, I do not see the person in.
Okay. And William Dusold, also not present.
I'm sorry, the next name was?
William Dusold, also not present. Appears not to be here. No, okay. Going on to John Morrison.
No, Mr. Morrison, I'm afraid.
All right, going on to Amanda Burrows.
We have someone who's here we have just an Amanda. We have a couple of Amandas. So I think we'll check in with the Amanda with no last name to see if that is Ms. Burrows.
All right. Oh, wait.
Hi, good morning.
Are you Amanda Burrows?
I'm Amanda Gormley.
Okay. We're on a different Amanda. We will get to you. I don't know where you are on the list, but we'll get to you when we can. Mr. Joseph Clapsaddle.
My name is Joseph Clapsaddle, and I live at 705 Rossack Court in the city of Maryland. I am in favor of this council accepting a difficult responsibility of leadership in extending the mask mandate and also in the state of emergency. I'm not going to take up your valuable time by going into my reasoning behind this, other than to say that I believe in the science that we are being given, and I think we have to trust that science. There's nothing that's certain in life. So I urge you to search your conscience and to vote in the affirmative for both of these initiatives. Thank you.
Thank you, Mr. Clapsaddle. Our next speaker is Ryan McDonald.
Hey, good morning.
Go ahead.
I'm testifying. I'm not in favor of the mask mandate. The reasons why is the Anne Arundel County Council does not have the power to mask mandate the whole county. People will not comply with the mask mandate. They've already tried it with the vaccines. People are not complying with the vaccines. You should be worrying about the effect it has on the school children. You guys can't even provide soap in public schools right now. It's horrifying. The governor understands that he can make a mask mandate. That's why he didn't do it. You guys also did not have the authority to do it. That's all I have to say. Thanks.
Thank you, Mr. McDonald. Next, we have Doug Shade.
Hi, my name is Doug Shade, and I live at
on Holland Road in Severna Park. I'm a mechanical engineer and I have supported the Navy for over 30 years. And I like to think that I'm able to see the big picture. I urge everyone to support a mask mandate. If you're not supporting a mask mandate, you are suffering from tunnel vision. We've heard from the doctors, the experts, yet you ignore them if you're against the mask mandate. There are people, vaccine or not, antibodies or not, who will not survive because of getting COVID. I'm a diabetic who takes insulin and a kidney transplant recipient. I take medications that suppress my immune system. Like a lot of people, if I get infected by the COVID virus, chances are that I will not survive, and my family who depend on me will suffer. The Omicron variant of COVID is extremely transmissible. People can be carriers of the Omicron variant and never show any symptoms, ever. A mask mandate is an easy fix that anyone can do to prevent the spread of COVID. If you are against the mask mandate, then you are ignoring the needs of our entire population. So please think of everyone in Anne Arundel County and vote yes for the mask mandate. Thank you, and God bless America.
Thank you, Mr. Shade. Next up, let's see. I have Curtis Kingsland.
Yes, good morning. Can you hear me?
Yes, go ahead.
Okay. Good morning and a happy new year to all. My name is Curtis Kingsland, Owington, Maryland. I'm in opposition to Bill 622 and Bill 722. We all know of the difficult time we are living in, but setting aside the fear, the uncertainty about the future, here's my response to stop the CE from the mask mandates and lockdowns we had over 2 years. My thoughts are from an epidemiological viewpoint and a viewpoint of virology. Both of those sciences tells us that COVID went down in July 2020, has been down since, and herd immunity by those two sciences and metrics and data shows that herd immunity was July 2020. Number two, the death rate of just COVID deaths over the past 2 years is 1.5% for the total population of America. Number three, the number one killer in Maryland this year and the past year is cancer. COVID was ranked number 4. Number 4, Governor Hogan stated recently that the vax mandate in Maryland is around 92%. If you add natural immunity antibodies of people who got COVID and survived, it's probably around another 5%. If you add that together, it shows that the vaccines, either they do work or they don't work, or they're being taken care of. Number 5, shortages of health professionals is probably because one of the reasons many of the health professionals had didn't want to get the vaccination, so they quit or asked to leave. That is one of the problems of the hospitals in Maryland. Number 6, hospitals keep a high occupancy rate. That's to keep the Medicare, HMO, Fed, and state money coming in. So if they have 100 beds and they only have 80 filled, they're losing 10. Well, I could say more, but I see that my time's up. I highly just, well, 2 things. My final point, masks do not stop COVID, maybe the flu we have right now. I highly suggest that the county council do the right thing and vote on both bills and do not give the CE authority to reinstate these mask mandates. Thank you. And I still have a lot to go, but that's the best I can do. Thank you. Happy New Year.
Same to you. Thank you very much. Next, we have Sherry Owen. Ms. Owen, you can unmute yourself, state your name and address for the record, and proceed.
Madam Chair, we do have two Sherry Owens, so we may just need to try the other one out here.
Ah, okay.
Can you hear me? Can you hear me? Okay, thank you very much. My name is Sherry Owen. I live at 1327 Yorktown Road, Annapolis, Maryland. I believe it's time to end the mask mandate for good. We've been wearing masks, social distancing, avoiding family gatherings, been vaccinated, and we are still battling the same pathogen. Albert Einstein said that problems cannot be solved with the same mindset that created it, so it's time for a different way of looking at the issues. Masks are porous, so we can breathe through them, but virus particles are even smaller and pass right through. To wear a mask that blocks out even more air, such as an N95 mask, for an extended period of time is detrimental to our health. A healthy person has no need to wear a mask, and a sick person should not be breathing in the same infected particles over and over again. It can actually increase the chance of contracting a virus because it is trapped in the material and can cause infection when inhaled. From my research, there is no clear proof that wearing a mask is truly protective, but there is considerable amount of evidence that doing so can be harmful, such as bacterial pneumonia, low blood oxygen levels, labored breathing, cavities, and skin issues. As stated in the Los Angeles Times newspaper reported on August 18, 2008, researchers determined that the vast majority of deaths in the 1918 flu epidemic were actually due to bacterial infections from the masks. As a person who has been healthy during this whole time, I have something to share. Number one, prevention. Supplements. We are not getting the nutrients we used to get in our food. Vitamin C, D, zinc, and quercetin. Dr. Vladimir Zelenko created the COVID protocol, which includes these supplements. He has had great successes and has developed an all-in-one pill that is called the Z-Stack that can be taken to get these nutrients into our body. He is one of many, many doctors who have shared this information. Number two, treatments. Ivermectin, once feared, is now a savior. The study that damned ivermectin has been retracted. There are currently 138 studies on this, proving its efficacy, and it has been proven safe for treatment and prevention. I know of many people who have been treated this way, and they have had amazing results within hours of treatment.
Ms. Owen, 2 minutes has expired. Please conclude your remarks.
Okay, this new variant has been reported to be even milder than the last. Worst case scenario, many people contract the milder version and develop antibodies and natural immunity. Thank you so much for your time. I appreciate it.
Thank you very much, Ms. Owen. Next, we have Mark Mazer. Or I guess we don't have Mr. Mazer. All right, then I see Megan Breslin on the screen. You may proceed, Ms. Breslin.
Good morning. Can you hear me?
Ms. Breslin, I think you have two devices. You want to turn one off.
Fuck, Joe. Fuck, I lost it. Can you hear me?
We can hear you.
Oh my God, sorry. Good morning. My name is Megan, and I am a mother of 3 young boys and a healthcare worker. This is my first time getting involved in something like this. I am here to tell you that 2 things can be true at once. 1, COVID is harmful to the elderly, obese, and immunocompromised. And 2, government mandates are wrong. Please stop the mask mandate. The mandates have nothing but caused issues with young children and statistically have done nothing to stop the spread anywhere on earth. Cloth masks were recently referred to as face decorations by Dr. Wen on CNN. It is disgusting watching national and local politicians enjoy their lives mask-free while still trying to enforce rules on kids who are powerless. Let a mask be an option that a free American can choose, not a mandate that a politician dictates. Let us, as individuals, parent our own kids. This is not your job. Leave the children alone and leave me alone and let my children be kids again. Facial expressions are an important part of development. Teaching children to be afraid of something that is statistically less harmful to them than bathwater, RSV, or riding in a car is unhealthy. Stop trying to cover up my face and my children's face when our risk is minimal. You said 2 weeks. You said until the elderly and immunocompromised are vaccinated. It's clear by now that vaccines do not stop the spread. How does this end? You have no exit plan. Thank you.
Thank you, Ms. Breslin. Next, we have Jennifer Claggett.
Madam Chair, I'm so sorry to interrupt. I just want to make a point. We need to, we cannot have profanity. We are going out over cable and it would does violate FCC rules.
Thank you for that reminder. So even if you think you're not on air, you might be. So be mindful of your language. All right, Ms. Claggett, you may proceed.
I'm sorry, I'm quickly scanning the phone. Oh, there we go. Okay.
Ms. Claggett, you can unmute yourself and go ahead, state your name and address for the record.
Ms. Claggett, you need to unmute yourself. If you are on another device, you can try *6.
Oh, okay. Can you hear me?
We got you now. Go ahead.
Okay, thank you. Jennifer Claggett, Annapolis, Maryland. According to the analysis from a study conducted by a scientist from the U.S. Army Institute of Surgical Research in the Brooke Army Medical Center, JBSA, Fort Sam, Houston, Texas, the Uniformed Services University of the Health Sciences, Bethesda, Maryland, the Madigan Army Medical Center, Joint Base Lewis McChord, Washington, the 2nd Brigade Combat Team, 4th Infantry Division, Fort Carson, Colorado, and the 121st Field Hospital, Camp Humphreys, Republic of Korea, mask mandates did not reduce deaths, patients hospitalized in either intensive care or regular hospital beds or ventilator use. In addition, there was no reduction in per population daily mortality, hospital bed, ICU bed, or ventilator occupancy of COVID-19 positive patients attributable to the implementation of a mask wearing mandate. The cloth mask that everybody's wearing, right on the boxes, they will tell you that it will not prevent the transmission of COVID-19. I also object to people calling these COVID shots vaccines when they neither prevent the catching or spreading COVID, and it is not a durable, long-lasting protection. It does not sterilize the virus. So at best, they are a therapy, and they're experimental, and they already in the VAERS database, they have nearly 1 million severe adverse reactions to the vaccines, including thousands of deaths. The people that need to be concerned are basically people who are over 80 in nursing homes, and statistically people of under 60 really don't have anything to worry about. I don't see any point in having any masking anywhere, and I do not support the extension of any emergency executive powers.
Minutes has expired. Please conclude your remarks.
I'm done. Thank you.
Thank you very much. Next speaker is James Zimmerer.
Can you guys hear me?
We got you. Go ahead.
Good morning. First, I'd like to thank everyone for taking the time out of their day to meet with everyone. Very long day for you guys, I could imagine. Second, I'd like to thank the military, first responders, and educators during this time. These are the folks that kind of help pull us through these difficult times these last 2 years. Next, I'd like to move on to choices, and there's freedom of choices. One, I am vaccinated. Two, I do support N95 masks. But the reason I touch on these choices, when I joined the Marine Corps and went on 2 combat deployments, I came back with not only a greater love for my country, but a greater understanding of what that freedom really represents and what it really means. The ability to make a choice will always be more important than the choice itself. That's what we come from, that's what we represent, and that's who we are today. Moving on, when Dr. Marcosi, Dr. Meisenberg, and Dr. Vanessa spoke, excellent points, valid points as well. But they touched on points such as reciprocation of duty. Civilians didn't swear an oath. Medical professionals did. We did not. 3, we talk about preventing diseases. I have not heard one local, state, or federal official touch on the importance of being healthy during these times. The #1 comorbidity in COVID is being obese. We're not touching on that at all. They say you listen to the experts. Well, most experts can agree that only N95 masks work. You mentioned when you started this meeting, we can't afford N95 masks. We don't have those resources. So I can wear a bandana and everything's fine. Lastly, counties don't have the legal authority, experience, or resources to make these policies or carry out these policies throughout the county. So I think today, again, I appreciate the time, but no matter what the vote is, it just doesn't make much sense for myself or other constituents as well. But if Bill 622 does pass, I'm definitely in big support of 722. County Executive Stuart Pittman is overstepping his bounds when his own governor comes out in the very same county in his same backyard and does not.
Mr. Zimmer, your time has expired. Please conclude your remarks.
I've included, again, I'm opposed to 622, but if it is passed, please pass 722 as well. Thank you, ladies and gentlemen, for your time today, and best of luck.
Thank you very much, Mr. Zimmer. Next, we have Gina Witcher. Is Ms. Witcher present? No, okay. Then we will go on to Matt Minahan. No Mr. Minahan either?
Looks like next we have maybe Greg Mill.
Oh my goodness, we're all of these. Oh wait, there's Matt.
Yes, hi, sorry, good morning.
Good morning.
My name is Matt Minahan. I live at 3651 First Avenue, Edgewater. I strongly support both bills 622 and 722. The arguments against masks are fiercely held by otherwise honorable people. Arguments like they don't work, leave me alone to make my own decisions, they make me sick and give me cavities by recycling my own germs, and citing one-off research studies that are neither peer-reviewed nor replicated. But these arguments are wrong. Masks are not just for self-protection. They protect you from my virus and protect me from your virus. What's the point at which your right not to wear a mask trumps the community's right to be safe and healthy? In Star Trek terms, we're talking about the needs of the one versus the needs and rights of the many. That's what we ask government to do for us, to protect all of us from the tyranny of individuals who would harm or infect us. And on the extension of the civil emergency, it's been dismaying to see how many times a motion has been raised by this council to rescind this authority over the past year. Fortunately, all of these motions have failed, but sadly, exclusively along party lines. This morning, you have the opportunity to do better. If there ever was a time for citizen legislators to find common ground around the health and safety of its citizens and to follow the guidance of the health experts we heard this morning, this is that time. Prove to all of us that you are public servants and citizens first and politicians second. I ask the council to rise above the partisan noise in the county and the country and to vote unanimously to approve both bills 622 and 722. And thanks to the council for this hearing and for calling these experts and hearing from all of us on this.
Thank you very much, Mr. Minahan. Next, we have Millie Bowers.
Good morning, and thank you very much for allowing me to speak. I'm Millie Bowers, and I live at 411 Hamlet Club Drive in Edgewater, Maryland, District 7. And I'd like to request all members of the council to focus and to be aligned with our communities of Howard County, Baltimore City, Prince George, Montgomery, and Frederick, as well as what Governor Hogan says is to wear the mask. I'm in favor of you folks stepping up and voting yes for Bill 6-22 and for the State House 7-22. Thank you very much for this opportunity, and I'm looking forward to seeing the outcome. Thank you.
Thank you very much, Ms. Bowers. Next, we have Brenda Molden.
Madam Chair, I'm not seeing that name. I think we need to, oh, never mind, actually, sorry.
Ms. Molden, you can unmute yourself and proceed. Ms. Molden, there you are. There you are. You may proceed.
Good morning to everyone. I'm sorry, I'm kind of new at this thing, but I thank God that I was able to get that email. And I do vote for bill number 622. I am a daycare provider. I live in Glen Burnie, Maryland. We fought COVID over and over and over, and we won until some people, and I'm not, harping on anyone, until I saw relaxation. And just this past week, my husband and I both had COVID. I had COVID and the flu at one time. My husband is a retail worker, and I believe that he got it from that. I believe, that's my opinion. And I'm free from it. We're doing well. But I do support this bill, and I support Joseph, that he said that we're not certain of anything in this life. But one thing I do know, that COVID is real, just like God is real. And we need to do whatever we can do, supporting all the data that we have to support this COVID-19. And I just thank God that none of my daycare kids, which are from the ages of 8 down to 3 months, did not get COVID. But I got COVID, and I did not get it from them. I got it after Thanksgiving, and I had to close down this week and last week because of COVID, because I cannot give it to my children. So I do support this, and Godspeed to all of you, each and every one of you, because just like Joseph said, we're not certain of anything, but we can do what we can do to support wearing the mask. Thank you.
Thank you very much, Ms. Molden. Next, we have Sean Tavalozzi. Trying to remember how you pronounced it last time.
It's no worries, no worries. Thank you. You can hear me, right?
Yes, go ahead.
Okay, Sean Tavalozzi, 1203 Ellicott Avenue, Churchton, Maryland. With all due respect to Dr. Makazi's testimony and others like his, they are the exact reason why the nearly 30% of unvaccinated Marylanders remain that way. And for the record, I am vaccinated. Vaccinations work. What do we need protection from? What you should be telling the vaccinated is to go live life without fear, because they have extreme protection from hospitalization and death. If you want people to get the shot, change the narrative to one that shows the vaccines work, and stop telling vaccinated they need to live like they're not. I quote Governor Jared Polis, Democratic governor of Colorado. COVID-19 emergency is over, and it is the unvaccinated's own darn fault if they get sick from this deadly virus. When officials say patients to describe those who need care and the overload it brings, it is misleading, because that word includes a massive amount of people who are asymptomatic and just have mild symptoms, rushing to the ER for tests out of panic. And our elected leaders' communication strategy is partly to blame. According to numerous local reports, hospitals are not only frustrated, they are begging people to stop going to hospitals for testing under these conditions, which will leave hospitals in a much better place to care for sick. Also, the short staffing due to resignations and firings of healthcare professionals because of vaccine mandates doesn't help. All the masks in the world will not fix this. For those with immune deficiencies, I feel for you, but COVID is here forever, according to Dr. Fauci. So should we just wear masks forever? May I suggest you take the proper health steps to protect yourself if you're that vulnerable, and not rely on others, because I promise you that is not in your best interest. Fellow Marylanders, if you are tired of constant government intervention in your life and addressing elected officials through laptops, listen up. If it maddens you that elected officials receive salaries while supporting draconian lockdowns, consider voting to replace them. You suffered unnecessary hardships in 2020. Bring that to the voting booth on November 2022. If we don't vote, we deserve every bit of this. And those that support masks, no one is telling you you can't wear one. Feel free to wear as many as you want. Thank you, and may God bless Anne Arundel County.
Thank you, Mr. Tavalozzi. Next up, we have Deborah Mullen.
Good morning, Deb Mullen, Annapolis. I shouldn't really have to add my comments, because the 3 doctors who spoke earlier should have convinced us all for the need of wearing masks. The question of personal freedom versus mask mandates seems quite simple to me. A person's personal freedom during a pandemic is not even close to being more important than the health, well-being, and safety of others. Wearing a mask is a small action that will have a great impact. This is all about the greater good. Until our citizens voluntarily wear masks, this body has the duty and responsibility to mandate mask wearing in all public indoor spaces. Thank you very much for allowing me to speak. God bless you all.
Thank you, Ms. Mullen. Next, we have Tamara Beeger.
Good morning. One moment. I'm moving to a quieter room. Okay. Good morning, County Council members. My name is Tamara Beeger, and I live in Odenton, Maryland. I would like to thank the health officials, doctors, nurses, and healthcare workers who are working so hard to care for and protect our communities. I stand with all of you, and I'm here today again to implore the County Council to vote yes to both of the emergency ordinances regarding the indoor mask mandate. I've listened to all our health professionals speak during this meeting, and the facts are clearly being presented here today. Our healthcare professionals have stated that vaccinations and proper mask wearing are the best protection against the spread of COVID-19, period. I'm not sure what else can be said after hearing such compelling testimony about the high risk of the spread without vaccinations and proper mask wearing, and the critical hospital overcrowding that is happening in our county. What I can say is that unfortunately many residents aren't vaccinated by choice, and I'm not talking about those who are unable to vaccinate. I'm talking about those who refuse to vaccinate despite the risk to themselves and our community. Therefore, wearing a mask indoors while in public is the least that our county residents can do to help slow and stop the spread and keep their fellow residents safe and healthy. Mask wearing is most effective when mask wearing is universal, where everyone is wearing masks together in public. We've heard the experts, the risks of COVID-19 are real, and we need to work together to slow the spread, to protect those unable to vaccinate and those who are vulnerable, our healthcare workers. We also need to protect our schools so that they can remain open. The school buildings can remain open for students to attend in person. So our students are healthy to attend school and our staff members are healthy to educate our children. Just as our hospitals are suffering, our schools are currently severely understaffed on a daily basis. Students are missing school and schools are reporting that they're continuing to see dramatic increases in reported COVID cases. They're in dire need of substitute teachers to cover all the staff absences, which we just do not have. All of this is preventable. Please put aside your partisanship and make the right decision to protect our communities, hospitals, schools by voting yes to both emergency ordinances regarding indoor mask mandates. Thank you.
Thank you, Ms. Beeger. Next, we have Melissa Angeles.
Hi, Melissa Angeles, 561 Norton Lane in Arnold, Maryland. We're almost 2 years into the 2 weeks of slow spread. Our children, families, and friendships have suffered. It's time for the government to stay in their lane and leave people alone with this reckless mandates that do nothing except create division and mass hysteria. The people in Anne Arundel County are smart enough and equipped enough to decide what is best for them. The government's job is not to protect the health of the people. We're seeing hospitals close and at capacity because of the fear of getting sick. I have family on the front lines. People are calling 911 and tying up the medic units because they got a positive test and are convinced they will die, instead of staying home and treating their symptoms. Anne Arundel County officials need to report fair and honest numbers when it comes to those hospitalized because of COVID and with COVID. We know for a fact that these numbers are being inflated to maintain control over the people. We are the government and we are here to help should be the scariest words an American ever hears. I urge the elected members of the County Council to exercise caution when voting to extend mandates and grant powers. Thank you very much.
Thank you, Ms. Angeles. Next, we have Monica Alvarado. Ms. Alvarado, you may unmute yourself and state your name and address for the record.
I'm so sorry about that. I may or may not be driving. Please don't report me. Okay. So Monica Alvarado, I live at 1732 Old Generals Highway in Annapolis. I am in favor of the mask mandate. I am speaking today as a mother, as a veteran, and probably most importantly to this discussion as a business owner. I own Bread and Butter Kitchen in Annapolis. We have had our mask mandate at my restaurant in place since the beginning and continue today. And I would encourage the council to consider the needs of the people who are working in the restaurants as well as other businesses that are open to the public. We feel safer with masks on in our restaurant, and we ask our customers to do that as well, and 99% agree, and also would like masks to be on. I think from my perspective, I've got 13 employees, all of whom are mothers with children in schools. Some are too young to get vaccinated. So as a matter of protection for us, the masks do work. I myself am fully vaccinated and boosted and have been wearing a mask since the beginning. And I have not had COVID. And I have had the unique opportunity to be on the front lines at food distributions through Feed Anne Arundel across the county. So if anyone in this county should have gotten COVID, it would be me, because I've been to people's houses delivering food who were positive with COVID, et cetera. So I do believe masks work. I do believe the science. I believe the doctors, and not all of these people who have called in with their opinions. And so I would urge you to listen to the 3 doctors who spoke at the beginning saying that masks do work. They are pleading with you to put that in place. And as a business owner and a resident and a mother in this community, I'm asking you to do the same for me. Thank you.
Thank you, Ms. Alvarado. Next, we have Heather Burlett. Ms. Burlett, you may unmute yourself and proceed.
Hello, this is Heather Burlett of Arnold, Maryland, and I'm speaking on my own personal opposition to both bills. I want to thank you for the opportunity to weigh in on our county, Anne Arundel County's rights and our freedoms at this time. The emergency powers take away freedoms and liberties that our country can't afford to give up at this time. I want to appreciate that we currently do have overcrowding in the hospitals, and like others have stated, we're aware that it is not simply limited to critical care of COVID patients, partially in effect, but also the reaction of fear that runs so many people right into the hospital, and also financial enumeration of the hospitals who report COVID cases. I'd like to appreciate the testimonies of the well-prepared opponents, having testified with actual sightings of qualified studies that have questioned effectiveness of masks. I find it very disconcerting that the experts, 3 doctors on our panel, and we did not have a single one that could present the other side of the argument. It's out there. The media is not going to give you both sides of that, unfortunately, but I want you to please keep in mind that many of our citizens are aware that the masks are not as effective as we are told, and that we are being encouraged to separate ourselves from one another and live in fear. I would ask you to be aware of what's going on in Australia. We aren't talking simply about, do we pass a germ? We are all, not a germ, excuse me, a virus. We are also talking about liberties. And I would side on the side of our liberties. The emergency powers have been very detrimental and frightening. And
thank you, Ms. Burlett. Your time has expired. If you would conclude your remarks.
That'll be fine. Thank you very much.
Thank you very much. All right, next we have Aslam Demiroglu.
Madam Chair, I just wanted to point out that Gina Witcher has, I think she had some technical difficulties. We just got a few people ahead of her. I'm not certain if you'd like to circle back.
Since I just called Aslam Demiroglu, I guess I feel like we should allow that person to speak, but then we'll go back to Gina.
Okay, and I'm not certain that that individual is in attendance. I'm quickly looking at phone numbers. I'm not seeing a match here. Yeah, I don't see any evidence of that individual being here in the meeting.
Okay, then let's go back to Ms. Witcher.
Thank you.
Ms. Witcher?
Okay, can you hear me?
Yes, we can. You may proceed.
Okay. So I would just like to say, yes, I agree with all the other individuals that are against mask mandates and just the powers to continue mandating this. It just seems like there's no end game. There was a 2 weeks of leveling the curve that has turned into mass hysteria. I know this doesn't have, we aren't addressing vaccines, but if we're talking about experts, there are, I could cite, and I've done a ton of studying on all this, about 100 experts that would be against masking or saying it doesn't work. It's just not, it's not on the box, like they said, it does not prevent the spread of COVID. I am in the school system. I was a teacher the last 2 years, so I was teaching part of it. Now I'm substituting. I'm in numerous schools and numerous classes, and I can promise you that there are no children wearing the masks the way they should. There's no amount of being able to force them or coerce them or whatever. They will be told by a teacher or a leader, it is down. It's cloth masks. It has come out that said that they pretty much are facial decorations. These kids touch them all day long. They are pulled down. They are, it's not something that can be regulated, and even in the school system. So we say we're protecting our kids. I promise you there is no protection whatsoever from any children. I feel like there are tons of studies against masks. I believe our Constitution, and I have many readings right here from Thomas Jefferson, just the reason our Constitution was written. Life and liberty and property do not exist because men have made laws. On the contrary, it was that the fact that life, liberty, and prosperity existed beforehand that caused men to make laws in the first place.
Ms. Fletcher, time has expired.
Yes.
Please conclude your remarks.
Okay, thank you. I think there should not be a mask mandate. As much as I respect what you guys do for the community, and I do not believe you guys have the powers invested by our Constitution to require, and it cannot be regulated. It cannot be enforced. So that's what I say. Thank you.
Thank you very much. Next, we have Karen Weiss.
Hi, can you hear me?
Yes, go ahead. It sounds like you may need to mute if you have a second device near you. You can turn off the sound.
I'm moving to another room. Does that help?
That should work too. Yeah. Thank you.
I am testifying today against proposed bill 6-22 and 7-22. There are many studies which have demonstrated that masks don't slow the spread of the virus, as the virus particles are smaller than mask pores. Wearing masks, especially with working out, forces the wearer to breathe in CO2, which should be expelled, to take in other unhealthy airborne debris. It blocks the flow of oxygen, generally counters any health benefit from a workout. Children are now showing slowed emotional development from masks, as they are unable to see and recognize cues from facial expressions. We also know from experience that masks and lockdowns do not work. Remember 2 weeks to slow the spread? This is a flu, and we need to get on with our normal lives. Masks are nothing more than political theater promoted by politicians and the media based on disinformation and misinformation, and used to create fear and panic. The sole goal of masks is to create a controlled and compliant populace. I moved to AA County from the inner city of Baltimore after living there for 40 years. Under this administration, I feel victimized by the same irresponsible, unresponsive, one-size-fits-all corrupt bureaucracy I left in the city. We have vaccines and treatments, which the government has been withholding, but which do exist, and there is no need to move backward. I do not want Stuart Pittman and his toadies to have any further ability to curb my civil liberties and destroy the economy and livelihoods with his command and control government. For all of us, vote against these measures. Thank you.
Thank you, Ms. Weiss. Next, we have Russell Leone.
Good morning, Russell Leone. I'm an elementary school teacher and president of the Teachers Association, and I'm encouraging and urging you to support Bill 622 to extend the indoor mask requirements. For nearly 2 years, TAC has asked us to follow the science. This morning, we heard some of those experts, because our students deserve safe and healthy learning environments. With AACPS currently reducing quarantine time in accordance with CDC guidance, masking along with vaccines is still our best measure for mitigating the spread of COVID-19. In addition, I want to point out that Anne Arundel County has not met an 80% requirement for vaccinations and a 14-day period of low community transmission that was set by the MSDE, our state education department, to allow schools to relax the masking requirements. In addition, we have over 50 schools currently experiencing cases of COVID, And AACPS has a school that's been at the top of the list for cases in all of Maryland schools. And we must continue to do what is safe for our students. We want to keep our schools open to provide the best learning experiences, and we must rely on the community to help us by also wearing face coverings. Our students will follow what is modeled for them. As an experienced educator, I can tell you that is true. And they are looking to see what we do when we are out in public and in these indoor spaces. So I please ask you to support the extension of face coverings in our county. Thank you so much.
Thank you, Mr. Leone. Next, we have Mary Grace Gallagher.
Hi, can you hear me?
Yes, indeed. Go ahead.
I am Mary Grace Gallagher. I live in downtown Annapolis. The experts who spoke earlier did a great job setting the stage for a mask mandate. Maybe all the talk of variants and dashboards, mandates, pathogens, isolations, quarantines, maybe we've lost track of what's at stake. It's easy to forget that what we are trying to avoid is an illness that floods hospitals to capacity with people drowning in their own bodily fluids. We have simple, cheap ways to avoid horrible deaths: masks and vaccines. We wear the masks for the children who can't get vaccines and for those who remain vulnerable despite doing what they can. I am grateful that we have city, county, and state leaders who have modeled good masking and vaccine behavior, and who acknowledge that despite it not always being popular to set down these rules about masks, the rules must be set and enforced so that powerless and vulnerable people don't get sick. And now it's up to this council to hold that rule in place. The language of the pandemic has become divisive, but really elected officials have a simple imperative to keep people safe. A mask mandate is a cheap, relatively simple way to avoid more horrible, unnecessary death. Thank you very much.
Thank you, Ms. Gallagher. Next, we have Hilton Nikithia.
I do not see any evidence of that individual in our waiting room, Madam Chair.
All right, and we don't have Mr. Albert either. Looks like our next speaker is James Packett. Mr. Packett, you may proceed.
Can you hear me now?
Yes, I can. Go ahead.
Okay. Why I believe there should be no mask mandate. The rebreathing of our exhaled air will, without a doubt, cause oxygen deficiency and a flooding of carbon dioxide. We know the human brain is very sensitive to oxygen deprivation. According to Dr. Marquise Disson, the neurons in our hippocampus cannot survive more than 3 minutes without an adequate supply of oxygen. Oxygen deprivation can cause metabolic changes that are vitally important for the cognitive functioning and brain plasticity, with symptoms of headaches, drowsiness, reduction of cognitive functions. Scientific evidence in total suggests masks as currently used are ineffective in reducing transmission. According to Professor Yvonne Croissant, quote, face masks do not function after 20 minutes of use. When they become saturated with moisture, they stop doing their job. Similarly, wearing a mask that has already been used is more risky than using a mask that's not been used at all. More risky than using no mask at all. The evidence is clear that not only are masks ineffective, but according to Dr. Russell Blaylock, face masks pose serious risks to the healthy. Now, what about masking children? What has been done to our children, according to Dr. Paul Alexander, is, quote, tragic, unscientific, and damaging. Children do not readily acquire COVID-2 or spread it to others. Children should not be forced to be masked, for by wearing them, their exhaled viruses will not be able to escape, but through their olfactory nerves make their way to their brain. A German registry study found the average mask time of a child at 270 minutes per day, causing irritability, headache, difficulty concentrating, less happiness, drowsiness, and fatigue. Children also need to be able to recognize facial expressions as part of their ongoing cognitive development. The accumulated evidence of prolonged masking of children is not only harmful, but dangerous. Masking has limited efficacy at all and is even virulent, especially to our children. Yet we have been deceived from day one by our government officials and their advisors, and resulting in a type of deception that causes unfounded fear, which has been driven by the media.
Expired. I ask you to conclude your remarks.
Okay, masking hasn't worked and will not work to stop the spread of COVID-2. Let's put it this way. If you keep doing the same thing the same way and expect different results, it's insanity. Thank you for your time.
Thank you, Mr. Packett. Next, we have Emmanuel Carr.
Good morning. My name is Emmanuel Carr. I am not a county resident, but I am an Anne Arundel County educator. I'm in favor of Bills 6-22 and 7-22. Instead of giving you my own research that I'm not good at interpreting and that has not been peer-reviewed, I will talk about my personal experience. Many students and staff do not believe in the importance of masking, and the rest of us educators constantly have to argue with them to wear their masks and wear them properly. I've contracted COVID at school right before winter break because of this issue, and I'm still in isolation. I'm very careful with my health and wearing masks because I have an autoimmune disease and take an immunosuppressant drug. If you're wondering how I got infected despite wearing my mask, I have to remind you that we eat in our classrooms and have to take our masks off. I've been sick for 2 weeks now, and even if it's a mild case, I'm still not feeling good, and I can tell there's going to be some long-term impacts on my health. So please believe in science that was shared with you by experts. Follow what Dr. Marcosi, Dr. Vinema, Dr. Meisenberg, and Dr. Kay said. Don't be so far behind and follow the surrounding county councils that are working with their county executives concerning proclamation of executive orders and mask mandates and protect us all by passing these 2 bills. Thank you.
Thank you very much, Ms. Carr. Next, we have Kaylee Locklear.
Good morning, honorable members of the Anne Arundel County Council. For the record, my name is Kaylee Locklear and I live in Edgewater, Maryland. I am here this morning in opposition to Bill 622 as well as 722. To be clear, I'm not against masks and I respect those who wish to wear them. I'm against mandates that are just not necessary. For those who have been anywhere, especially recently, the majority of people, even before this week's mandate, were already wearing masks, yet the numbers keep increasing. And if we ask ourselves why that is, the truth is that most COVID transmission is not occurring in the businesses or public places in our communities. It's occurring at home with family and friends. And if you don't believe me, I just ask you to look at states and localities that have mandates and those that don't. There is no correlation with mask wearing. I also oppose these mandates because the onus falls on our strained businesses and it diverts precious resources. The health department, for instance, can shut down a business owner if they receive an anonymous complaint about mask wearing. And in conflicts with customers, the state has said a business owner must contact police. This pulls precious fire responder resources away to deal with a mask when our departments are already understaffed. Finally, we are all concerned when we hear our hospitals near capacity, but, and as it was discussed earlier, the majority of admitted individuals are not COVID cases. And I should add that even before COVID, the nursing shortage was causing similar issues. Better access to COVID testing, antivirals, and primary care would undoubtedly help alleviate the recent hospital influx. Thank you for your time and attention today, and I respectfully ask for an unfavorable vote.
Thank you, Ms. Locklear. Next, we have Steve Rotone.
Madam Chair, I'm sorry for the interruption. I just want to ask everyone to please state their name and address before they speak so we can properly match everything up. Thank you.
Thank you, ma'am. My name is Steve Roten, 7302 Stallings Drive. Benjamin Franklin in 1775 said, "They who can give up essential liberty to obtain a little temporary safety deserve neither liberty nor safety." These bills violate numerous articles within the Maryland Constitution Declaration of Rights. The bills violate Article 24's permanent boundary on any person being deprived of their liberties without judgment of their peers or by the law of the land. It violates Article 45's constraint on limiting or denying rights not enumerated in the Maryland Constitution. Bodily sovereignty is a God-given right being denied in these bills. Violates Article 44's perpetual barrier on government canceling or suspending any provision of the Maryland Constitution and U.S. Constitution under any plea of necessity. Violates Article 36's protection all persons are entitled to in their religious liberty from being molested by any law as they are to perform their duty to worship God in such manner as he thinks most acceptable to him. Each person of Anne Arundel County will be injured in their ability to worship God each and every day. Violates the Declaration of Independence by using the pretext of saving lives to invade upon the sacred liberties of every citizen of Anne Arundel County. According to the Maryland Constitution Declaration of Rights, Article 6, each of you, as persons invested with legislative and executive powers of government, are the trustees of the public, and as such, accountable for their conduct. The broad ends of government, as prescribed by the Declaration of Independence, have been perverted, and the public liberty have been manifestly endangered by these bills. I urge you to vote against both Bills 622 and 722. Moreover, from a medical perspective, the N95 mask filters pathogens down to as small as 1 micron. The COVID-19 virus is 1/10 of that size, and it can't possibly filter out the COVID virus, and neither can cloth face coverings. The CDC guidelines, making the CDC's guidelines look foolish.
Please conclude your remarks.
Yes, ma'am.
Thank you.
If people are going to the hospital, then there's been a fundamental failure of an early treatment regimen. If Bangladesh, of all countries, can stamp out COVID-19 through early treatment, why can't we? My last comment is, there are threats to doctors for giving out accurate information to their patients about these things. And I'm concerned that there was not a balance.
Your time has expired.
Okay, vote against both of these bills.
Today.
Thank you very much.
Thank you. Next, we have Cheryl Starr Thomas.
Madam Chair, the next 3 people that are registered, we're not seeing their names. I'm also not seeing phone numbers matching those registrations. I'm scanning quickly here.
So, okay. So does that mean the next person we do see would be Pamela Moats?
I believe that's what it means, yes.
Oh, and there she is. Ms. Moats, please state your name and address for the record, and you may proceed.
Okay, my name is Pamela Moats. I live at 205 Aquahart Road in Glen Burnie. And to make a long story short, I am in support of both of those bills to extend the period of time, extend the mandate. And I will say, whatever format it wants to take, whether via letting the county council do periods of extension, however it works best, but it does need to be extended. And I have the person earlier that said about, oh, well, you can't, how can you enforce it on the Amish? Each group of the plain people kind of have their own thing. When I was on a train ride to Denver, 24 hours, 2 days straight, masks, and that included a whole bunch of Amish that apparently from the Midwest. So please extend the mandates. Personal health, public health transcends personal choice.
Thank you very much, Ms. Moats. It looks like, do we not have Michael Marge?
No, right, I'm sorry, Madam Chair, same thing. I think we have to move on to the next name.
Thank you. Next is Michelle Sobolewski.
Hi, good morning. Can you hear me?
Yes, state your name and address for the record, please.
Michelle Sobolewski, 1205 Hanson Way in Severn. So I won't harp on everything that's been said over and over again. I am a healthcare worker in the area. I actually travel for work, so I go all up and down the Northeast corridor. So I have a lot of experience in a lot of hospitals. I'm against the max mandate as it is now because people are not wearing them properly. If we're going to mandate it, everyone needs an N95. Sorry, I went to a different room, I'm out of breath. So kids walking around and adults with masks hanging around their chins, down below their nose, playing with them, wiping their nose with it, it does absolutely nothing. So if we're going to mandate it and we're going to make restaurants responsible, we're going to make it a mandate, it needs to be correct. I'm, of course, obviously big on public health. I understand what's going on in the hospitals. Some of our local hospitals are now requiring people that don't work there on a regular basis, such as myself, who travels in and out, to wear 2 N95s. So that's what I had to wear all week, which is fine. I'm in a hospital. However, everybody else is walking around with little plastic masks that they have in their car for, months at a time, especially our children. So if it's going to be masked correctly, if it's not correctly, don't do it, because it's damaging our health in the reverse way. That's just how I feel about it. And people aren't going to wear it. They're not going to do it. That's just really the cold, hard truth. So, and I do want to give a shout out to Jessica Hare and Nathan Volke, because we love you. You guys are great.
All right.
That's all I got.
Thank you very much. Next up, we have Edward Burlett.
Madam Chair, with your permission, we can check in with Mrs. Burlett. I'm not certain if they're sharing a device, but the address and everything else matches.
Okay, that would be fine. I can't remember her first name. Oh, there she is. Okay, so maybe he's going to speak on her device. Or they should.
Mrs. Burlett, is this the same device for Mr. Burlett? If so, please unmute yourself. If not, we will move on. Okay, I'm not seeing anything that's helping out here, Madam Chair, so I think we have to skip to the next person.
All right, our next speaker is Charles Henn.
I'm not seeing a Charles Henn or a phone number associated with that registration.
All right, thank you very much. Christina Colvin.
Hi, can you hear me?
Yes, state your name and address for the record, please.
I am Christina Colvin. I live at 8012 Elizabeth Road in Pasadena. I'm a history teacher, and I recently read that my local high school has the highest COVID rate in the state. But places I go, people wear their masks when there's a mask mandate, and mostly they don't when there isn't one. I can't convince people that masks work if doctors and basically every government agency on earth can't. They aren't a perfect solution, but they have an important effect. Even if they only have a chance to reduce the spread a tiny amount, the state of hospitals means that we should do it. Questions of potential herd immunity are frankly irrelevant to the question of whether our hospitals are currently overwhelmed. I've heard stories from nurses in our community who used to work in labor and delivery wards who quit to work in salons because they cannot keep up the level of care required in this emergency. I have friends who work in hospitals, and I know that our hospitals are getting overwhelmed, and that concerns me a lot more than catching COVID, but it is a concern. I'm vaccinated, I'm boosted, and it was a challenge to find somewhere that had booster appointments because the CVS's websites are wrong. But my pediatrician's office just had to cancel my child's 2-year checkup this week because they are so overwhelmed with their staff and families having COVID. My son is too young to be vaccinated. He wears his masks because that is the rule, but it is easier to get him to wear his mask when the adults around him do. We have to do everything in our power to keep our hospitals functional, and a mask mandate is low-hanging fruit that will also help against things like the flu. Nurses and doctors wear masks and PPE when caring for the ill because it is effective, but they are about to break. The least the council can do is require citizens to take such a comparatively unintrusive measure. And I mean comparatively unintrusive in terms of like, you guys could be mandating vaccines. This is not that big of a deal. So that nurses and doctors don't get overwhelmed trying to keep us alive in times of crisis. Even if all a mask mandate does is remind people that the current situation is very serious, that's worth doing because maybe then people will go buy an N95. Thank you.
Thank you very much, Ms. Colvin. Next, we have Joyce Toll.
It's the question of the day. Can you hear me?
Yes, state your name and address for the record, please, and you may proceed.
Joyce Toll, Howard Grove Road in Davidsonville. The headlines on Sunday read, 2 states just shattered records in the highest number of new cases in one day. Those 2 states were New York and Florida. New York has some of the strictest mandates, including a mask and vaccine passport, and it has not protected them any better than Florida, who has little to no restrictions in place. The masks we are going to be mandated to use are simply not able to protect us or slow down the community spread. And I believe one of the doctors that you had testify earlier also said that the N95 was the best way to protect people, and that is not what is being requested of us with the new mask mandate. Cities with mask and vaccine mandates are seeing COVID spikes anyways. New York, DC, Chicago, Boston, LA. For the last 2 years, the CDC data tracker has been tracking COVID cases rates on a national and state level. If you look at the yearly trends, you will see COVID behaves in a secular manner, much like the flu and cold season. A rise in cases starts in October and starts to drop off at the end of January, February. This is no longer just flu and cold season. It is flu, cold, and COVID season. We have never been issued an EO to wear masks during the flu season, so why would we start issuing one now? In fact, the UK Daily Wire reported yesterday that US case rates dropped 25% just since Monday. You guys have the most opportunity to stop. We have to, at some point, this has to stop. We can't just every time there's a spike or a new variant, go back and say, okay, now we have to go back to masks. At some point, we have to draw a line and say, we cannot do this any longer. I am not in favor of this mandate. I really hope that you at least look at the CDC tracker and look at the historic data. And I wish that somebody had asked these 3 doctors if a cloth mask mandate was really going to protect people from the spread of Omicron. Thank you.
Thank you, Ms. Toll. Next, we have Charles Max.
Yes, hi. Can you hear me?
Yes, state your name and address for the record, please.
Charles Mackus, Chestnut Hill Cove. So I adamantly oppose the bill 622 and 722. Breathing unfiltered, clean air is a fundamental right for all U.S. citizens. Forced masking is illegal, immoral, and unconstitutional. COVID is not going away. We must learn to live with COVID like we do the flu and the common cold. We should be focusing on early treatment, eating healthy, and exercising to stay healthy, not have mandates for masks and vaccines, which neither work. Last Wednesday, I signed up at my local gym in Pasadena. Thursday, the mandates came back for masks, so I had to cancel my membership. There is nothing safe about wearing masks while working out. Wearing a mask causes great harm. It reduces the flow of oxygen by up to 20%, then make us breathe unwanted carbon dioxide we just exhaled. We do not receive enough oxygen. Our heart rate goes up to compensate for the lack of oxygen, just as unhealthy, potentially deadly. I tried to work out. After one set with the mask, I had to stop. There's countless videos online of people passing out while working out, wearing masks, whether they're doing cardio or weights. Science clearly confirms, real science, that masks do not stop the spread. Look, wearing a mask to prevent the spread of COVID is like trying to stop water with a chain link fence. It just doesn't work. Nurses and doctors are trained to use masks one time, all masks, and then discard it because it's contaminated. That tells you everything you need to know about masks right there. Masks do work to create fear and hysteria for the masses, as brought on by mass formation psychosis.
Please conclude your remarks.
So, to the council, most people are sheep. They need to be led by good shepherds. They need to be led to green pastures of early treatment and eating healthy, exercise, not off the edge of a cliff with forced vaccines and forced masks. This is up to you guys. You have to do this in our local community. We cannot continue down this road or civilization will collapse.
We will appreciate your remarks. Next up is Amy Reel.
Madam Chair, I do not see an individual with that name in our room. I'm sorry. No phone number to match.
Okay. Do we have David Camp?
We do.
Oh, there is Mr. Camp.
Can you hear me?
Yes. Say your name and address for the record and you may proceed.
David Camp, William Chambers Jr. Drive, Glen Burnie, and Mr. Volke's district. I want to say thank you again for having people here, and I actually feared that I would be one of the only ones that is against these mandates, and I'm glad to see that I'm not. What I am concerned about is I'm concerned the way people listen to Dr. Meisenberg and Dr. Marcosi earlier, because their testimony was full of holes and inconsistencies. They contradicted themselves. That's what's going on in the world today. Dr. Meisenberg wanted to assume that people that are in the hospital now wouldn't have been in the hospital 2 years ago. We're dead in the middle of flu season. We literally have gotten COVID to where we wanted it to be at the beginning. It has become the flu. People that compared it to the flu early on in the other variants were off. It is now the flu. The symptoms are mild. That is not conjecture. That is studies out of other countries who have been hit with this earlier than we are. It has turned into the flu. There are many, many cases where hospital systems are overwhelmed with people running in for tests. Why are they running in for tests when they've already taken a rapid test? They're doing it because governments are instilling fear in the people. This can be beaten by treating it at home. That has been documented. And Dr. Meisenberg also said that masks can help prevent you from getting it because it prevents it being inhaled. Well, if that's the case, then people that voluntarily wear masks are helping protect themselves. We were told that the masks and the other requirements were only due to trying to slow the spread, get to the vaccination point where we have vaccines. Vaccines are widely available. Anyone that wants one can get one. Hospital systems are being overwhelmed by fear that's being instilled by governments. Don't continue to contribute to that. We are not at that crisis because of COVID. Most hospital beds are not being taken up by COVID patients. Most hospital beds are being taken up by other diseases. And the ones that are from COVID are consistently going there because they're being instilled with fear.
Your time has expired. Please conclude your remarks.
Thank you. I will say that what you should do instead of extending the mask mandate is educate the people not to rush to the hospitals for testing or mild symptoms, treat themselves at home, and we are literally where we wanted to be 2 years ago. Thank you.
Thank you, Mr. Camp. Next, Becca Robeson. Ms. Robeson, if you can hear me, you can unmute yourself and state your name and address for the record and proceed with your remarks.
I'll do my addition of reminding you to try *6 if everything else is failing here. Madam Chair, I don't think this individual is able to join, or she might be doing something else. We can circle back if you'd like.
All right, sounds good. Next, we have Linda Sinkowicz.
Hi, can you hear me?
Yes, you may proceed. State your name and address for the record.
Thank you. Linda Sinkowicz, 260 Perch Road, Savannah Park. I'm speaking today in opposition to Bill 622 and 722. After hearing the experts speak today, I wish we had had an opportunity to ask questions of them. I'm specifically wondering why none of them have spoke to preventative measures like the one mentioned by the Cleveland Clinic speaker and others. Educating the public on common sense healthcare is arguably more critical. Since the beginning of the pandemic, the handling of COVID has been completely arbitrary, particularly how mandates are imposed and who they're imposed upon. During the pandemic, you had to wear a mask to enter a restaurant, but you could remove it when you were seated. Liquor stores were deemed essential, but places of worship were not. In schools, it is permissible to unmask while eating and while participating in gym, band, or theater. No exemptions are required for these activities, but students with learning disabilities who need to unmask to be understood must apply for exemptions. The worst examples of arbitrary enforcement of mandates involve vaccines and alternative therapies. Student athletes are required to be vaccinated or to be subjected to weekly COVID tests, but those who have been vaccinated can also contract COVID and spread it to others. Healthcare workers who worked through the worst of the pandemic have been forced out by vaccine mandates, which I would argue is a bigger factor in the current hospital crisis. Journalists and politicians have demonized any talk of alternative therapeutics to combat COVID. Talk of hydroxychloroquine and ivermectin will get you fact-checked, censored, or outright banned from Facebook and Twitter, yet we recently learned that politicians and athletes are receiving these very treatments after contracting COVID. Anne Arundel County is proposing to return to masking to stop the spread. Despite the assertions from the experts speaking today, Montgomery and Prince George's County have both the highest number of daily cases and the highest rate per 100,000 citizens, and they've had masking in place during almost the entirety of the pandemic. And yes, while our county's rates are rising, I would counter that after mask mandates were lifted, many continued to wear them out of an abundance of caution. And yet we are told masks will help. This reasoning seems, well, arbitrary. Please vote against the mandates. Thank you for your time.
Had myself on mute. Thank you very much. Next, we have Jennifer Fold.
Hi, my name is, I'm here. I'm Jennifer Fold. I live in Linthicum.
Go ahead.
Okay. All right. Anne Arundel County does not need a mask mandate. Maryland data does not support a mask mandate. PG and Montgomery counties have had mask mandates for months, and according to the CDC website just today, have higher case rates than Anne Arundel County. Not only does the Maryland data not support a mask mandate, this bill is based on manipulated data. This bill cites an over 300% increase in people admitted to hospitals with COVID, not because of COVID. What does it mean to be admitted to a hospital with COVID? Does that mean if a person is admitted because of a physical injury from a car accident and tested for COVID at the time of admission, as is protocol of all hospitals, that individual is now counted in the individuals admitted to hospitals with COVID category? If so, which is what I suspect, this data should not be used to support an argument that COVID alone is the reason for an increase in hospitalizations and thus supports a mask mandate. Might the reason for an increase in hospitalizations be that it is winter, the season that hospitalizations always surge? Might it be that there is a shortage of Maryland nurses and hospital staff? The bill fails to acknowledge that Luminous Health also reported staffing shortages as a contributing factor in the burden on hospitals. These staffing shortages were caused in part by Governor Hogan's vaccine mandate for hospital healthcare workers. The bill defines a face covering as a covering that fully covers without gaps a person's nose, mouth, and chin. This acknowledgement that to be effective, masks should be worn without gaps snugly around the face invalidates the overall argument for a mask mandate. How many individuals outside of healthcare workers do you believe are wearing masks snugly around their faces without any gaps? The Maryland data does not support a mask mandate. The data cited in this bill is not accurate and reliable to make an assertion for a mask mandate. The citizens of Anne Arundel County do not support a mask mandate. Thank you.
Thank you, Ms. Fold. Next, we have Nicole Miller. Ms. Miller, you can unmute yourself, state your name and address for the record, and you may proceed.
Hi. Perfect. Okay, I'm Nicole Miller and I live in Linthicum, Maryland. I just want to state that I am opposed to both of these bills. I thank you for this time that I'm able to speak. Sorry, I'm a little bit out of breath. I just walked away and ran from the other room to join you all. I'm an educator within the county. And first I wanted to point out that I was very disheartening to find out that the experts that were chosen were one-sided. I think that it was unreasonable to put together a meeting and an agenda where all of the council members were not sought out. They did not have an opportunity to seek representation of the other side of information. There are many cases out there that are case studies that document and support many of the comments of those that are opposed to these bills. As an educator, the people group that I want to try and express concern for are those that are hearing impaired or deaf within the community. The isolation that masking universally causes for these students is highly detrimental. There's absolutely no alternative for them. Any face covering that would allow them to see some of the time, it's still obstructing their view. And I have several students within my population who are extremely profoundly hard of hearing, and watching the isolation that they've had to face this week, not being able to engage in peers because they highly rely on lip reading, is unfortunate. They're going to be put back behind in their education as well. And so the masks are not, there's no settled science proving that they work in any way. I need to echo those that have said that people are not wearing them appropriately. So in the grand scheme of things, they are causing problems for those that can't hear appropriately. And so I ask that the council would oppose this mask mandate, and there's really no need for it. Thank you for your time.
Thank you, Ms. Miller. Next, we have Bill Moore.
Madam Chair, I'm sorry again for the interruption. We have Mr. Henn. He is here by phone. We just missed him by a couple of people here. I'm not certain if you want to give him a chance.
That would be fine. We'll call on Mr. Moore next. Go ahead, Mr. Henn. And what's the star?
And Mr. Henn, yeah, he did it.
Got it.
Yep. Hello, can you hear me?
Yes, go ahead. State your name and address for the record and you may proceed.
Yes, it's Charles Henn, Edgewater, Maryland. I apologize for the technical glitch earlier. I'm here, like many of the other callers, to vehemently oppose all mandates, whether it be masks or any other mandates associated with COVID-19. The citizens of the county have dealt with mandates for almost 2 years. Since we now have a record number of cases, obviously the mandates and requirements don't work. It's time to accept the fact that the face mask will not and has not stopped the spread of COVID-19. The mandates are tiring and a complete overreach of the county's authority. I implore you to not let this mask mandate become effective. I'd like to give an example of some of the ancillary effects that I think a lot of times when politicians are making decisions, they don't take into account. 2 weeks ago, before a mask mandate, everybody was free, as they should be, to either wear a mask or not. That is the decision and the responsibility of the individual, not the government. I did not wear my mask during that point in time, and not once in that 8-month period did anybody vilify me, criticize me. There were no arguments. Everybody kind of lived as they are. Once the government implements a mask mandate, with absolutely no way to enforce it, you leave that enforcement aspect up to the individual citizens and the businesses, and that's just completely unacceptable. There are no ramifications for not wearing a mask. The majority of people who do wear them are the cloth masks, which many studies have proven to be ineffective. Those who wear the mask, wear them below their nose, they do absolutely nothing, as we can see by the statistics. The last thing we need as a community is to be at odds with each other. I think the last couple of years, or the last 2 years, has really driven division within individuals and how they think. None of these mandates have worked, as we can see by the numbers. I think the moral of the story is that mandates levied on citizens only drive the divide that we find ourselves in. It's my opinion that the citizens are just to the point where they're going to do what they want.
I ask that you conclude your remarks.
Yeah, real quick. I think the scariest part of all this is, when does it end? When do the mandates stop? When do you realize you cannot control government and people can go back to their lives? There has to be a clear end in sight with clear metrics. When will the overreach end? For those council members who do not support these mandates, I thank you for doing what's right for the citizens. I like to end with a quote that sums up this time in history. The 9 scariest words in the English language are, "I'm from the government and I'm here to help." Thank you for your time.
All right, next up, let's see, we have, is it Amanda Gormley?
Yes, that's correct.
All right, you may proceed. State your name and address for the record, please.
Amanda Gormley, Elk Ridge, Maryland. This morning, I'm speaking in opposition of both bills being proposed. I'm a registered nurse at Johns Hopkins. In March of 2020, we were told 2 weeks to flatten the curve. Initially, masks and social distancing were our only lines of defense to slow the spread. That is no longer the case. Individuals have been granted free access to vaccines and boosters. Many Maryland public schools over the last month have reported outbreaks, which have shut down extracurricular activities and led to virtual learning. The children are the least at risk. Masks are mandated in all Maryland public schools. If they work so well, then why the outbreaks and rise in cases? Exhaustion has set in. We've been complying for 2 years to mandatory testing, masks, and shutdowns. For masks to be effective, it must be worn adequately. Dr. Lena Wen, a medical analyst for CNN, recently stated that cloth masks are little more than facial decorations. In the past week, I've learned of at least 15 people that have tested positive for COVID, all of them double vaccinated, boosted, and avid mask wearers. If Omicron is getting through 2 vaccines and a booster, what is a piece of cloth from Old Navy going to do? When public schools shut down and opted for virtual learning, my husband and I withdrew our 2 children, enrolled them in private school in Anne Arundel County. It's been a financial burden on our family, but the best decision we've ever made, because they've been able to learn in person with real teachers and their friends until this week without ill-fitting masks covering their faces. I'm asking the Anne Arundel County Council members to be leaders moving forward by stopping the mandates and grant people the ability to make their own choices for themselves and their children. I respect the decision of others to choose to wear 1 mask or 10. I simply want to be granted the same respect of that choice. Please do not vote in favor of these bills today to extend the mask mandate. Thank you.
Thank you, Ms. Gormley. Next, do we have Bill Moore? Oh, I see Mr. Moore on the screen. State your name and address for the record and you may proceed.
Hi, this is Bill Moore, Davidsonville, and I oppose 622. About 30 years ago, I met a Russian lady who had lived under the Soviet Union and made it to America after the Berlin Wall fell. I remember her saying she was so happy to be in America, the land of the free and the home of the brave. I asked her what surprised her most about America, and she said she found it amazing that Americans believe the television news. Given so many folks today seem to be swimming in television propaganda on COVID and mask efficacy, I decided to review the actual science. Here are some salient facts. 1, there is no killer novel coronavirus. According to the CDC, the average COVID survival rate for all individuals under 70 years of age is 99.9%. The CDC has stated that 6% of reported deaths are directly attributable to COVID. In other words, on a yearly basis, COVID deaths are roughly the same as the yearly flu. Masks do not work for stopping viruses. Viral particles are measured in nanometers, while the pores in masks are measured in micrometers. This means that your mask is like a chain link fence trying to stop a mosquito. Masks are damaging to respiratory health. According to a British medical journal, face masks make breathing more difficult, and for some people can be life-threatening as bacteria is kept on the mask and breathed back into the lungs. Since there is no killer virus and the masks do not work and are harmful to health, we can only speculate that either this bill is being brought up out of ignorance or the motivation is not health, but control over people and a move towards tyranny in Anne Arundel County. My hope is the decision on Bill 6-22 on the mask mandate would reflect reality instead of 24/7 COVID TV marketing campaign, which is largely funded by ad revenue from major pharma companies who are directly benefiting in what has become a COVID industrial complex. We need to put this sordid last 2 years behind us and get back to our free American society. We need to stop the mask mandate and once again become one nation under God, indivisible, with liberty and justice for all. Thank you.
Thank you, Mr. Moore. Next, we have Sophia Hecominos. Ms. Hecominos, you have the floor. You can unmute yourself and proceed. State your name and address for the record, please.
Hello, everyone.
Hello. You may proceed.
Thank you. I'm sorry. All right. How's everybody doing? I'm really pleased to be speaking here today. I've never done anything like this, so this is pretty neat. I actually work in Odenton, Maryland. I'm a bartender, manager, and a server who does all.
Your name and address for the record,
please.
please.
I'm sorry. Sophia Hecominos, 378 Mount Vernon Avenue.
Thank you.
All right. That's all right. Okay. I am a bartender, manager, and server, and I do all three of these jobs simultaneously. And most of the time, I am alone on the job. Now, again, I am being told I have another responsibility of ordering regulars and friends of mine to wear masks. I'd also like to mention my coworkers and I work a small local venue where many are heroes of the community, nurses, firefighters, police officers, and those that serve and protect our country, military and NSA. Myself, my coworkers, and a large majority of our patrons are vaccinated, boosted, and also have natural immunities. It is becoming increasingly frustrating and dangerous for myself and coworkers to insist that our paying patrons wear masks. I have worked in the service industry for 12 years, and I have worked some shady bars. Point being, masked individuals on a late weekend night is never fun, and it's very scary. I believe that the community understands the risks of this disease, but we should be allowed to have the individual choice to wear a mask or not to wear a mask, as well as to stay home or to go out. We want to live our lives with our freedoms and liberties, and nobody really wants to sit at the bar with the government drinking a beer next to them. Let's be honest. Let's get real and let's be smart and live the lives that our Constitution has entitled us. And I thank you all very much for my time. And hopefully I'll see you tonight, maskless at the bar.
Thank you very much. All right, next we have Sandy Sangokshin. Ms. Shin, you have the floor. Please state your name and address for the record.
This individual may want to try *6.
Hi, my name is Sandy Shin. Hi, my name is Sandy Shin. I'm at 2078 Ingleside Court in Crofton, and I'm calling to support both bills. I was so appreciative of the doctors taking their time to address the council today, and I'm asking every member of the county council to take to heart what you heard from them. and support these bills, especially the limited mask mandate. You know, I've seen firsthand individuals who are asymptomatic. They weren't intending to infect people, but you know, God only knows how many people were infected because they went to school, the gym, the grocery store, and restaurants without masks. And these are well-intentioned people. They're, you know, they're not people who have an agenda or anything like that. Masks work when they're widely used. And yes, I hear people saying masks don't always work. Yeah, upgrade the masks. You know, we've got more companies out there. You know, US made N95 masks that work. I am disturbed by a lot of the speakers who cite medical studies, things that are not peer-reviewed, simply misstatements or cherry-picked information that's way out of context. I trust the experts who spoke today. It was very compelling. I just want to ask the members of the council, put aside a lot of the background noise, listen to the experts, and support both bills, particularly the masking. I mean, the proposed bill is very modest. We're only talking about a 45-day period. Our democracy is not going to fall apart because we have a mask mandate for another 45 days. Thank you very much.
Thank you, Ms. Shin. Next, we have Greg Miller. Mr. Miller, you may unmute yourself, state your name and address for the record, please.
Unfortunately, my husband serves in the U.S. military, and when he's on duty, he's not at liberty to share his testimony. If he were here, he would have stated that he is opposed to both, but he unfortunately had to go to work. Thank you so much.
Thank you very much for stepping in for Mr. Miller, and thank him for his service. Next, we have Jonathan Hoppy. You may unmute yourself and state your name and address for the record.
Yes, can you hear me?
Yes, I can. You may proceed.
All right, my name is Jonathan Hoppy. I live at 860 Swift Road, Pasadena, Maryland. That's also the address of my church. I'm the pastor of a small church here in Pasadena in Nathan Boke's district. And I'm also a full-time Christian school teacher, fourth grade teacher. And a year ago, I did have COVID, and everyone was wearing masks in the classroom. I was wearing a mask. We were wearing masks all the time, except when we eat, and we tried to distance as much as possible. Still got COVID from one of the students who tested positive. I had a CPR positive test, had all the symptoms. None of my family caught it, even though they were exposed to it. This year, my family did have it for Christmas. I did not get reinfected. I like to believe I have natural immunity. I am opposed to the mask mandate. I believe it's important that we have the freedom to act in our own best interest. Also, when my COVID case was addressed by the doctor who handled that case, when I went to get tested at urgent care, they told me that being exposed to COVID qualifies as being both persons, maskless or not properly masked, within 6 feet of each other for at least 15 minutes. If one person wants to wear a mask because their immune system is not there, they should have the freedom to do that. But I don't think we should require everyone to wear a mask. I believe it's a violation of personal liberty and unnecessary, and that will not prevent all cases of COVID. I also want to say that that it hinders communication. As my job and the teacher, I've seen it. It makes it much harder to teach the fourth grade class. It makes it harder to communicate with people in my church as the pastor. It's important that you'll be able to see facial expressions as well as lip reading. That's very important. And be able to hear clearly, very important. And it just also trying to police it in a classroom, very difficult. It causes undue tension between those who are for the masking.
I'm sorry to interrupt, but your time has expired. Please conclude your remarks.
And so we have been fine thus far this year within the classroom without mandatory masking. I ask that we return to that again, please.
Thank you very much, Mr. Hoppy. And next we have, it looks like Jonathan Barnes is not here. Is that correct? All right, so we will go on to David Morseberger. Mr. Morseberger, you may unmute yourself, state your name and address for the record, and you may proceed.
Good morning. I'm Dave Morseberger, Village Lake Drive in Davidsonville, Maryland. I'm testifying in opposition First Bill 722. The county should not delegate its responsibility to the county executive, who's an individual, independent of the party in power, or the administrative state, the unelected, uncountable bureaucracy. In my opinion, any changes necessary to combat COVID must go through the county council with a full and transparent public debate. Council must be in the driver's seat like they are today. As far as Bill 6-22, I'm also in opposition of that. I'd like to say this has been a great session. I mean, it's basically our system of representation of action. We're hearing professionals, we're hearing the public. It has been great. As far as the testimony of the three doctors, it's been noted multiple times that all three of those have been supportive of the mask mandates. And there was not a doctor or anybody in the medical profession that opposed mask mandates. So does that lead one to assume that all doctors support mask mandates? I don't think so. This is a very emotional topic, and this solution cannot be symbolic or based on emotion. Of course, we support the doctors and nurses, especially those in the hospitals that are doing what they're doing. But we must discuss and debate other solutions for effectiveness, like improving the immune system, discussed for like Anna Cheney. I go out to the coronavirus.maryland.gov website, and you really, when you look at the data in detail, and kind of as an engineer, I'm always looking for a causality, correlation, and as one doctor said, the outcome. You see no positive effect in places like Baltimore City, Montgomery County, and Prince George's County, who have already mandated masks. Their trends are actually have gone up, whereas they were better than Anne Arundel County prior to their mask mandates, and now they're actually worse.
Your time has expired. Please conclude your remarks.
Okay, in summary, I think this boils down to personal choice versus state-controlled mandates. We have been in this situation going on for 2 years. People have had access to information to make an informed decision based on their situation. If it feels important to wear a mask, then wear a mask. If you were someone in your business, if you own a business and you want people to wear a mask, then mandate it in your facility. Make the hard decision. People need to make their hard decisions, not rely on the county government to make it for them. Thank you.
All right, thank you, Mr. Morseberger. Next, we have Jake Starren.
Madam Chair, my apologies. I'm sorry. I received communication from the Burletts. Mr. Burlett has resolved his issues and is ready to testify.
All right, well then we will hear from Mr. Burlett. You may unmute yourself, state your name and address for the record, please.
Yes, Mr. Burlett is coming to the phone. Sorry, it was a technical difficulty with his computer earlier.
No worries. We want to accommodate those so everyone can speak.
All right.
All right. My name is Ed Burlett. I live at 924 Pine Trail in Arnold, Maryland. I just want to say that I am opposed to both the emergency powers and the further mask mandates. I am open to look at any compelling evidence that masks are effective. The county council doesn't seem to produce scientific data on efficacy. Please cite the research that supports mask mandates. I'm sorry that wear the damn mask is not a compelling argument. The last round of emergency powers lasted far longer and was far more intrusive than expected. Stupidman was shown himself incapable of listening to reasonable argument and should never be allowed emergency powers again. This emergency county council session is designed to as a publicity event, showing that the citizens of Anne Arundel County want their government to control them. The expert testimony given at the beginning of the meeting did not include any people with opposing views on mandates and vaccines. To the Republicans on the council, don't give in to this phony pressure. The majority of the county wants to live peaceful lives without the government dictating how to take care of our body and how we should dress. Please do not allow the Democrats to have control of the citizens of Anne Arundel County again. Democrats have not allowed to be independent thinkers and have proven that they are incapable of anything less than ruling with an iron fist. Vote against the mask mandates and emergency powers. Thank you.
Thank you very much, Mr. Burlett. Next, we have Jake Starren, or Starren.
Hey, you got it right. Thank you.
All right, my name is Jake Starin, and I live 205 D Street, Southwest Glen Burnie, Maryland. I'm just going to start out by saying the saying was 14 days to slow the spread, and it's been well past 14 days. It's been 2 years, and I think we're at the point now where people should be able to choose for their families and for themselves whether or not they want to wear a face mask. I'm around thousands of people daily. I work actually at BWI for Homeland Security and screen passengers that are flying all across the nation and the world. And because of my stance on my vaccine status, I'm forced to wear a face mask and a shield. And even through that, I believe I have gotten Omicron even at work with all my, all my coworkers wearing masks, being vaccinated, wearing gloves, 6 feet apart, the whole list. And it just shows you that even with all those things, and we have plexiglass between us and passengers, supposedly, right? That's supposed to help. And even with all of this, people are still getting the virus. I just went to New York where they had the COVID passports and everything else. You can't buy a burger without showing your piece of paper. And the truth of the matter is that that it doesn't really matter anymore when it comes to these things, because the truth of the matter, we've been doing it for 2 years and we've seen the results. We see that people that are vaccinated are still getting it. We see that people aren't wearing the masks. I mean, you could just go on and on about that. I've had more sinus infections wearing the mask, breathing in the same air. There's just so many different things that question the validity of the masks. You just look at the leaders that are enforcing these masks that are running to states like Florida. You look at AOC and Governor Newsom, all these people in DC that are enforcing these things, but they obviously don't really believe in it, because when they get to these states, they do the total opposite. So my question is, at what point do people get to choose what is right for them and their families? If we want to protect the elderly, then do it. If we want to use the new treatments that are coming out, then do it, but don't force it upon people. It is people's right to choose what is right for them and their families. Thank you.
Sorry, I was on mute. Thank you, Mr. Starin. Next, we have Suzanne Lewis. Ms. Lewis, you may unmute yourself, state your name and address for the record, and proceed with your remarks.
Thank you. I fully support and request that you vote to extend both the mask mandate and the state of civil emergency. It makes sense to align the county's way forward with the state of emergency that Governor Hogan instituted. Masks help prevent transmission of viruses. We must band together for the greater good. This crisis is temporary, so let's all sacrifice the personal discomforts of mask wearing in the short term to increase odds that people won't suffer and die needlessly. Please make your decision with the most vulnerable in mind: children who are too young for vaccinations, the elderly, those with high-risk medical conditions, and immunocompromised citizens undergoing cancer treatments and infusions for multiple sclerosis, Crohn's disease, and more. Consider the overwhelming stress on our healthcare system. How can you not vote to make life easier for those who have carried such a heavy burden for all of us over the past 2 years? Recently, I was in line at a Severna Park bank, masked and standing on a decal to space customers safely. The woman behind me was 3 feet away, no mask, and coughing. I felt like her right to be unmasked while coughing on me disregarded my right to well-being. This morning's testimony from the doctors was compelling. Anne Arundel County's positivity rate is over 30%. That excludes home test results. Hospitals are struggling. My friend is a hospital CEO who is now feeding patients because 40% of the nurses are absent due to illness. Some people are turned away at emergency rooms, and only 1/3 of National Guards called in to help can do so because 2/3 are unvaccinated. We are in a crisis situation. I have concerns about those opposing testimonies today that include misinformation and misinterpretations related to the virus, masks.
Your time has expired. I need to ask you to conclude your remarks.
Do the right thing, the unselfish thing, to protect the welfare of our citizens. Vote to extend mask mandates for the good of all of us. And thank you so much.
Thank you very much, Ms. Lewis. Next, we have Mary Dodoni. Ms. Dodoni, state your name and address for the record after you unmute yourself, of course, and then you may proceed.
Can I be heard?
Yes, you can. Go ahead.
Thank you. Mary Dodoni, District 7, testifying on behalf of the Education Committee of the Anne Arundel County NAACP. Omicron risk and impact are not equal for all students. Omicron is neither trivial nor low risk for children with underlying conditions such as asthma and diabetes, which are more prevalent among minority students. The infection rates continue to rise, rapidly climbing toward the 5% action level that would drive closure in more AACPS classes, grades, and schools. We've already seen this in neighboring counties and know from experience the inequitable effect of such closures on more poorly resourced students and families. Rapid tests will remain limited and may not be positive until several days after infection. Families with fewer resources are less likely to obtain sufficient tests to monitor their or their children's health status and therefore more likely to send infected children to school. Families in which the wage earners cannot take time from work are more likely to send children to school despite their health status or to leave them home alone. We too need to keep our students in school and healthy. This cannot happen without control of community spread. Masking is a simple approach with a profound impact. I seldom pull it out, but some of you know me as Dr. Mary Dodoni. That's a degree in science, in biology, and my profession has been in life sciences and disease profession for more decades than I want to admit. Weighing the impact on our students against the discomfort and inconvenience of community masking, we see no just reason not to support both 622 and 722 and to help keep our students safe and in school. I conclude with the following. Fact. Omicron is more dangerous for poor and minority students, not only directly, but also through its impact on the healthcare system and the education system. Fact. Masking is not dangerous and does reduce community spread. Principle. The Anne Arundel County NAACP comes down on the side of safety, health equality, and educational access. We regard passing of 622 and 722 as nothing less than an act of public responsibility and justice. Thank you.
Sorry, I had myself on mute. Thank you very much, Dr. Dodoni. Next, we have Heather Iliff.
Good morning. Thank you so much for having me. I'm Heather Iliff at 16 Joyce Lane in Arnold, Maryland, and I am president and CEO of Maryland Nonprofits, representing the state's 37,000 voluntary and nonprofit charitable organizations. And the Maryland Hospital Association, along with all of our members, are nonpartisan organizations calling on these measures in favor of the mask mandate and the state of emergency. Just to raise some things that have not been said so far, that hospital workers are not the only ones on the front line of the pandemic. Nonprofit workers who are caring for foster children who are victims of abuse and neglect or have severe mental health illnesses are in residential settings, are also in crisis mode, as are facilities that serve individuals with disabilities, seniors, and others. Nonprofits are also on the front line of delivering food, like Meals on Wheels and food distribution centers, and have remained in the community doing services throughout the pandemic for the last 2 years. No one is more exhausted, I think, than our hospital workers, and just come next right behind it are all these frontline workers in the nonprofit sector who are all impacted. I would like to underscore the previous speaker from the NAACP that people of color in our communities, especially Black and Latino people, are more likely to be frontline workers, are more likely to fall ill and die from the pandemic, more likely to be low income. So those of us, as I am, have the privilege to work from home, should do all that we can. My local Safeway and other stores, prior to the mask mandate, I was just asking the checkout person, what percentage of people do you think are wearing masks? This is unscientific, but and I was like, is it 75%? Oh no, much lower than that. She says it, definitely less than half. So counting on people's personal.
Time is up. I'm sorry to interrupt you. You need to conclude your remarks.
Thank you so much. Speaking in favor of both the mask mandate and the emergency. Thank you.
Thank you very much.
We're going to continue on with Seth Lipko is the next person.
Comms check.
Go ahead, sir.
Okay. I would like the record to show that I am unhappy with my testimony time being cut in half for the convenience of the council. I did plan on testifying against both of these bills. I'll try to be quick. First of all, against mask mandates. We've heard by plenty of people, cloth masks do not prevent the transmission of COVID. Also, to force me to wear one is a violation of my conscience, as I would be living a lie knowing that they do not work. If this bill is about public health, like the whereas clauses claim, you would have to mandate every citizen to be fitted for their own personal mask, mandating them to be clean shaven, and other such absurd and personally infringing acts beyond what's offered in this bill. Will we also see mandates to take daily vitamins or maintain a BMI below a certain value? This is getting ridiculous. There are other detrimental side effects that I won't go into for the sake of time associated with mask wearing. The executive's decision to reinstate the mask mandates, the stand in those orders are on nonsensical grounds, as is based on prior decisions that have destroyed the rights of all individuals. Past abuse is no reason to continue abuse. Past tyranny is no reason to continue being tyrants. I think the real decision this council needs to be making is whether or not to, not whether to extend the mandates, but to nullify them. The government does not have the power to prescribe healthcare treatments or mandate any health treatments upon its citizens. If that power is granted to the executive, please inform me of where that is. And if not, it's your job to put the executive in its place. Does this council not have the power to keep an overreaching executive in check? Are you not going to protect our rights as defined in the US Constitution or the Maryland Declaration of Rights? I see a great example here of our public liberty manifestly endangered by Executive Order 55 and 56, as well as Bill 622. Moving on to the second bill, I don't see any documented proof of a crisis for the state of emergency. If it's in response to the Omicron variant, there's no science to suggest it's life-threatening any more than other winter colds. We've heard a lot about the hospital capacity issue and other factors that could play into that. My question to the council is, are you doing anything to help your constituents keep an even head during the panic, or are you just going along with everyone else's panic over something that can be treated with NyQuil? The testimony from the panel of doctors was fraught with vague statistics and anecdotal evidence.
Mr. Lipko, your time is up. If you want to just wrap up your thoughts, that'd be great. Thank you.
Sure. So we should be looking at other countries who have already seen the Omicron surge. We should look into maybe how this data is, in terms of case positivity, how it actually is affecting us. And I would conclude by saying, shame on you for proposing these bills, but not doing the due diligence and providing information to the public to back up these emergency orders.
Thank you, Mr. Lipko, for your time. Thank you. Pastor Arkan.
All right, thank you for your time. I just quickly would say that I oppose both of these bills, but not ignorantly or without any experience. Our church has purchased and given out thousands of masks to disadvantaged families in North County the last 2 years. We've given out tens of thousands of dollars of food and medication assistance. I did a funeral for a dear, elderly member Wednesday who died with COVID. I'll do another funeral on Tuesday for a dear lady who died with COVID. My family and I have, including my 75-year-old dad, have all had COVID. But I would plead with the council to not pass these bills. Our church is done with being mandated on how we conduct our services, how we conduct our teaching ministry. We have buses. We pick up aggressively families out of Freetown, out of Brooklyn Park. They've been devastated by these different kinds of lockdowns and mandates, and we bring them to church. We love on them. Others have stated it. It is so difficult to be able to communicate with them and wearing masks, and they're not wearing masks. They're not wearing them properly. And so we're done with it. I don't think it's appropriate. My fellow pastors from Prince George's County have been texting me all morning saying, don't do this. Don't do it. We're doing it here, and it's not helping our hospitals. It's not helping our place. And so I would just again say we oppose both of these bills. I love y'all. I appreciate what Councilwoman Lacey said the other night, that y'all are in a difficult spot. And I appreciate it. I got teared up seeing her. I knew that she was sincere. Y'all are in a catch-22. And so I appreciate you. I'm opposed, and I know my time's up. Bless you.
Thank you, Pastor Arkan. Moving along, Anthony Frank. Mr. Frank, if you can unmute.
Okay, unmuted. Yeah, my name is Anthony Frank, Glen Burnie, Maryland, and thanks for providing this forum to express our views. It's been quite informative for myself personally, listening to both sides. And I too was struck by the fact that the medical experts were all on the side of the efficacy of mask wearing. And I don't doubt that there's some benefit from it. Personally, it just makes sense. I have a scientific background. But whether or not it is the solution or it should be mandated is why I'm here to speak. And, you know, if people want to wear masks to protect themselves, I say let them do it. In fact, I have an uncle that wears 2 of them. More power to him. But my wife and myself have both had COVID, and the symptoms were very mild. And, you know, we have also been vaccinated and boosted, and she has dementia. It's profoundly difficult for me to manage 2 masks, to get it on her, get it off of her every time we go in and out. I wear hearing aids, she wears earrings. It's very, very cumbersome. And it's the fact that it's mandated is very, very problematic in my mind. This virus is definitely not going to go away. I've heard people say, well, this is temporary. No, this is not temporary. This virus is worse than it ever was, even after all the vaccinations. So it's not going away. And people are going to have to live with it. We cannot wear masks forever. The impact that it's having on my relationships, my ability to socialize with other people in community settings, ability to sing together, it's crippling. And of course, people have talked about the, you know, covering up the face and missing all the facial cues. And this is just no way to live.
Mr. Frank, can you finish your statement? Your 2 minutes is up. We want to give you
all right. That's it. In summary, you know, it's not sustainable and it's not the solution. You know, vaccines, great, natural immunity, great, but forcing people that don't see the need, there's where the problem lies. Thank you.
Thank you, Mr. Frank, for your time. Continuing on, Carolyn Greiner.
Mr. Persky, we do not have that individual in our waiting room. We should move on to the next person.
All right, Miss Amy Leahy.
Good morning, everyone. Actually, almost noon time. I just have a few things that I want to say. Oh, I'm sorry, Amy Leahy, Severna Park, Maryland. I just wanted to make a couple of points. There's been some really good conversation going on here today, so I appreciate that. The doctors who were given all the time at the very beginning, who were all very one-sided in their views on masking. You know, we spent a whole hour this morning that could have been given to people to testify, but it was taken up with 3 expert witnesses, if you will, who really should not have been given that privilege. They were all very one-sided. I was very upset to hear the one doctor saying that he did not think that the monoclonal antibodies was a good solution for some people who have COVID. I think that that is against a Hippocratic oath, if you want to know the truth. Because there are other alternatives out there for people who have come down with COVID. So let's see, there was another point that I want to bring out is the people who've complained about how this is a political partisan issue, because it seems that the only ones who are accused of being politically partisan are the folks who are supposedly either, and I use the air quotes, anti-vaxxers or anti-maskers. And so somehow it seems to be we're given the message that those folks are the ones who are partisan. However, the county executive used his county email to send out notification of this meeting to all of the people on his email list with a request for people to comment on being for not just the mask mandate, but the emergency powers again.
Ms. Leahy, your time is up if you want to conclude real quickly.
Well, I just want to say we did this once before 2 years ago, and it took an act of God almost for us to be able to get our powers back again. And as far as I can see, fool me once, shame on you, fool me twice, shame on me. Thank you.
Thank you for your time. Moving on. Let me check my list. Rachel Livingston.
Hi, thanks. Rachel Livingston, 110 Oakwood Road in Edgewater. I have been a nurse at Anne Arundel Medical Center for the past 12 years. I've had the privilege of caring for many from our community over my career. I have personally cared for COVID positive patients. Right now, the hospital is full and running on crisis protocols, and honestly, it's still not enough. It's not a lack of effort or hard work on the part of hospital staff, but we are worn down and we are tired. We are struggling to have the space or the staff to continue in the path that we are headed, specifically without any further interventions in the community. Vaccination alone is not enough to reduce the severity and volume of disease in our community. We need layers of protection. Vaccines are one and masks are another. In addition to a nurse, I'm a mom to 2 school-aged children who I want to be able to remain in school. The rate of community spread is concerning to many parents, making us question every activity we allow our children to participate in. Lastly, I have an immunocompromised cancer-fighting mother who also lives in South County. While she is able to stay home about 95% of the time, all cancer-fighting patients aren't so lucky. My mom needs to feel some degree of safety when she is required to leave her house. Mask requirements in all the above 3 situations would help. In my life, I strive to be others-focused, and wearing a mask isn't about me or my personal freedoms. It's about what is best for the people around me, loving my neighbors, friends, coworkers, and strangers well. I'd like to ask you to consider, what if I was talking about your mom trying to fight cancer? What if there was no space for your family or friend in the hospital? And what if it was your small child you were trying to protect? What we do know is that masks reduce the spread of respiratory droplets, and that is something we should all be trying to accomplish. I say all of this, and I'm hopeful for a different 2022, and I hope you'll consider the words and the real life reasons in support of this mandate. Thank you for your time.
Thank you very much, Ms. Livingston, and thank you, Mr. Pruski, for taking over for a few moments. Next, I see we have Kevin Roy. State your name and address for the record, and you may proceed.
Great, thank you. Kevin Roy, 1006 Round Bay Road. First of all, we all acknowledge this has been a very serious virus, especially for the vulnerable. Thankfully, it's also been less dangerous for school-age children than either seasonal flu or other pandemics. The 2009 swine flu was 5 times deadlier for children than COVID. It also appears, as others have mentioned, that it is diminishing as the variance in terms of its danger. The incidents we talked about this morning, what are incidentals, with COVID versus from COVID? We heard 15 to 20%, the 2 hospitals in Anne Arundel County. We've seen reports from other countries that it's maybe as much as 50%. The point is, we know a lot of this is incidental. Dr. Meisenberg said, this was astonishing, I hope for everyone, as it was for me, that 1/3 of the hospital census are COVID related. What about the other 2/3? Why aren't we talking about mediations for those 2/3? So anyway, that was really a big moment for me to hear that. 3 quick points in my limited time. One, it's been mentioned, randomized controlled trials have shown that masks have little to no benefit. Certainly there's some observational studies that show marginal benefit, but stating the obvious, if they worked, we wouldn't see that pretty much everyone follows this seasonal pattern all over the world, no matter what mediations they take. And if they work last winter, we wouldn't be here. Secondly, they do cause harm for children, especially in terms of development. There's a mental health emergency for youth with emergency department visits for mental health emergencies up 24% for kids 5 to 11 and 31% for those 12 to 17. And finally, we've glossed over the fact that, this is a free country and people should be able to choose. That's not a minor point. I mean, this is maybe something that, others choose to want, and what was forgivable in March 2020, not so much anymore with what we know. So thank you again, urge you to vote no. And also to dig into the data more, as has been mentioned elsewhere. I think there's really a lack of really sort of informed data. So again, thanks again for all the attention today.
Thank you, Mr. Roy. Next, we have Dana Schultz. Ms. Schultz, you may unmute yourself, state your name and address for the record, and you may proceed.
Hello, my name is Dana Schultz, Shawnee Court, Millersville. And before my time starts, I want to note for the record that I'm opposed to the shorter time. I had 2 speeches prepared. I'm also opposed to Dr. Marcosi. I'm vehemently opposed to, he implied that you are a terrorist if you don't wear a mask. See something, say something. I'm a combat war veteran, wife of 26 years, and mother of 3 children. A single solution is not the answer, especially if people have natural immunity from previously fighting COVID-19. Stop feeding into mass formation, hysteria, and anxiety. Provide information and support for air filtration, nutrition, monoclonal antibodies, exercise, vitamins, antiviral medication, community education, and emotional support. Masks failed. They don't stop COVID. They never stop COVID. They could not stop COVID. The highest quality studies show inefficacy and have for generations. Masks do not prevent viruses. Masks are not intended to prevent viruses. The Robert Koch Institute study in Germany shows there is 0 curve separation even from N95 masks, 0. Masks have become a literal addiction, similar to mass formation or following the herd mentality. Mask hysteria has taken over science and logic. Masks are not some harmless precaution. They alienate, isolate. They're a symbol of fear, abnormality. It breaks human contact, communication, empathy, and community. These all lead to stress. They are not helping. It's more needless damage, and it's time we said no more. Masks are harmful to children's ability to learn. The Brown University study concluded that wearing masks is blamed for a disturbing 23% fall in young children's development and cognitive test results. Give parents their right to decide. AACPS qualified for over $50 million because of the masks.
Ms. Schultz, your time has expired. Please conclude your remarks.
Mandates are not necessary for a virus with a 99.95% recovery rate. We don't need to turn into Australia and give over our power the way Dan Andrews has clutched his power. Social determinants can be improved, which will improve our COVID outcomes. Vaccines present risks. The VAERS, Vaccine Adverse Event Reports, clearly illustrates
has expired. Thank you very much. Andy Lazarus, you may unmute yourself, state your name and address for the record.
Madam Chair, I don't see that Andy is unmuting himself or able to. I can again suggest that *6, but that's about all I can do to help here. Here we go.
Hello.
State your name and address for the record. We can hear you and go ahead and proceed.
Wonderful. My name is Andy Lazarus, 1414 Oak Bluff Road in Edgewater. I am a physician. I know you heard from experts. I don't believe the word expert because for every expert who says one thing, you could find 3 experts that say something else. So I guess I would be an expert too. I'm either the doctor for or the medical director of virtually every large assisted living facility in Anne Arundel County. I've treated hundreds of people with COVID. I've written 2 scholarly books on COVID. I am Baltimore Magazine Doc of the Year 2 years running. So I do have a lot of expertise on COVID. I will tell you, in all our facilities, we have had a mask mandate since March of 2020. Despite that mandate, COVID runs wild in these facilities. We are told the mask will protect people. It does not protect anyone. Every single one of my patients, which is probably over 500 now, caught COVID from someone wearing a mask, usually 2 masks, shields, gowns, people who have been checked their temperature. And because of this, we have not been able to get a policy that actually helps. And I've talked to the governor, I've written to him, I never get responses, that we need rapid daily testing in long-term care. Your doctor experts, what they don't acknowledge is the people going into their facility who are most vulnerable, my patients, all caught it through a mask. And they were given false assurance that these masks work. And the governor's response is, we don't need rapid daily testing because we have masks, even though every wave of COVID has occurred through masks. We're dealing with hundreds of people right now in my facilities with COVID, despite this mask mandate. So it's a complete fiction that masks work. We have the evidence in long-term care, 350,000 deaths in this country, despite mask mandates in these facilities. 350,000.
Time has expired. Please finish up your remarks.
I just want to say one last thing. There are no randomized trials that show mask work. The only ones are observational trials that can be picked and chosen at will. And they also show that driving a Prius will lower your risk of getting COVID too. So don't believe the experts. Reality is very different, and a mask mandate is not only useless, but it prevents us from doing what's right to protect the vulnerable people.
Thank you, Mr. Lazarus. Next, we have Shannon Ledbetter. State your name and address for the record, and you may, and unmute yourself, and you may have the floor.
Good, check to see if it was afternoon yet. I almost said good afternoon. Good morning. My name is Shannon Ledbetter. I'm at 1725 Mayfair Place, Crofton, Maryland. We aren't here today because we are debating the pros and cons of masking or whether or not it works. The bills that are at stake are about mandates and emergency powers, not the benefits or negatives of masking. We're discussing whether or not government has or should take the power to mandate masks and take further emergency control of our community and citizens' lives. It should be clear at this point that many of our citizens do not trust our government because over the course of the past 2 years, government has broken the trust by prioritizing the harm of COVID over the very real harms that are now on the rise in our county: depression, anxiety, suicide, education loss, economic loss. In his December 28th press conference, the county executive was asked why he isn't instituting a vaccine mandate for county employees. He answered that the public health experts have advised him that when you mandate personal health decisions, you inevitably get counterproductive pushback that leads to non-compliance. I'm not sure why these public health experts weren't asked to speak today, but I urge you to take their advice to heart when considering mask mandates and acknowledge the broken trust between our government and citizens as a result of the harms of the last civil emergency that was declared. My 96-year-old, fully vaccinated, boosted grandfather, who wears his mask everywhere, is recovering from COVID. My grandfather was very scared during his illness and many times wanted to go to the emergency room just to be able to talk to a doctor. We were able to keep him from doing this by talking to friends who are nurses, who helped us provide effective care at home and learn what warning signs would suggest a trip to the emergency room could actually be needed. Instead of mandates and civil emergencies, what our government could consider are ways to get information and resources in the hands of citizens to help them understand how to provide self-care.
Please conclude your remarks.
Mandates and civil emergencies are not only government overreach, they are not the answer to our current challenges. Please vote nay on both bills today. Thank you.
Thank you very much, Ms. Ledbetter. Next, we have Virginia Kolakowski.
Hi, I'm Virginia Kulikowski, Annapolis, Maryland. I wanted to start by saying repeating the same thing over and over again, expecting a different result, is the definition of insanity. And I believe that's what we're doing by instating another mask mandate. Dr. McCullough, a world-renowned doctor, cardiologist, epidemiologist, and lead author of the first paper on early COVID-19 outpatient treatment, he stated masks are illogical and the data does not show them to be effective. The virus is too small to be blocked by most masks. I also wanted to back up Dr. Lazarus, who spoke out. I've heard him speak before, and he went into some things as well in his talk at Howard County, that masks, there is a downside. Masks deceive people into believing they are protected, and then they tend to ignore other precautions. We need to consider the people from lower economic status who cannot afford new masks for every day. Most people don't wash their masks or keep their hands off them. This causes more problems and sickness. We do not know the long-term damage that masks will cause. Some clinicians have discussed there being an uptick in lung cancer in the future as a result. Masks give people perception that they can control getting the virus when they can't. By instituting a mask mandate, then we are relying on a non-scientific approach to a virus that is not shown or has shown that it is not stopped or slowed by masks, especially in vulnerable populations. In fact, not only are long-term care facilities with mandates seeing an upsurge of cases, but so too are schools with mask mandates. So how then does one think that a mask mandate will help when it clearly doesn't? Thank you.
Thank you, Ms. Kulikowski. Next, we have Diane Burnham. Ms. Burnham, state your name and address for the record, and then you may proceed.
Diane Burnham, 134 William Chambers Jr. Drive. I'm calling, and the doctor that she just mentioned, I listened to yesterday, Dr. Robert McCullough, and a virologist that she couldn't remember what it was. And Dr. Ronan, Dr. Robert Malone, all these are suggesting that we use therapeutic medications. I just wanted to also mention Dr. Morzesi, where any of his patients are children, all of them, and they have had heart attacks, they're emotionally upset, and my most important thing right now is children. This is totally wrong. It's an airborne virus. Masks do nothing except restrict normal breathing and have children in school paranoid about getting sick. They are the least likely to suffer from this virus. Shots only keep you from becoming more ill than you would without it. Personally, my grandson had 2 staph infections due to the fact that he had to wear his mask in class, and his glasses constantly fog up. And now he is getting headaches because he can't see because of this eye strain from breathing his own air. And of course, constantly being yelled at to pull his mask up while teachers have theirs down. That is about all I wanted to say. Everybody already knows that the mask has not worked, hasn't been working. And I am asking you please to be reasonable and not vote either one of these in. And I have sent information to my representative so that he can follow through with anything else I wanted to say. Please have a great day. Happy New Year. I hope we all have a great year without suffering through this once again. Goodbye.
Thank you very much, Ms. Burnham. Next, we have Bill Love. Bill Love, state your name and address for the record, and you may proceed.
Hi, my name is Bill Love of 490 Fair Oak Drive, Severna Park. Shame on the council for not having expert opposing view. Also, our Constitution was not written by Vulcans of Star Trek. Masks are ineffective for the purpose claimed by the mandates, are potentially harmful, and are only authorized for use by EUA. Wearing a mask to prevent catching SARS-CoV-2 or similar sized influenza is like throwing sand through a chain link fence. It doesn't work. The fact is, after reviewing all the studies worldwide, the CDC found no reduction in the viral transmission with the use of face masks. There are proven microbial challenges as well as breathing difficulties that are created and exacerbated by extended mask wearing. Requiring anyone to wear a mask sets the stage for contracting any infection, including COVID-19, and making the consequences of that infection much graver. In essence, a mask may very well put us at increased risk of infection, and if so, having far worse outcome. Informed consent is required for investigational medical therapies. Mask use for viral transmission prevention is authorized for EUA only. The law is very clear. It is unlawful to conduct medical research, even in the case of emergency, unless steps taken to secure informed consent of all participants. Furthermore, by requiring everyone to wear a mask, you are promoting the idea that the mask can prevent or treat a disease, which is an illegal, deceptive practice. Therefore, Council, please vote no on both ordinances. Thank you for your time.
Thank you very much, Mr. Love. Next, we have Amy Frondoso.
Madam Chair, sorry for the interruption. There is an individual here we've tried, I think, once or twice. I wanted to maybe see if we should give her another chance to give her testimony.
Okay, that would be fine.
Okay. Becca is her first name, I believe. There we go.
Hi, yes, good almost afternoon. My name is Rebecca Robison. Thank you, members of the County Council and guests. I'm 1018 Magathy Ave, Arnold, Maryland. As a resident of this county, mom of three, I work in retail in Annapolis. I wanted to shed light on us approaching the 2-year mark in this pandemic. We now know a great deal. Once fearful, we have a vaccine, peace of mind. End all be all? No, but a great deal of help. We are nearing the endemic as this surge makes way. Notes to consider. 1, many were already masking. Number 2, adults do not need to be told what to do. People are done with government overreach and hypocrisy. Perfect example here today. Paid lobbyists from Maryland Hospital Group speaking in regards to suggesting mandates, presenting Stuart Pittman's case for more. This all trickles down and leaves our kids in this county, ages preschool to college behind a mask. Dr. Marguerite Grisez-Brisson, MD, PhD, neurologist, neuropsychologist, and I could go on with her accolades, saying, number 1, the delusional madness of forcing children to wear masks blatantly ignores the expert warnings. The child needs the brain to learn. The brain needs oxygen to function. It is that simple. The well-known doctor warns of a tsunami of dementia years down the road because of deprivation from wearing masks today. I could go on quoting the doctor on effects of the re-inhalation of our own air, but I will pivot to a personal story. I accompanied my son on a field trip in the fall. I can speak from personal experience as a former teacher. It was saddening. It was eye-opening, noticing the difference in communications between children with masks versus pre-mask days. The damage to children and society has occurred. Now it is up to us to stop it, to give the choice, to let them grow as they should, to cease mandates.
Robinson, your time has expired. You can please conclude your next sentence.
And that was it, to cease mandates. Thank you.
Thank you very much. We will go back to, do we have Amy Frondoso? Yes, I see her name on my screen. Ms. Frondoso, you can unmute yourself, state your name and address for the record, and you may proceed. And what's that star? I'm sorry, I should know it by now.
It looks like we might need to do *6 here.
*6.
Hello? Hello?
Yes, we can hear you.
Okay.
You may proceed.
Hi, Amy Frondoso, Arnold, Maryland, and I oppose 6-22. What is a leader? The etymology of leader is to go before they guide. I ask then, are you being a leader or are you the one that is being guided? Because As leaders of the people, before allowing the voices of those that surround you to fill you with their beliefs, I ask you to listen to the voice within. As leaders of the community, I ask you to listen to that small voice that guides. Be in the feeling and knowing that your decision will be affecting the livelihoods of the same people that are responsible for the security of your livelihood as an employee for we the people. I trust that you have done the true research outside of what the mainstream media, lobbyists, and bought scientists and doctors have instilled. I trust in the leaders that were chosen by we the people, that you are educating yourself with all the available information instead of just a narrative. As a health practitioner, I took an oath to do no harm, and it is taken to heart. As a government official, I would expect that the oath that you have taken to support the Constitution is taken to heart as well. Let's educate opposed to a mandate. Let's educate the people to take zinc, vitamin C, and D, build the immune system, exercise, eat healthy, get plenty of sunshine, breathe fresh air, laugh, and love. Opposed to mandate a mask that stifles the mechanism of what breathing does. Breathing in our own carbon dioxide creates an environment that leads to increased respiratory rate, tachycardia, cardiac arrhythmia, and impaired consciousness. I trust that you already are aware of this. I ask that you honor your oath of the 14th Amendment. Give us the liberty of justice in regards to masks. If you trust a mask protects you, wear it. Give the same respect for those that choose not to wear a mask. They are trusting in their feelings.
Please conclude your remarks.
Okay, I'm done. Thank you.
Thank you very much. Next, we have Tina Belford. State your name and address for the record, and you may proceed.
Hi, Tina Belford, Bartell Avenue in Linthicum. Can you hear me?
Yes, we can.
Thank you. The overwhelming majority of testimony given a few nights ago at your meeting speaks volumes to how your constituents feel about mandates. Despite the last minute change to the agenda that did not allow people to speak specifically about mask mandates, it still was abundantly clear where people stand on this issue, and the same can be said of the testimonies this morning. Of course, there are a few that feel that mandating masks will somehow rid our county of COVID, and they should continue to wear masks if they truly believe they work. For the rest of us, we feel it has been tried, it has failed, and now even the experts are in agreement. Masks do not prevent spread of airborne viruses unless they are properly fit-tested N95 respirators. That means that even N95s are not effective unless they are fit-tested properly. Please stop giving people a false sense of security by promoting the idea that a cloth mask or even a surgical mask is preventing the spread of an airborne virus. I have emailed a notice posted in local healthcare facilities that references the new CDC guidance for healthcare workers. You'll note that it states we are able to work with a positive test while wearing an N95. Why would they specify wearing an N95 if cloth or surgical masks were effective at preventing spread? I'm sure the latter are much cheaper. At this point, what your constituents need is to be reminded to fear not, because the worst is behind us. This coronavirus has mutated into a strain that is much more mild than the ones we've experienced in the last 2 years. We now know so much more about the transmission and prevention of severe illness from this virus. And one thing we know in hindsight is that mandates, lockdowns, and closures did a lot of harm, especially for our youngest Anne Arundel County citizens. Please do not put a mask mandate in place. As you've heard, this is dividing our community. It is absolutely unnecessary, and it is insulting to those of us who have been perfectly capable of making responsible decisions for ourselves. We have been tolerant of so much, but enough is enough. We are through with the micromanagement and psychological manipulation that has come from our elected officials. And not to sound harsh.
Expired. Please conclude your remarks.
Just like to say, not to sound harsh, but if you are not appropriately representing your constituents, you will be replaced with someone who does come November. Thank you.
Thank you very much. Next, we have Patricia Brightwell. Ms. Brightwell, you may unmute yourself. Yeah, state your name and address for the record.
Patricia Brightwell, 2995 South Haven Drive, Annapolis. Thank you so much for the opportunity today. I'm so grateful for the way that our country works, and that we're able to share and have input into this very important discussion that's affected our country for 2 years. I thank you so much for all of the people who have testified today. It is disheartening to see that we had 3 expert witnesses, but no witness for the opposing view. We heard many wonderful things pertaining to the therapeutics, the medications, how it's affecting our children, their mental, their emotional state, these masks, how it's affecting immune systems, fresh air, sunshine. And so I just wanted to bring something a little bit different and read something I found online from a pulmonologist pertaining to breath, the breath cycle. Your respiratory system works hard, logging 20,000 breaths daily. Respiratory muscles are working every minute of the day, every day of our lives, says Dr. James Hoyt, a pulmonologist with UC Health Pulmonology Clinic from Fort Collins, Colorado. Our respiratory muscles don't have the luxury of being out of shape. To better understand how our system works, our respiratory system works, first picture a tree. The trachea or windpipe is like the trunk of the tree, Hoyt said. From there, the airways divide and divide like branches of a tree. At the end of a tree's branches are leaves. Similarly, the ends of the bronchioles have air sacs where gas exchange takes place. In the air sacs, freshly inhaled oxygen is passed to the blood. I'd like to repeat that again, please. Freshly inhaled oxygen is passed to the blood.
Ms. Brightwell, your time has expired. Please conclude your remarks.
Oh my, boy, that went by fast. And the point is that, and at the end of the sacs, the carbon dioxide comes out of our breath. And so when you have a mask up to your face, you're breathing in the carbon dioxide. I know that's been stated, but I was going to ask everyone to do the exercise and breathe in fresh air and see the difference. If you put just your hand up to your mouth, you can see the difference. And I just want you to think about that, what that's doing to our children, to their health.
Ms. Brightwell, your time has expired.
Thank you very much.
Thank you very much for your testimony. Mr. Volke.
Thank you, Madam Chair. Nathan Volke, District 3. As a point of order, and I guess also to understand, I'll probably make a motion on this. It's now past 12 o'clock, meaning that the state of emergency in Anne Arundel County has expired as declared by the county executive. My understanding is that now means that Bill 7-22 is moot, considering that there is no state of emergency for the county council to extend. So my motion, provided that that's correct understanding, would be that we end testimony on Bill 722 and simply concentrate testimony on Bill 6-22, because that's the only one that is still ripe and in front of the council. So that would be the motion.
I believe this would be a question for our Office of Law. Go ahead, Mr. Barron.
I'm happy to let Pete Barron with the administration, happy to let the Office of Law opine as well. We will have an amendment if the council decides to move forward on 7-22 that would tweak the language to make sure that it would still work. And Mr. Swain is able to speak more if needed. So I wouldn't say it's moot, Mr. Volke.
Greg Swain, County Attorney, that's correct.
All right, thank you, Mr. Volke.
Sorry, thank you, Madam Chair. Nathan Volke, District 3 again. So I guess to follow up, Mr. Swain, then can you clarify how it is that under the code, under section 1-6-104, that we're able to extend a state of emergency? Because my reading, it's pretty simple. Proclamation of civil emergency or executive order may not be effective for more than 7 days unless authorized by ordinance enacted by the council. So we would have to extend the state of emergency. That's the natural read of that. If the state of emergency is expired, there's nothing left to extend. So I don't understand how we can amend the bill to fix that. So maybe some clarification there would then alleviate the need for a motion.
Right, the amendment, Greg Swain, County Attorney, the amendment would be retroactive. So because it is council action, it would be able to address the state of emergency, even though it is now expired. but because the bill would be retroactive to prior to noon, it would address that issue.
Thank you. Ms. Fiedler. Or did Mr. Swain answer your question?
I believe so. I might have a follow-up.
Okay, Mr. Volke, I also want to just point out we're so close to the end of public testimony. I hate to have the folks that have been waiting the longest continue to wait because we really have about 20 folks left, or 20 and change folks left. Go ahead, Mr. Volke.
Thank you, Madam Chair. I agree with you, and I don't want to belabor this point, but I simply at this moment would make that motion that I referenced. So I'd make a motion that the council end the debate or the public testimony on Bill 7-22 in light of the fact that we're no longer under a state of emergency, and continue on with testimony on Bill 6-22. So that would be the motion I make in front of the council.
Is there a second on Mr. Volke's motion?
Fiedler, second.
Thank you, Ms. Fiedler. Madam Secretary, please call the roll.
Mr. Volke?
Aye.
Mr. Pruski?
Nay.
Ms. Fiedler?
Aye.
Ms. Hare?
Aye.
Ms. Lacy?
Nay.
Ms. Pickard?
Nay.
And Ms. Rodvian?
Nay.
4 in the affirmative, 3 in the negative. The motion has failed.
All right, thank you very much. Let's see, going on, I believe our next speaker is Kurt Svensson. Mr. Svensson, state your name and address for the record and you may proceed.
Kurt Svensson, Arnold, Maryland. Sorry, it's been a long day. Wow, that's the gang of 3 is at it again. Woo! Good work there, guys. As adults and citizens, we have a responsibility to set an example for our children. These are the words I want to emphasize in my 2 minutes. Humility, to admit that we don't always know for sure. I don't hear anybody saying masks are 100% preventative. Caring, to place the well-being of others above our own interests. I see wearing a mask as a symbol of caring, not fear. I see people describing about how you're gonna die from not being able to take in oxygen as fomenting fear. Faith in our fellow human beings, not assuming they're conspiring against us. Leadership, to understand some actions are more important than just trying to be reelected. Sacrifice, to temporarily give up some liberty in return for hope in the future. The collision of individual rights and the common good is as old as our republic itself. In the words of Henry David Thoreau from his work, Civil Disobedience, I heartily accept the motto that government is best which governs least. Carried out, it finally amounts to this, which also I believe, that government is best which governs not at all. And when men are prepared for it, that will be the kind of government which they will have, end quote. Based on what I've seen and heard from my fellow citizens, we are not prepared for that. For this reason, I support Bill 622 and the necessary role of government in society.
Thank you very much.
In Anne Arundel County, we just lost 5 citizens 24 hours ago. Thank you.
Thank you, Mr. Svensson. Let's see, our next speaker is Clinton Hardnett. Mr. Hardnett, you can unmute yourself and state your name and address for the record and proceed.
Madam Chair, I don't see that it's working.
Okay, we can maybe try and circle back to Mr. Hardnett. Next, we have Katrina Atzinger.
Hi, good morning. My name is Katrina and I live on Lockwood Court in Annapolis. And I'd like to thank you, honorable council members, for considering this important topic. I'm a mother of three daughters, one in elementary, one middle, one high school, and therefore a credible source for you to hear from on the subject of face coverings and their extreme negative social, educational, and psychological impact on children. Dr. Wieneman, our partisan quote-unquote expert, masks are intrusive, masks are dehumanizing, and they fail completely in a fair cost-benefit analysis. I'm also a teacher in higher education. I have first-hand experience on how the mask negatively impacts my ability and my students' ability to communicate and build life-giving relationships. Regarding Bill number 622, we are no longer in a catastrophic health emergency, so named in 2020. We have vaccines, therapeutics, we can take dietary supplements, and we know that Omicron exhibits with mostly mild symptoms. The Omicron variant has spread indiscriminately in places with or without face covering mandates, showing that commonly worn cloth face coverings do not stop the spread, and this proposed action is an inappropriate response to an inflated idea of what constitutes a health emergency. Regarding Bill 722, it is a total mischaracterization to call the spread of this current variant a civil emergency and a threat to public peace, health, safety, welfare, and property. And therefore it is inappropriate to extend disproportionate executive powers. So I urge the council members to vote against these proposals. And I thank you very much for hearing me on this very extended meeting. Thank you very much.
Thank you very much, Ms. Atzinger. Next, we have Seth Winnick. Mr. Winnick, you may state your name and address for the record after you unmute yourself. You may proceed.
Good afternoon. Can you hear me?
Yes, indeed, we can.
Thank you very much. My name is Seth Winnick. I live on State Street in Annapolis. I have chronic leukemia. I'm being treated at the University of Maryland Medical Center in Baltimore, and I'm doing very well. However, both my cancer and the drugs that I'm taking to beat it have compromised my immune system and weaken or nullify the effectiveness of COVID vaccines. So while I'm fully vaccinated and boosted, I remain highly vulnerable to COVID. At the beginning of the pandemic, chronic leukemia patients infected by the coronavirus suffered a 30% mortality rate. With better treatments, the mortality rate has gone down to about 10%, but I'm sure you will agree, those are still lousy odds. Nearly 3% of Americans, over 10 million people, are immune compromised. We make up over half of the fully vaccinated COVID patients who are hospitalized. In Anne Arundel, about 17,500 citizens are likely immune compromised. Mandatory public masking is the best way to stop this variant and to protect the vulnerable. In closing, I'd like to urge you to extend the mask mandate and the state of emergency in our county. For the immune compromised and for other vulnerable citizens, the Omicron variant is not like a bad flu. It's like a game of Russian roulette. Please protect us. Thank you.
Thank you very much, Mr. Winnick. Next, we have Christine Hunt. Ms. Hunt, you can unmute yourself with *6, I believe. Oh, there you are. And state your name and address for the record. And you
hear me okay? Yes, I'm sorry, I'm driving, but I'll stop. My name is Chris Hunt. I live on Doxford Drive in Crownsville. And I feel as though it's a myth that masks prevent viruses from spreading. Science is supporting that standard cloth and surgical masks offer next to no protection against virus-sized particles and small aerosols. The size of a virus particle is much too small to be stopped by them. Just as an example, a single virion of SARS-CoV-2 is about 60 to 140 nanometers, or 0.1 microns. The pore size in a surgical mask is 200 to 1,000 times that size. And if you consider that the CDC website states, quote, surgical masks do not catch all harmful particles in smoke, end quote. Okay, that's smoke. The virus size, the size of a smoke particle in a wildfire is 0.5 microns, which is 5 times the size of the SARS-CoV-2 virus particle. So wearing a mask to prevent catching COVID or any other kind of influenza just doesn't work. There has been one large randomized controlled trial. There are many more, but this is citing the one that specifically examined whether masks protect their wearers from the virus. This study found that mask wearing, quote, did not reduce at conventional levels of statistical significance the incidence of SARS-CoV-2 infection, end quote. This particular study was published in the American College of Physicians journal called the Annals of Internal Medicine. So this is just one example. I submitted a testimony yesterday, so you can look it up, Christine Hunt. There's a lot more documentation and studies that have been done on this. But basically, it just shows that masks are ineffective and negates the need for them and the mandates that you were considering. So hand washing has been shown to be one of the most effective means of preventing it. I encourage you to vote against these mandates and to, again, as some people have stated.
Your time has expired. You may conclude your remarks.
Yes, to continue promoting preventative measures and other measures that are not being used but are more effective. Thank you.
Thank you very much, Ms. Hunt. Next, we have William Simpson. Mr. Simpson, you may unmute yourself, state your name and address for the record. You may have the floor.
452 Royal Beach Road in Pasadena. I am vehemently against both of these mandates. It is unnecessary for we humans to walk around like little zombies with little masks on. And the socialization of humans, specifically the children at such an early age, going on 2 years, has gotten to the point where it's absolutely ridiculous, and there's been speech impediments on these younger children. As far as anyone who wants to wear a mask and thinks it's protecting them, that's their business. We don't need to be dictated to about wearing masks, eyewear, but we do have to understand, we don't want people sneezing on us. We don't want people coughing on us. And wash your hands before you touch your eyes, your nose, and your mouth. I mean, that's what it's been since the beginning of the common cold, the flu, and it's caught the same way. It is totally unnecessary to be masked up, and we don't need to be dictated to. Thank you.
Thank you very much, Mr. Simpson. Next, we have John Ryan. Go ahead, Mr. Ryan. Unmute yourself, state your name and address for the record, and you may proceed.
Yes, can you hear me?
Yes, indeed. Go ahead.
Okay, thank you. Just want to thank you for the opportunity to speak with the council today. My name is John Ryan. I live in Crownsville, Maryland. I'm here today to voice my opposition to Bill 622 and 722. I just want to say that the groupthink knee-jerk reactions that may make us feel that we are doing something in the right direction, but really in real life are placing undue burdens onto society. We need to ask if the science is really there to support the mass usage. We could all cite examples both ways, and we can both all cite examples from both the CDC and other experts on both pro and con masks. Now, if it was proven that wearing a mask drops the transmission rate to 0 in 2 days, that may be a good strategy, but it doesn't. So policymakers, we need to ask that you look at the big picture. Well, it may seem like the right thing to do because we all want to do something. We have to look behind us in the wake of these decisions to see what is really happening on the streets. Putting face coverings on our humans is not normal. Just ask any parent with small children how hard it is to keep the mask on their child. You will see that the masking humans is not in our nature. This masking of our identity leads to many other serious conditions which are not getting the attention they deserve. Depressions, drug use, suicides are all up. Living in constant fear, business shutting down, unemployment, and who else knows what the long-term impacts these policies are having on our youth. It is easy for us to work from home and are not really affected by these mask mandates, except for a few minutes to go to the grocery store, to go ahead and think these are a good idea. But what about those persons who work in the retail centers for 6, 8, 10 hours a day wearing improperly fitted, dirty, and usually unsanitary masks? We need not to be putting our working class at a higher health risk just to say we're doing something during the cold and flu seasons. This also pertains to our school children as well. If persons wish to wear the face coverings and or get vaccinated, that they are free to do as they choose.
Mr. Ryan, your time has expired. Our next speaker, thank you, Mr. Ryan. Our next speaker is Cynthia Bolin. State your name and address for the record and you may proceed.
Hi, can you hear me?
Yes, we can.
Perfect. My name is Cynthia Bolin and I live on Narragansett Avenue in Annapolis. I thank you for holding this emergency session since we are indeed in a state of emergency. I'm here as a concerned county citizen, parent, trained school psychologist, and current nursing school student. I'm here to ask you to vote yes on the mask mandate for Anne Arundel County. At this point, we must do everything we can as citizens to slow the spread of COVID-19. Our hospitals are filled beyond capacity and operating under crisis standards of care. The healthcare workers and their patients deserve that we take every reasonable precaution to stop the spread of COVID. Dr. Mercosi has asked us to fight with our healthcare workers, and I think they deserve our support on their side. I hear questions and conversations about when won't we need masks, and they feel insulting to those folks living on the front lines daily. It seems they're asking very little of us. No one enjoys wearing a mask, but that's irrelevant. Many testifying here have cherry-picked random situations to support their point of view, but there's no reason to do that. We had outstanding medical experts and medical leaders share that a mask mandate would slow the spread of COVID-19. These experts weren't selected to prove a one-sided theory. They are chosen because they are the leaders of our 2 county hospitals. It seems there's no better expert to listen to. Some here have stated higher case rates in counties requiring masks as evidence that they aren't having an impact, but that's not how statistics work. We can't measure how much higher cases would have been in those counties requiring masks. That's the tricky thing about public health measures. When they work, we never know exactly how many cases they prevented. But the data in peer-reviewed medical journals is clear that masks help prevent the spread of COVID-19. Additionally, our students, including my own 2 sons, are currently in Anne Arundel County Public Schools. In order to keep students in schools, we have to do what we can to slow community spread, including wearing masks. The folks yelling loudest about keeping our students in person should also be the same folks advocating for wearing masks and a mask mandate. While some opine about mental health and child development, I'm here as an expert in mental health and child development to say we owe it to our children to do what we can do in the community to keep schools open. Please enforce a mask mandate.
Thank you very much, Ms. Bolin. Next, we have Bobby Howard. Bobby, you may state your name and address for the record and proceed.
Hi, Bobby Howard from Edgewater, Maryland. I have been in Anne Arundel County for more than 30 years. I am vehemently opposed to both of these bills. It has been proven, though the media would not allow much to be said. I appreciate those who have expressed opposition here today. The masks do not slow the spread. That's been proven. The county called 3 doctors that agree, but none that opposed. I find that very biased. And a mandate is not a law. So the fact that this council is trying to propose a bill for a mask mandate, I believe is against, it's not only unjustified, it's not only immoral and ineffective, but illegal. A mandate is not a law, and a mask mandate has not been put into place by Hogan because it's not appropriate to do it. It's against our civil rights and against our Constitution. Thank you very much. I hope that you all will consider the truths that have been spoken here and the facts, and the fact that a mask mandate is not a viable option. It is not a legal option, in my opinion, based on the information that I have received. I vehemently oppose these bills. Thank you.
Thank you very much, Ms. Howard. Before we go on to the next speaker, I just want to clarify something that's been repeated in a number of pieces of testimony. I'd like to just clarify that the hospitals, our local hospitals, reached out to the council. We did not reach out to them. And when they expressed an interest in sharing some information about the status of the hospitals, we accommodated them. So this was not at the request of the council. This was at the request of our local hospitals. All right, going on, our next speaker is Chris Ronk. Thank you, Mr. Ronk.
Ms. Ronk.
I'm so sorry, Ms. Ronk.
Thank you. Chris Ronk, 851 Buckingham Cove Road, Severna Park. I'm in Council District 5. Members of the County Council, I am appreciative of all the effective, factual testimony opposed to the mask mandate and the state of emergency declaration. I wanted to comment also that, and I'm disappointed that there weren't highly educated epidemiological medical experts to speak with an alternative viewpoint. The County Council could have requested medical people to speak with an alternative viewpoint. I am strongly opposed to both County Council Bill 622 and 722. These mask mandates do not protect the public, and masks have been proven time and again to not reduce the spread of the Wuhan virus. The latest mutation of the virus, Omicron, has been documented to be very contagious but less serious, causing less stays in hospital ICUs, and there hasn't even been mention of patients needing respirators. In fact, Luminous Health, formerly Anne Arundel Medical Center, is urging patients to go to local urgent care or their family doctor for testing and treatment, or of course to use an at-home test if a person can find one. The ER is very busy, and they are taking steps to direct non-serious patients elsewhere. When County Executive Pittman was granted emergency powers before, due to COVID, there was great difficulty taking this authority away, and it occurred long after the high volume of the virus had diminished. I am opposed to the council allowing the current arbitrary and useless mask mandate imposed by County Executive Pittman to be extended even for one more day.
Ms. Ronk, your time has expired. Please conclude your remarks.
I understand that this virus and its various mutations have overwhelmed and frightened people. And I agree that we should remember our hardworking medical healthcare workers, but another ridiculous and useless mask mandate or lockdown imposed by the county will solve nothing. Thank you.
Thank you, Ms. Ronk. Our next speaker is Jose Lebron. Mr. Lebron, you may unmute yourself and state your name and address for the record and proceed. Mr. Lebron, are you there? If you are, you may unmute yourself. Seeing that we are not getting any response from Mr. Lebron, we will go back. We can circle back, but we will go on to our next speaker and our final speaker. Well, before we circle back, Mary Diggins. Ms. Diggins, you may unmute yourself and state your name and address for the record and proceed. All right, hearing or seeing no response or unmuting from Ms. Diggins. Madam Secretary, can you see if we have any additional speakers who had signed up that maybe we passed over before that are in the virtual waiting room?
Yes, I can. How about this? I have the names of people that were called and who were mostly not here. We've had 2 or 3 people who have not been able to unmute themselves. If I enable the raise hand feature and your name is called, then you can raise your hand. We can do that real quick. Would that help?
That would be wonderful. Thank you for that, coming up with that approach on the fly.
Okay, so I'm just going to call the names of the people that we skipped over, and if we see a hand raised, Ms. Schultz will enable their speaking. So let's go back to the beginning here. We have Carrie Sellner, Russell Reel, Jaden Ferris, Lena Stinnett, John Morrison, Amanda Burrows, Mark Mazer, Aslam Demiroglu, Hilton Nikithia, Cheryl Thomas.
Lena, I see you. We've got you.
We have Lena.
Yeah, I was going to just say, let's go ahead and go through the whole list, and then we'll come back to any of the raised hands.
Okay.
I just need to let her know that we'd see her.
Okay. Cheryl Thomas, I think I might have said that. Margaret Coder, I'm sorry if I'm not pronouncing names correctly. Diana Betts, Michael Marge, Janine Daly, Catherine Bellotti, Amy Reel, Rhonda Sterling, Jonathan Barnes, Caroline Greiner, Michael Dodd, Tom Cole, Mary Kavanaugh, Ravinder Sahani, I again apologize if I've mispronounced that, Dee Corey, Ben Brewster, Juliet Murphy, Quentin Hardnett, Melissa Eidelman, Michael Brown, Randall Maynard, Kessia Petty, Brian Mueller, Davey Sachs, and finally, Kristen Clark.
It appears Ms. Stinnett is the only one remaining. So Ms. Stinnett, you will get the final word in our public testimony today. You may unmute yourself, state your name and address for the record, and you may proceed.
Saving the best for last. Hi, everybody. My name is Lena Stinnett. I thank you so much for having this emergency meeting today. I live at 8124 Edgewater Road in Orchard Beach, Maryland. I am adamantly opposed to the proposition. Cloth masks are face decorations per Dr. Leona Wen last week on CNN plus the week before. And you said that we weren't going to require surgical masks or N95s. As many people before me has said, the amount of microns, I'm not, up on scientific words, but the droplets are too large to even be protected by even a surgical mask. Even the N95 masks do not protect against 0.1 particles. And then Dr. Berry, of course, said, bend the curve. Didn't we already play this game 2 years ago? I mean, bending the curve, flatten the curve, whatever you want to call it. And we're not talking about the mental health, perpetuating the fear of going out in public, scaring kids that this is never going to end. I know so many children right now that are suffering, that don't want to put the mask on, that are and mental health issues, even in adults. This is going to cause a spike in crime, violence, things like that. Things are getting kind of out of control. Our mental health, everybody's mental health. I completely respect the healthcare workers. I respect what they're doing, but they also fired a lot of people for not participating in being vaccinated. So that right there will overwhelm your healthcare system. And I just want to say the Nazis made the Jews wear pieces of flair. So I'm really excited that 100 years later, this is where we are. Thank you very much. And I oppose this. Have a great day.
My apologies. we have, I understand that we actually have 2 additional speakers. Clinton Hardnett, you may have the floor. State your name and address for the record.
Hear me?
Yes, we can hear you. Yes, go
Clinton
ahead.
Hardnett, longtime resident of Annapolis, Maryland. So, there's been a lot of people talking very passionately about what they believe in this on both sides with a lot of backup. People for it with backup that's highly publicized, and then people against it with backup that isn't, but does exist. And I think that what we need to focus on, think about, is where we are in time with this. We've gotten to a point now where it may be relevant to reevaluate some of our assumptions about it because we've crossed certain thresholds. We've gotten to a point where we understand more about the efficacy of different aspects with the masks in particular, and how they haven't shown clear results, and other things like health. And it's relevant that we've gotten to a very high percentage with vaccination rates, and also with people who have had it. So we come to a point in time where we have to look at the fact that we are at a point where the entire population of the planet has been affected by this in a way that we have to accept that it is here and it will be around. And we have to start looking at the future as to how we're going to deal with this long term. And we're still looking at short-term solutions. But I think it's time for us to go ahead and move forward as a society and start to look at the long-term aspect and realizations that this is going to be with us. And now we have to learn how to live and help our young children, thrive. And just imagine being a child and all of your life wearing a mask at this point, and how that does dampen or subdue the spirit of young, vibrant children and even adults. So we just need to think about that and look to the future more long term than we have been looking at this thing up to this point, because we're in year 2 now and moving into year 3. And I think that's cooler heads need to prevail on it and start realizing that these things
has expired. You may conclude your remarks.
It's a new time that we just need to go ahead and move forward with some new ideas and realizations. Thank you for letting me.
Thank you very much. And now we've got Brian Mueller.
Yes, can you hear me?
Yes, state your name and address for the record, and you may proceed.
Brian Mueller, 7477 Wiggly Avenue, Jessup, Maryland. I also have property over in the Glen Burnie area, so Mr. Volke knows me. Obviously, as everyone discussed, either for or against masking, I think it should, it's been a while that this has gone on. Make it not more the public's own interest. If companies or businesses want them to wear masks, make them wear it. If you're afraid of getting it due to whatever concerns, you can wear it on your own opinion or option. But as we continue to push it, okay, if this goes forward and you guys agree that the next 45 days we have to wear masks and COVID doesn't change whatsoever, are we going to stop it completely then with the masks? Or are we going to say, hey, let's give it another shot. That mask will work again. On the, I want to say it's 722, everyone signed up to represent their districts, to actually put forth what they think is right when voting. So why turn over that power to one individual instead of you guys taking what you signed up for and actually voting on everything, instead of just allowing one individual go ahead and push their own agenda without your actual concerns? That's it.
Thank you very much, Mr. Mueller. I just want to check back in with our secretary. Do we have any other folks that raised their hand, or? All right. Then at this time, the joint public hearing on bill number 6-22 and 7-22 is now closed. For the sake of our secretary and our staff who have not been able to take a break, I'd like to take a 15-minute recess at this time. Do I have a motion?
I should read in order to close this out, I need to read the titles of the 2 bills real quick. I think we should just do that.
Let's do that then. Thank you very much. Madam Secretary, please read the titles of bills 622 and 722.
Bill number 622, an emergency ordinance concerning COVID-19 and the use of face coverings. Bill number 722, an emergency ordinance concerning extension of proclamation of civil emergency.
All right, thank you, Madam Secretary. I renew my motion to take a 15-minute recess. Oh, go ahead, Ms. Hare.
Thank you, Madam Chair. Jessica Hare, District 7. Before you make that motion, might we make it a 30-minute recess? I'd like to take a look at the amendment that the administration says that they have and take a look at that legal authority. It might give everyone a chance to do a short bathroom break, and then we could return at about 1:15.
I am fine with a 30-minute recess. I will modify my motion to return at, let's see, it's 12:45 at 1:15, but I see some hands. Mr. Pruski.
Thank you, Madam Chair. I understand some folks have to do some things. I'm willing to do a motion, but 30 minutes for me, I'm not going to be able to be here that much longer. So again, maybe there's a compromise of 20 minutes. I also, again, for the debate, I know we've heard a lot of testimony from the public. Certainly want to make sure we get right to the point because there are people also waiting for votes and other things. So again, I just ask for that consideration.
Ms. Fiedler.
Thank you, Madam Chair. Amanda Fiedler, District 5. I just wanted to confirm that we are going to have an opportunity to ask Dr. K questions since we did not have that at the beginning of the meeting.
Yes, indeed. And I apologize, Ms. Pickard. I saw your hand right after I called on Ms. Fiedler. Go ahead.
That's okay. I don't have an issue with the length of the recess, but we haven't, an amendment hasn't been introduced or shared. So there's nothing I can be looking at in the 30-minute recess. That is something we have to do publicly, correct?
I have not seen an amendment. I've heard that there may be one coming.
Okay, well, that will be introduced at the appropriate time as we're dealing with potentially 722, but we can't be looking at it in a recess. So however long we want to recess, I'm fine.
All right, thank you. Mr. Volkey.
Thank you, Madam Chair. Just to clarify for the benefit of everybody on the council who may not be aware of this, but I've been emailing back and forth with Mr. Swain while we've been here asking for legal authority on the retroactive amendment with respect to 7-22. He's indicated to me that he's sent that to council staff. So I think that we will actually have that during this recess so that we can look at it. I know Ms. Corby's been inundated with what she's doing, so I'm positive she hasn't had a chance to forward it over to us yet. But if we had 30 minutes, that would give us the opportunity to look at that. And then if there is an amendment, we'll at least know what the legal basis from the Office of Law is to discuss that. So I just wanted to share that with everybody as some information if people weren't aware.
Thank you. I will amend my motion to say, let's split the difference and ask for a 20-minute recess. So, and ask everyone to just try and move quickly. Do I have a second?
Elsie Pickard, second.
Thank you. Madam Secretary, please call the roll on motion to take a 20-minute recess.
Mr. Volkey.
Aye.
Mr. Pruski.
Aye.
Ms. Fiedler.
Aye.
Ms. Hare.
Aye.
Ms. Lacey.
Aye.
Ms. Pickard.
Aye.
Ms. Rodvian.
Aye.
7 in the affirmative, none in the negative. The motion to take a 20-minute recess has been passed.
We are adjourned until 1:05. Or excuse me, we're in recess until 1:05.
Madam Chair, we are just putting the finishing touches on a few things here.
All right, thank you.
We may be able to restart the meeting here and start the conversation while we continue to work in the background.
Okay. In that case, it looks like we have 4 members here, so we can get started. I know, oh, we have 5. All right. Good afternoon. This emergency session of the emergency meeting of the Anne Arundel County Council is back in session. Madam Secretary, could you please call the roll?
Mr. Volkey.
Aye.
Mr. Pruski.
Here, sorry.
I understood you. Mr. Pruski. I do see you, Mr. Pruski. Ms. Fiedler.
Present.
Ms. Hare.
My understanding is she will be joining us in just a few minutes.
Yes, I got that too. Thank you. Ms. Lacey.
Present.
Ms. Pickard.
Present.
Ms. Rodvian,
Present.
Ms. Schuett. I can see you as well. Madam Chair, we have 6 council members in attendance. I believe Ms. Hare will be joining, and we have Ms. Schuett here as well.
All right, at this time, I would like to offer my council colleagues the opportunity to make comments and ask questions. And I'll take any flags as they come. Mr. Volke.
Thank you, Madam Chair. Nathan Volke, District 3. I am curious, I guess this is probably a question for the health department if we have Dr. K here. Actually, I'm going to wait on that for a second. What I want to actually ask about is this instead. We just got the amendments that came over from the administration. I see that it looks to be some sort of a retroactive amendment, but I think without getting into the substance of the amendment, I just want to understand from the Office of Law, how is it that we can vote to do anything on a bill that deals with a state of emergency that's expired? So for instance, if we had a bill, as you know, there's a life on that bill and there's a date when it expires. You obviously can't take any action on that bill after the expiration date. I don't understand how we can take action on a state of emergency post the time where the state of emergency has expired. That's kind of my threshold question. I want to know about this bill and why we're even discussing it at this point.
Greg Swain, County Attorney. With regard to the amendment, it's probably more appropriate for me to speak on the amendment once it's introduced.
Can you just speak generally about legal authority to be able to act on a state of emergency post the expiration of the state of emergency without a new declaration of a state of emergency?
Right. Well, with the state of emergency, under code, it extends for 7 days. Under the terms of the executive order that established the emergency, it expired at noon. So if the emergency has not expired per code, it's expired per the terms of the executive order. So I do think that we can act retroactively with regard to the expiration of the executive order because we're still in the 7th day.
My apologies. I was actually looking for the amendment in my email that is supposedly forthcoming. Ms. Hare.
Thank you, Madam Chair. Jessica Hare, District 7. I guess I'll start then with a question for Dr. Kalyana Raman. Maybe you can just help me out at the very beginning here by giving us some of the demographics for the folks in the hospital. I did hear in your initial remarks, you mentioned something about those who are vaccinated making up a very small percentage of it, but could you tell me exactly for the folks that are in the hospital, what the breakdown is of vaccinated versus unvaccinated, boosted or not, their age range, and whether they have any comorbidities?
Absolutely, Councilwoman Nilesh Kalyana, the Department of Health. I want to give you some not broad, but some ranges. There's no exact number, right? That's a moving reality that we keep measuring. What we're seeing is that roughly, at least in our counties, when we last checked the hospitals, this was about 2 or 3 weeks ago, 65 to 70% of folks who were hospitalized with COVID were not vaccinated. Approximately 30% were vaccinated but not boosted. And then fewer than 5%, it depends, sometimes it's 2%, 3%, but fewer than 5% were vaccinated and boosted, typically with severe underlying chronic conditions. And that you'll see general data like that from other states or from other countries. Sometimes it's, it shifts by about 10 or 15% on that vaccinated versus not vaccinated versus vaccinated boosted. But generally, that number of people who are vaccinated and boosted is extremely small and below 5%.
And what about the age ranges?
So the age ranges, I don't have that off the right at my fingertips. But generally, our discussions with the hospitals are that They're seeing a lower age range amongst those who have COVID by a few years. So I don't want to put a number out there and be inaccurate, but they're seeing a slightly lower average age for those with COVID versus those without COVID in the hospitals.
Okay, thanks.
Ms. Fiedler.
Sorry.
Oh, go ahead. Mr. Barron, if you wanted to add something, go ahead.
Just want to remind the council that we had representatives from the hospital here earlier today talking about the volume of patients that they had and the need for the county to take action. Thank you.
All right, go ahead, Ms. Fiedler.
Thank you, Madam Chair. Amanda Fiedler, District 5. I was going to ask Dr. Kay a question, but before we get too far removed from Mr. Swain's response to Mr. Volke, Mr. Swain, you said, I think, in your comments. I don't think I've ever remember you advising us on an I think. What is your level of uncertainty on if we can do this or not? Just trying to understand what section of the code this advice is coming from.
Sure. Greg Swain, County Attorney. It's section 1-6-104 of the code. And what that does, that addresses emergency proclamations. And I said, I think, but what I really should have said is in my opinion, because the statutory time frame for the expiration of the state of emergency has not expired, that it can be addressed retroactively through legislation.
Mr. Volke.
Thank you. Sorry, Nathan Volke, District 3. I'm just trying to gather my thoughts after that. All right. I want to understand from the county administration and or the health department, has there been any consideration, instead of paying roughly $9 million in bonuses to county employees, spending $3.2 million to purchase homeless housing, $200,000 for new equipment for rec and parks, has the health department given any consideration to setting up an additional COVID testing site at Baltimore Washington Medical Center using county ARP money, as opposed to trying to wait for the state to set it up? And why is it that the health department hasn't used the ARP money to open additional sites at other places throughout the county, knowing that that's what our county residents are looking for and what we're continually hearing from citizens that they want?
Pete Barron with the administration. I'll remind the council that the county exec has purchased with ARP money several 100,000 tests. There is, and I'll let Dr. Kay speak to staffing and the ability to stand everything up. We would love to do everything. I think the question before the council here right now is, what are the rules that should be in place to help reduce the spread?
Nolesh Kalyan, Department of Health. So Councilman Volke, we have absolutely considered expanding testing. Couple of items. One, we are going along multiple pathways. As Mr. Barron noted, we spearheaded the purchase of at-home tests, hundreds of thousands, and we were one of the first, if not the first county in the state to push us aggressively into that. Second, on the staffing piece to stand up additional testing, there is no additional staffing. We cannot hire additional people. It's why the hospitals can't expand staffing, health departments can't, and frankly, it's why the governor had to call up the National Guard to expand testing. There aren't additional medical personnel to stand up additional testing sites.
Thank you, Dr. Kalyana. To my colleagues, I think we actually should move forward, even though we had a joint testimony or we had a joint hearing on the two bills. I think we should move forward with the two bills and our discussion of the two bills separately, since they do have slightly different parameters. So for that reason, let's shift our topic to Bill 6-22. And I honestly don't know who is next. Does anyone know who is next? Go ahead, Mr. Volke.
I was going to say, I think Ms. Fiedler was next, but as a point of order, how is it that we can we had a joint public testimony hearing, but now we can bifurcate out in how we're going to discuss these, even though the public discussed them as one, and now we're going to discuss them separately? I don't know if Madam Parliamentarian can weigh in on whether that's an appropriate thing to do once we've combined everything into one big pot.
I believe it's appropriate because we do have to vote on them separately, and they are two different bills with different provisions. So At this point, I would like to proceed with 6-22, and Madam Parliamentarian, feel free to weigh in if you think this is an inappropriate path.
Like yesterday, I think it was, that's a point of order, which you have decided, and so that's it.
All right, yeah, and we have them in the agenda on the agenda in this order, so I believe it's appropriate to discuss 6-22 and 7-22 once we get the amendments, and the amendments, after we vote and such. So let's keep the discussion on 6-22, which I realize some of the questions that have been asked are relevant to both. So go ahead, Ms. Fiedler.
Thank you, Madam Chair. Amanda Fiedler, District 5. I think it is worth noting that the other night we combined 11121 and 11221, both the public discussion and our debate, and then voted separately. This is doing something entirely different. So my question is with regards to this bill, and I'll certainly have the same question, or maybe it'll be answered here for the second bill. Dr. K, right now, and I know that our police department has never been part of enforcing mask mandates in the past. I don't believe that they are currently doing it. I did get some emails from constituents who had reached out to the Department of Health to file complaints, and they were told that the health department right now is not enforcing mask mandates either. And then I went on the health department's website, and the information on mask mandates, I don't see enforcement information. So could you go over what is currently happening as far as enforcement is concerned, how we are enforcing if these bills pass, and the number of staff that will be required to enforce, and what departments they're coming from?
Sure, absolutely, Councilman Fiedler. So in terms of enforcement, it would be what I'll harken back to what was happening at prior times, particularly when we were doing enforcement via phone calls. This is, we've always stated the goal is for people to wear masks, not to have to rely on going out and doing enforcement. So it would be largely by phone. We would get, and we are talking to other agencies in terms of staffing. We don't really know the call volume at this point, so I don't know how to estimate the staffing, but we estimate a couple of 2-3 folks to be able to take calls, provide education by calling back out to those businesses that aren't in compliance. At that time, when we were using that mechanism, we had to make maybe 1 or 2 visits per week out to a business for ones where we're getting repeat calls. But otherwise, we don't anticipate many visits at all to businesses.
Madam Chair?
Go ahead.
Yes.
Go ahead.
Thank you. Dr. K, to your knowledge, would that include the liquor board as was done before for places of food establishment?
We did work with them since they have inspectors familiar with those establishments. And so we would, if there was a establishment with a liquor license, we can certainly talk to them and have them help us. But as I was mentioning at that time, there's only 1 or 2 visits a week that were happening. So it was pretty infrequent at that point. The liquor board was involved in earlier stages of that enforcement effort.
Thank you. Ms. Hare.
Thank you, Madam Chair. Jessica Hare, District 7. Dr. K, a number of folks mentioned this in their public testimony, and it's an idea I'm sort of curious about to get your thoughts. And this concept of an exit ramp, right? There's, I've heard a lot of comments about how we need to do this, or that this is going to be the magic bullet. Well, not necessarily the magic bullet, but this is going to be effective, et cetera, et cetera, et cetera. But nobody has talked about an exit ramp. And of course, I think I asked you the same question last year in 2020 in October or so. And when would you say that the masking would end? And at the time, to my best recollection, the concept was herd immunity. And we're at that 70% vaccination point. So help me understand now, where are you at on that? What do you see as an exit ramp? And because it looks to me like this is going to be perpetual if this keeps going.
Absolutely, Councilwoman. So I'll address, I think, the second point first, because I think it'll help us with our understanding. So last year, in the winter when we were talking about herd immunity, population immunity, talking about 70 to 80%, closer to that 80% range. But that was also with the original COVID virus. Since then, we've experienced Alpha. When we saw Delta, which arose over the summer, that was actually when we had to revise our estimate for population immunity upwards, probably in excess of 90%, to be quite honest. And that was related entirely to the characteristics of the virus. So since we talked last year, we're now on our third new variant, which is even more transmissible. And that makes, that I understand, trust me, I understand that it's challenging to feel like the bar is constantly moving, but that bar is moving because the virus changes, not because of any other factor, right? And so when we talk about population immunity, realistically, we're talking about in excess of 90% because of how transmissible it is. To the question of off-ramps, we didn't have a masking requirement in place. And the only reason we're talking about it is because our hospitals have, for the first time, declared that they have put into place crisis standards of care. It's linked not just to spread, not just to the fact that people are getting sick, but because one of our core civic institutions, our hospitals, are under a tremendous amount of pressure right now, and it's time limited. All the estimates that we're seeing have continued to project peak cases somewhere in late January, early February, with hospitals lagging that, so early February to mid-February. Those are our projections. We're not talking about doing this for an unlimited amount of time. It's meant to blunt that increase and keep our hospitals, even now they're struggling, but at least keep them at this level of struggle as opposed to going even further in terms of increasing numbers of admissions. So that's the time limited answer to this. I think on the longer term, one of the key things that's going to change in the next few months is the availability of oral medications. They simply aren't available in the quantities we need right at this moment, and that has to do with production levels and federal distribution, not something that we can control at all. But as oral medication becomes more available, that is going to change the ability. If people get sick, they can get oral treatment and significantly decrease their chances of hospitalization. That gives us a better a better prognosis of how we're doing. And then I have to always caution that there will be a new variant, and we will have to deal with that when that comes. Hopefully we have all the tools in place to be able to manage it, but that is our challenge, is that we are reacting to the changing landscape of what COVID does.
May I ask a quick follow-up, Madam Chair?
Go ahead.
Thank you, Madam Chair. Okay, thank you for that explanation, Dr. K. I guess my question is then, given all of that, I mean, we obviously talked about a limited duration at the beginning of all of this, right? And so it's kind of constantly been a changing, limited, and forever extending duration. And it sounds like what I'm hearing from you is, sure, it's limited right now, but there may be other surges and the virus is going to mutate. And, really this, I'm hesitant because it sounds to me like we're going to forever be back in this bend the curve, 2 weeks to flatten the curve, just get us through this surge, put another mandate in place. And I mean, am I hearing you wrong that that's a legitimate possibility that might be what you're asking for?
I think of it this way. I truly hope we don't have to have this conversation again. But if our hospitals say that they are enacting crisis standards of care and they are talking about deferring urgent care that people need, then I will have to come back here to talk to you about it. I don't want to, but if that's what happens, I will.
Okay, thank you.
The county executive fully agrees with what Dr. K just stated.
Thank you. Mr. Volke.
Thank you, Madam Chair. Nathan Volke, District 3. I just want to follow up on something that's come up a few times in these proceedings. So, Dr. K, did you reach out to anyone at University of Maryland, Baltimore Washington Medical Center, at Anne Arundel Medical Center, and/or at Johns Hopkins University to request that the physicians we heard from this morning, or someone from the local hospitals, attend the meeting this morning?
So we've been in conversation, Councilman Volke, with our colleagues at Baltimore Washington Medical Center and Anne Arundel Medical Center. at least weekly. I have conversations with them, and I have been repeatedly telling them that it is critical that they share what they are seeing, because they have talked to us quite a bit about the challenges that they're facing, talking about how we can partner and how, as a county health department, we can help with what they are seeing. And I have encouraged them to reach out to others to share what they are seeing, that they have that firsthand knowledge of this.
But for today's meeting, did you specifically reach out to anyone at those three institutions to ask them to have representatives here at this meeting today?
To the best of my knowledge, did I ask them to be here for this?
Yes.
Did not ask them to be here for this.
Okay.
Councilman Volke, if you're getting at the need for us to have a opposing view, I'll remind you there are 2 hospitals in this county.
Right, but you brought somebody from Hopkins who's not even in this county. But that said, that's not really my point about that. I'm just trying to understand. There was a statement made from the chairwoman that the council didn't request that these doctors be here, that they requested to be here. So I'm trying to understand how they got that request. And my understanding is that Dr. Kalyanaraman actually specifically reached out and asked for them to be here. And he's now said that's not true. I didn't reach out and specifically ask them to be here. I just wanted to clarify that.
All right. I apologize. I wish I had a way to keep you in order on my screen. Ms. Hare.
Thank you, Madam Chair. Jessica Hare, District 7. Dr. K, I asked this question earlier to some of the panel, and they suggested that I might follow up with you on this question. So if roughly 70% of the population is vaccinated in the county at this point, do we have a good idea of how much of the population is either vaccinated and or has antibodies to COVID from contracting COVID? What are we at there in that terms of population percentage?
So in terms of vaccination, we see that approximately 73% has had at least 1 dose, about 67% has had 2 doses. We don't have the booster data. That is related to data issues. That's not unique to us. That's true across the state. In terms of immunity combined from people who have acquired the virus versus those through vaccine mediated immunity, we don't have that data. And I think one of the things that we really look on is that there's wide variability in terms of the protection from people who have gotten infected with COVID. There's much more durable immunity for those who have gotten the vaccine. And in fact, the recommendation is currently and has always been since the vaccines came out that anybody who has gotten COVID should still get vaccinated to get durable immunity. So, we don't really rely, and we've certainly heard this, can I just check antibody levels to see if I've got protection? That is not a reliable indicator. We've found consistently that vaccine status is the reliable indicator as to protection from COVID and its severity.
Okay, but so we don't know is the answer.
We don't know because there really isn't a mechanism to know that.
Thank you.
And I'll remind the council again, the question before us is whether or not we should have a mask mandate, which is being recommended to us by our care professionals, including a letter that should be in every council member's inbox that addresses Secretary Schrader asking for a statewide mask mandate signed by the Maryland Hospital Association, HFAM, MedChi, among others. Thank you.
Ms. Fiedler.
Thank you, Madam Chair. Amanda Fiedler, District 5. Dr. Key, there were quite a few folks who testified today about vitamin therapies, and then I call them vitamin cocktails. Would the Department of Health be able to, with ARPA money, purchase and distribute to those people who test positive for COVID or prove that they have, a positive test, as just ways to assist people with treating at home, hand out, a week's worth of that daily dosage, because I did hear from the hospitals that another portion of all of this is that people are coming to the hospital and they're waiting for hours and hours only to be told, yes, you are sick. We know you feel awful, but you don't meet the requirements for admit. You have to treat at home. And then secondly, to the vitamin distribution, could ARP money be used for kind of a telehealth program so that if somebody were feeling awful at home, instead of making the effort to go to the emergency room, they could call. I know there was once an Ask a Nurse program at one of the hospitals. I don't think that that's up and running anymore. Just is there that ability from the Department of Health to do something like that?
So a couple of things. One, we have, we've talked to the hospitals about the emergency department volume that they're seeing. It's certainly a concern of theirs, but it's not their primary concern. And so we haven't really pursued that one as much in terms of facilitating connections to telehealth or outpatient care. We still encourage people to see their doctor. That's not something that we're able to set up on the fly, to be quite honest. As a public health department, we generally are not in the healthcare delivery space, with some significant but narrow exceptions to that. In terms of the vitamin therapy, we haven't really seen any studies that have shown any particular benefit of any of those. Certainly, if that were to come to the fore, we'd be able to encourage that. But we generally, once again, don't engage in that treatment relationship with the public at large, right? That has to go through somebody who's providing direct care to them. So I'd be happy to, if folks can share the evidence behind that, I'd be happy to see that, but I haven't seen that to date.
Ms. Hare.
Thank you, Madam Chair. Jessica Hare, District 7. Dr. Kay, I wanted to go back for a minute to the question on using the ARPA money for testing and things like that. I know in 2020, we used some of those COVID dollars to set up testing sites around the county. I know you and I specifically had talked about a testing site in South County and things like that, and all sorts of issues that went along with that. And you mentioned that staffing was an issue now. I know that obviously staffing was an issue then also. What am I missing that we can't use some of those funds, purchase additional PCRs, set up those testing sites, and use some of that money to get staff, like we did on a contract basis, et cetera, beforehand, to keep those sites up and going for a temporary basis the next, handful of weeks?
So, Councilwoman, I think the secret was that we were using our school health staff. They were a large portion of our response to COVID. And obviously school is back and they are engaged in that work. And so we don't have the ability to shift the entire work product of our department to COVID exclusively. So that piece is off the table. And then in terms of, we would absolutely use the money to hire additional staff. There are no additional staff to hire. That's the challenge that all of us are facing. And as I noted earlier, that's why the governor has had to draw on the National Guard to stand up testing. The state has contracts with hiring firms and with staffing agencies. So do we. And nobody can draw additional healthcare staff because everybody's pulling from the same pool.
Okay, and so not even with all the staff, but just even one additional testing site. I mean, we can't staff anything.
At this point, to do that, we would then have to take something else down, and that's been our challenge. Is that if we do that, then we would have to take vaccinations down, most likely, because those are the staff most ideally suited to be able to do testing. And we made the decision to invest in at-home testing as a way to continue with our vaccinations, continue to provide testing, and leverage leverage the ARPA dollars to be able to provide additional testing.
Thank you.
Again, I'll remind the question before you is related to mask mandates and slowing the spread, not testing.
Ms. Fiedler.
Thank you, Madam Chair. Amanda Fiedler, District 5. I do think that these questions are important in the grander picture that we're looking at today. Back to the enforcement piece, because I did double check again the health department website. There is an associated fine back in 2020, and I'm asking these questions on behalf of businesses that have reached out to express concern, uncertainty, anxiety after previous mandates. Will there also be the online list and closures that there was before? And are the fines the same as 2020 or last year when we had the mask mandates?
We do not anticipate there being a list, Councilwoman Fiedler. In terms of fines, I don't have the data at my fingertips, but when we talked about this in previous iterations, it was a very small fraction we had to go back for a second visit. By and large, everybody that we contacted said, yeah, my bad, I'll do it, or that was just a one-off, and it was pretty easily handled. I understand that there's concern, but we have always been steadfast in our work that we're not out to get anybody. We're out to just ensure that people are masking so that we can decrease the spread. There were, to my knowledge, and if I'm wrong, I apologize, but to my knowledge, there were no monetary fines levied at any time that I'm aware of. We did have some temporary closures for non-compliance, but those were typically remedied, and there were only a handful of those.
Mr. Volkey.
Thank you, Madam Chair. Nathan Volkey, District 3. Doctor, I just want to circle back one more time to this. So it's your statement today that you did not reach out to anyone at the hospitals asking them to be here today to offer testimony in this meeting. They just signed up all on their own, just kind of, you didn't know they were coming. They just signed up. You didn't reach out to them and ask them to be here.
Councilman Volkey, I didn't say I didn't know they were coming. I mean, we were in constant conversation. But in terms of,
I think the question is just, did you ask them to be here then? That's what I'm trying to understand. Did you specifically ask anyone from either of the two hospitals in the county, please send someone, please be here to testify? Did you do that?
I was trying to answer Councilman Volkey.
Okay.
So I did not say that I wasn't aware that they were coming. Of course, I was aware that they were coming. I started off by saying that we are in constant contact. I am in constant contact with our hospitals. I certainly encourage them to reach out to council members, to share what's happening, and to the public, and to share widely. We have asked them to do that through a variety of mechanisms. When you're asking, did I ask them to come here specifically? I asked them to reach out to y'all. As to how this was set up this morning, I do not control the county council schedule. I do not control the agenda. I was aware they were coming, yes.
Councilman, concerned that the hospitals that serve our county came and briefed the county council on their current status?
Mr. Barron, I don't know if you're familiar with the proceedings here, but we typically ask the questions and then Madam Chair controls the flow of that. So with
Madam Chair, point of order, please.
Yes, Ms. Lacey.
Thank you, Madam Chair. This is also not a court of law. I would ask that you ask Mr. Volkey to move on, please. Dr. Kalyan-Rahman is not on trial. Thank you.
Thank you. Let's see, I think Miss Pickard.
Thank you, Madam Chair. I think the larger global questions, as we do sit as the Board of Health, are interesting, but I do want to remind my colleagues that we're here to have a emergency legislative session around Bill 622 and Bill 722. We've been at this since 8 a.m. I'm ready to call the question, and I'm asking my colleagues, are we ready to call the question on Bill 622 today, right now?
I second that motion. Madam Secretary, please call the roll.
Madam Chair, point of order. That is not a real motion to call the question. It's a motion to close debate. If someone wants to make a motion to close debate, that's different, but that's not a motion to call the question. That's not a real thing.
I believe it is a thing. Madam Parliamentarian, is there? Can you clarify? Oh, you're on mute.
Could you please repeat the question for me?
Is a motion to call the question a legitimate motion?
I think it's the same thing as a
motion to close debate?
As a motion to close debate, it's the same thing. You want to vote. The point of each one would be the same as I read it.
Okay. In that case, Madam Secretary, please call the roll on the motion that has been made and seconded to call the question on Bill 6-22.
Mr. Volkey.
Point of personal privilege, considering that it's a motion to call previous question in parliamentary procedure, and then there's a separate question, which is a motion to close debate. I'm going to vote no on what is an illegal motion at this point.
Madam Secretary, please call the roll.
Mr. Pruski.
Aye.
Ms. Fiedler.
Moment of personal privilege. I had my flag and hand up. I feel like there was a necessary question. It's on previous testimony. I have gotten communication that there was something said on the record that wasn't accurate about hospital surgeries. So I'm going to have to say nay at this time because I think it's important to correct the record.
I believe that was your vote.
Yeah, yes. My apologies, okay. Ms. Hare.
Point of personal privilege quickly. I'm not sure why anyone would want to prevent us from continuing to ask questions and get more information in a vote, when we've all agreed to be here on an emergency basis and really kind of get a good understanding of what the issues are. So I'm a little surprised by the motion. And I do have a few more questions. I think we've all tried to be concise today, so I will vote nay.
Ms. Lacey.
Aye.
Ms. Pickard.
Aye.
And Ms. Rodvian.
Also a point of personal privilege. I've found that our questions have started to become repetitive and really inappropriate in terms of beyond the scope of our conversation today. So I vote aye. I'm comfortable to call the question at this time. Aye.
Okay, so I believe this is a motion to, is it a motion to call the question and close the debate? Is that the motion? I apologize. Okay, so the motion to call the question and close the debate has been adopted by a vote of 4. Although, Madam Chair, I'm sorry, we really need to get this cleared up because a motion to, I'm not certain if this is a majority vote or a super majority vote. I'm not sure if we need 5 or 4. So if we could please have Ms. Schuett explain what the vote that is needed here.
I believe it requires 5.
Okay, so then in that case, because it was 4 in the affirmative and 3 in the negative, that motion has failed.
Ms. Schuett, could you confirm that we're interpreting this correctly?
I think I said this before, at least I hope I did. I considered the motion to be a motion to end the debate and then go on to vote. And that does require 5 votes.
Okay, then at this time we will continue our discussion and questions. Ms. Hare.
Thank you, Madam Chair. Jessica Hare, District 7. Dr. Kalyana-Raman, I wanted to touch on a couple of questions that folks had during public testimony about the case rates in Anne Arundel County versus the case rates in neighboring jurisdictions where there are, in fact, mask mandates. And it looks to me like you're hard to find much correlation between a mask mandate and a lower case rate. In some of our neighboring counties with mask mandates, where there have been mask mandates for some time, they actually have higher case rates. And so any comments you have on that would be helpful.
Absolutely, Councilwoman here. And I think this is one of the harder, parts to really explain. If you'll give me at least, just bear with me for a second here. One of the challenges we have with any of our public health interventions, which are broad-based, is that it's extremely difficult to know what the counterfactual is, right? It's hard to say, well, if we didn't do it, what would it be? Because you only get one shot at it. You do it, there's an effect. But as with any of these public health measures, it's not going to stop. It's not a 0 or a 1, right? It's not that if you don't do it, everything's going to be terrible. If you do it, everything's going to be perfect. It's that it's something like a masking requirement is going to reduce the level of spread, right? That's what we're talking about. All of these interventions reduce the chances. So when we're talking about masking or with vaccinations or with testing, everything is a reduction. Distancing, it's all a reduction. So we really rely on public health studies that are able to do those comparisons, oftentimes in natural settings, right? Some counties did it, some didn't, neighboring states did, neighboring states didn't. And when we look through that literature, it's really clear. And I think I've shared with some of you the CDC webpage that contains lists of all the studies that go through masking, both at an individual level, its effect in reducing transmission and reducing hospitalizations, and then also through the use of masking requirements and its beneficial effect in terms of reducing the spread of infection and hospitalizations. And so we rely on those public health studies to say masking requirements do have an effect. But when we look at surrounding counties, you're right, it's good. You're going to see different numbers. But what we've seen from the literature is that without those mandates, those numbers would have been higher. That is an extremely difficult message. It's always been the challenge is that prevention is the absence of anything happening. And so it seems like nothing did, but it does have an effect. And that's why we rely on those studies.
I'm going to jump in here because I haven't asked any questions or shared any thoughts, but one of the things that really inspired me to bring this was I've been paying attention to the local health metrics for Anne Arundel County and really the state of Maryland since March 2020. And, we had a brief period of time in December where they were inaccessible because of a hacking situation, an outage at the state level, and then they started to come back online. Since that data has come back online, if you look at the Anne Arundel County Health Department of Health website with respect to its COVID statistics, our hospitalizations are almost a vertical line. And to me, this is so clearly, obviously, an unsustainable path. We do have some measures in place. For example, all of our public school students are masking. Now, is it perfect? Do they mask perfectly? I will tell you, at least in my classroom, they do not. But they actually do a pretty good job. Do I have to tell kids to cover up their noses with their masks on a daily basis, multiple times in a class? Yes. But even a majority of kids properly masking can make an enormous difference. I know for a fact that I have been in classroom with COVID positive students. I am always wearing a mask, and I have managed, of course, N=1 is never a valid way to make a point. However, I've definitely been in places where I would have been exposed had I not been wearing a mask and my students hadn't been wearing a mask. So we do know that some things are working. This is really about the hospitals. It's about that straight line. It's about the fact that we've broken records with respect to the number of people that are in hospitals right now. Do I have concern about the fact that it's only 30, or does it sway me in a different direction that only 30% of our hospital patients are COVID patients? Of course not, because we have patients in the hospital every single day, every single minute, and every hour of the year. So of course, those patients are going to continue that have all kinds of other medical needs that require hospitalization are going to continue to have those. There are going to continue to be people that have heart attacks. There are going to be kids that break their ankles sledding. All the things that hospitals deal with on a day-to-day basis before COVID are continuing. But the fact that we have now increased that population so dramatically beyond any previous level, I think should give everyone alarm. Do I understand the idea of, having a sense of freedom? Of course I do. This is not something I take lightly. I don't think it's something the county executive takes lightly when he put forward this mandate. I don't think it's something our health professionals take lightly. However, when we get to the point where we know that our health professionals, our healthcare workers, our hospitals are forced to ration care. I remember having a conversation, Dr. Kalyana, maybe you can share this again. Have there been in the past, just even several weeks, times that Anne Arundel County Medical Center, Luminous Health, or BWMC have had to turn away ambulances? Has that occurred anytime recently, to your knowledge?
Council, yeah, in our conversations with EMS, they are on diversion constantly. We have discussed with them that they have had to divert to other states as well. The hospitals won't say no to anyone if they actually walk up, but ambulances are in diversion. So wait times are very long there, sometimes upwards of 12 to 18 hours.
So that means diversion could mean that if, for example, if a parent had a child that they brought to the hospital with something that looked like a broken bone or appeared to be a broken bone, it is possible that that person could experience a wait of 12 plus hours or experience being diverted to a hospital in Baltimore City, Washington, D.C., or even, I know in a few cases, another state. Is that accurate?
So mostly. So if you walk in, if you walk in or drive in under your own power, they can't turn you away, but the wait times might be extremely long. If you're in an ambulance, there is a system to say that we cannot take this ambulance now. You will have to go to a different hospital. And so that diversion system is run by the state MIM system. So, under federal law, nobody can be turned away, but it doesn't mean that you're going to be seen in any period of time that is reasonable to you because of the large volume that's happening right now.
Thank you for clarifying that. And to me, that's really at the heart of this matter. We've gotten to a point where, any of us could be driving to the grocery store with or without a mask, and we are in a fender bender and we're seriously injured, and an ambulance comes and takes us to the hospital, and we no longer are able to get the prompt care that we otherwise would expect, or the care at our local hospital that we otherwise would expect. And so I just really want to emphasize that's what this bill is about. It's not about our rates. It's not about our positivity rates. It's honestly, I would love to, I'm going to continue to wear a mask to protect the people I love and my fellow citizens and residents of Anne Arundel County. I'm going to continue to do that as long as I need to make sure that we're not spreading this around the community. However, when it comes to protecting an institution that we are all impacted by, that every one of us relies on to take us to get care if we have an emergency, then it's no longer one person's right to do something. That person's right to make a choice not to wear a mask impacts everyone else's ability or right to get the timely medical care that they expect from our local institutions. And I will leave it right there for now, but I want to respect my colleagues and give them the opportunity to ask additional questions. And again, I've lost track of who's next, so I'm just gonna go Fiedler, Volke, Hare, Fiedler, because that's the order that you're in on my screen.
Thank you, Madam Chair. Amanda Fiedler, District 5. I do wish that we had some of the representatives still here in the room from our area hospitals, because my understanding is that that the EDs are still triaging, and they're still triaging based on severity levels. So I can't really speak to that process, but that is still taking place. So I don't want anyone out in the general public to fear for a scenario that you would be in a scenario that was represented here and you would be put in the back of the line. There is a triage process that is very much in place. I've been part of that process and weighing in as a patient on that process. So I do know it exists. I did want to go back, Dr. K, and I don't want to misquote you. It just stuck out in my mind and my phone started pinging. When you mentioned that emergency surgeries are not happening, am I quoting you right, or did I misunderstand you? Because I want to clarify that point.
I'll say it now. I'm fairly certain I said urgent surgeries are being deferred. Doesn't mean that all of them are, but absolutely some of them are being deferred. That has been part of our conversation with the hospitals, is that they've had to ramp up that a number, how many of the surgeries per week that they are deferring.
Madam Chair, may I ask a follow-up? Okay, thank you. So my understanding is that cancer surgeries are still taking place. Urgent life-saving surgeries are still taking place. It's more the hip replacements, the things that people are uncomfortable. I get it. I have surgery that I've put off for quite some time. But it's the urgent, emergent surgeries are still taking place, and they are not being turned away at this point. That's my understanding from what's happening in the surgical centers.
So what's happening is essentially, right, the whole point of being able to do a surgery, to be able to schedule a surgery, is to be able to control those conditions. You don't need to, stay in the hospital for 3 days now if it can be safely done in a week. Yes, some portion of those surgeries are going to have to get done now. They're not being delayed for 2 months or 3 months. It was more of, we're gonna schedule it in an orderly fashion to happen in the next 10 days. Most of those are still happening, but the longer ones don't. And what we find is that if at some point, if you don't do what you're supposed to do in terms of care, it becomes an emergency. Things like hip replacements or other types of surgeries that don't require an overnight stay, and sometimes I don't want to speak about any specific surgery. Essentially, we're talking about surgeries that would require an inpatient stay. Surgeries that are done in outpatient ambulatory centers that don't require a stay, those are different. That's not what we're talking about. We're talking about those that require hospital space only.
Mr. Volkey.
Thank you, Madam Chair. Nathan Volkey, District 3. I want to follow up on a question. It was one of the first questions that was asked in this discussion, which was about the breakdown of who is in the hospital with COVID at this point. I believe that the numbers that you gave, Dr. Kalyanaraman, were 65 to 70% of the hospitalizations were unvaccinated, 30% were vaccinated but not boosted, and less than 5%, but roughly 2 to 3% were vaccinated and boosted, but typically had severe underlying chronic conditions. Now, considering that you know the breakout on the vaxxed and unvaxxed and boosted and all that, and that you know that the people who are in the less than 5% had severe underlying chronic conditions, my question is, of the total number of everybody that is in the hospital for COVID, how many of them had severe underlying chronic conditions?
So Councilman Volkey, I don't know that answer. So I'm basing the data in large part on data that the hospital shared with us. When we followed up with them about who are those folks that are vaccinated and boosted, that's where they gave that additional data. Or additional description. I don't want to even portray it as data. I hope you understand that a large part of what we're doing is trying to capture snapshots in time, right? Because it's a pretty fluid situation, and trying to paint a picture of what's happening. We don't have that chronic that chronic condition information that you're asking for, and I understand. We certainly want that too. But we don't have access to that information.
Ms. Hare.
Thank you, Madam Chair. Jessica Hare, District 7. Dr. K, I wanted to return just to the conversation you and I were having a few minutes ago. And I want to stress that this is not really a question on the effectiveness of masks from CDC data or anything like that, but more on a mask mandate in public, and how that works out kind of in real world situations, knowing of course that studies are done in very strict conditions and things like that. And so if I'm looking at the two counties next to each other, and folks obviously can move freely between two counties, and one county's got the mask mandate and one county doesn't, and the case rates are different. I mean, do you agree that there are other, transmitting in public is not necessarily the only way something's going to get transmitted, right? We did hear from someone on public testimony that, this can transmit at holiday parties or other private gatherings and things like that. So do you agree with me that kind of the real world application and the mandate itself is somewhat different and unique than the testing for the effectiveness of masks on its own, given all those kind of other circumstances that go into it?
Right. So Councilwoman here, the reality is that any public health research is a real world test. There is no control. And I think that's probably one of the biggest challenges, but also the biggest strengths of public health research is that it is typically a real world example. So, you know, in the comparisons that they did between jurisdictions that put into place the masking requirement and didn't, right? They're simply comparing what happened in the one that did with all the messiness that involves against ones that didn't with all the messiness that involves. A masking requirement is another tool. It's another layer. It's not perfect. And I think the reason we're talking about this layer is because of the situation the hospitals are in. We were not talking about it just based on spread or cases. I assure you that a case rate of 20 makes me uncomfortable, which is what we saw a month ago, right? But without the commensurate hospitalizations and the stress on the hospital system, it wasn't really something that we were saying was necessary at that time. As things got worse, right? As we saw the conditions change, that's what really is the trigger for considering this layer at this time for a limited period of time. So I don't remember who said it, but a mask requirement, you do see people's behavior change. There's still going to be a slice of people who don't. There are laws on the book for everything. There's still people who violate those laws every single day. But we do know that they have an effect. And they have an effect to decrease the unwanted actions or behaviors. And a mask requirement at this time is also a signal that we are in a serious moment and would shift behavior enough to help with this situation.
Mr. Pruski.
Thank you, Madam Chair, Councilman Andrew Pruski. Thank you, Dr. Kane. This question's for you. There's certainly a lot of ways to spin or talk, and a lot of the questioning here I find interesting. Again, there's always different opinions, but if I'm not mistaken, the hospital CEOs also wrote a letter in the Capital Gazette, which was pretty public, which is administration to talk besides the doctors that were here today. So it wasn't just 3 doctors. There are others also calling for masks. And this is my question to you, because I'm focusing on Bill 622 and not all these other things, but in particular, masks are meant to another source of prevention to reduce the spread so that hospitals can operate. All right. People are asking questions, and I understand how many are COVID, how many not. We have flu, we have heart attacks. There's a whole bunch of people that go to the hospital. The point is the hospital capacity and staffing is the source here. And do masks, this is my question, do masks help with the prevention to help with staffing at the hospitals? I think it's a simple question. And if it doesn't, then you tell me that and we vote that way if you believe it does. But I think that's a pretty clear nexus here between the policy in terms of what we're doing. And in addition, I know there was concern over the time limit, right? Because one person shouldn't be making the decision, multiple people, then we review that, right? As the hospitals and staffing go on. Because I know the governor obviously is trying to do what he can in terms of emergency ordinances and so on. So again, if you could just answer that question, is there a nexus between this policy that we're trying to do with 622 and hospital staffing, prevention, and so on? Thank you.
Councilman Pruski, yes, masks and a mask requirement would decrease spread and have been shown to decrease the rate of hospitalizations. And that's what we're trying to do, is decrease that increasing pressure on hospitals to admit more and more people who are positive for COVID. So this would absolutely help the hospitals.
Councilman Pruski, Pete Barron with the administration. Appreciate the question. I will add, just for the record, the administration did not want to be at this point. We tried everything to not get here, but we listened to our hospitals, and that is why the question is before you today. Thank you.
Ms. Fiedler.
Thank you, Madam Chair. Amanda Fiedler, District 5. I did try to pull up the jurisdictions that currently have a mask mandate imposed, and I wasn't able to find very quickly, do any of them currently have an outside mandate included in their executive orders?
Keep bearing with the administration. I think the question is outside.
Correct, yes.
Outside spaces. I'd have to defer to Office of Law if other jurisdictions do. If I can state it correctly, and Greg, please correct me if I'm wrong, I think ours is only required outside if physical distancing is not possible.
Greg Swain, County Attorney. The one I'm familiar with is the Baltimore County order, which requires masking public transportation, many indoor spaces, healthcare spaces, as well as any place that food is prepared or packaged.
Madam Chair, if I may.
Go ahead.
Thank you. So that sounds like to me that Anne Arundel County would be the only county of the central jurisdictions, the large central jurisdictions, that would have an outside mandate as well. So thank you.
Well, let me, Greg Swain, County Attorney, let me qualify that because I'm not intimately familiar with others than the Baltimore County one. Although I do, so I really don't think I can speak affirmatively and conclusively on that issue. Thank you.
Mr. Volkey.
Thank you, Madam Chair. Nathan Volkey, District 3. Dr. Kelly and Rahman, I guess one of the things I just heard you say, I think in response to Councilwoman Fiedler and then also to Councilman Pruski, was you were very firm that masks will shift behavior, that masks will send a message, that they will do something to help the hospitalizations and decrease them. And I think where I'm struggling with that a bit is having looked at the dashboard for the state and seen the hospitalizations in other jurisdictions, including those that have had mask mandates for months. Specifically, I'm thinking of Prince George's County, Baltimore City. Even Montgomery County has had theirs, I believe, since November. They're all still tracking on the same trajectory in terms of case rates and positivity and hospitalizations. So I'm curious how it is that you can say unequivocally that yes, a mask mandate is going to decrease hospitalizations, given that we have real world data from our peer counties that is showing that that doesn't seem to be true.
Yeah, Councilor Volkey, I think that harkens back to something that I was saying a little bit earlier as well, which is that it's really hard to prove the counterfactual, right? And this is why we rely on the public health studies that have shown that mandates do have an effect. They don't prevent the entirety of that increase. They blunt it. And that's what we're talking about. We're talking about blunting it to whatever degree that we can because of the condition that they're in. Based on the studies, numerous studies that have shown this effect, I do feel fairly confident in saying that without those mandates, their rises would have been higher. I can't prove that to you because they only have one path that they were able to take, and I can't show you what would have happened if they didn't do it. But that is why we rely on studies.
Mr. Volkey, do you have? Oh, I see your hand down. I don't see any additional questions from my colleagues. Without any additional questions, Madam Secretary, please call the roll on Bill 6-22.
Mr. Volkey.
Nay.
Mr. Pruski.
Aye.
Ms. Fiedler.
Nay.
Ms. Hare.
Aye.
Ms. Lacey.
Aye.
Ms. Pickard.
Aye.
Ms. Rodvian.
Aye.
4 in the affirmative, 3 in the negative. Since this is an emergency bill, bill number 622 has been defeated.
All right, thank you, Madam Secretary. Let's see. Are there any additional questions that my colleagues would like to ask with respect to Bill 7-22? Or any additional comments from the administration?
The administration, can you not hear me now? The administration does have an amendment prepared to deal with the gap because this meeting has gone on past noon. I think that would be the only thing that we would add at this point. Again, to remind the council, this is to help our hospitals.
Madam Secretary, in that case, please read amendment number 1.
Amendment number 1. This amendment applies the ordinance retroactively to executive orders 55 and 56.
Is there a motion to adopt?
So moved, Sarah Lacy.
Is there a second?
Second, Allison Pickard.
Is there actually, Mr. Barron, would you like to make any comments about this, or?
I think it's pretty self-explanatory. It's the legal reasons to do it. It doesn't change any of the substance.
All right, thank you very much. Any additional discussion? Madam Secretary, please call the roll on amendment number 1.
Mr.
I'm sorry.
It's fine. We just vote. I don't know.
I saw your flag after I already.
It's okay. Nay.
Mr. Pruski.
Aye.
Ms. Fiedler.
Nay.
I'm sorry, could you give me that one more time?
Nay.
Sorry about that. Ms. Hare.
Nay.
Ms. Lacy.
Aye.
Ms. Pickard.
Aye.
And Ms. Rodvian.
Aye.
4 in the affirmative, 3 in the negative. Amendment number 1 is adopted.
Thank you, Madam Secretary. Because this is an emergency bill, we don't have to now schedule it for another date. And my understanding is that there is a second amendment. Madam Secretary, could you please read amendment number 2?
Just one moment. Is that one being offered?
I'm so sorry.
Yeah, thank you, Madam Chair. Yeah, just in the rush to get everything in front of the council, we had 2 options. Because amendment 1 was accepted, there is no need for amendment.
Okay, so we're good. All right, so we're now discussing Bill 7-22 as amended. Ms. Lacy.
Thank you, Madam Chair. So during today's hearing, I've been making an extensive list of notes of things that I'd like to say, and because it's so long, I'm going to go through it and hopefully skip the things that are things I wrote down that I shouldn't say, I just thought to myself, as you all, I'm sure, had those thoughts as well. So first, COVID particle size. We should remember when we're talking about the COVID particle size and the efficacy of masks, that yes, the particle size itself, whether it's 1/10 of a micrometer, is tiny. The only way it actually gets spread is by being attached to and contained in respiratory droplets, which are far larger. So the way water transmission and particle transmission happens through masks means that they get clumped together, and that actually increases the efficacy of removing a particular viral particle. So just keep that in mind. 0.1 micron is not the determinative fact there. Second, I wanted to respond to some folks who quoted Benjamin Franklin about those who are willing to give up some of their liberty to achieve security. He also is quoted as having, I think, also discussed a different element about liberty having to do with the public health. Relevant for today, back then in the 1730s, or in 1750 up to the 1750s or so, the smallpox virus was wreaking havoc, and it killed a very, very high rate of people compared to what COVID does. But Benjamin Franklin was apparently part of a family that didn't believe in trying inoculation with the smallpox virus to try to get immunity for other people. And he decided to try it. He saw that it worked. But then he decided, he waited before getting his 4-year-old son inoculated with smallpox. And in the meantime, in this waiting period, his son passed away due to a different virus. Benjamin Franklin was so overcome with grief that he then advised everyone he knew that he preferred inoculation because it was safer than doing nothing. It was a little bit of a loss of liberty, but he wouldn't have traded his son's life for that. Third point, 0 people have testified today, online, or in written testimony that masks are so useless they would want their own healthcare providers to stop wearing them. Think about what that means. The best, meaning achieving 100% of both compliance and properly wearing masks, is not necessary to actually achieve our public health goals, which remain flattening that curve, the same curve that brought us here 2 years ago to first begin discussing emergency orders. The difference is that right now, because of Omicron, that curve snuck up on us and has soared exponentially beyond anything that we were imagining. We were sort of, in a sense, asleep at the wheel, complacent. We dropped our vigilance. And now, to me, the most important point of everything that's been said today is that our hospitals are not available for the standard of care that we expect for them to normally have. And I expect certain of my colleagues, in fact, all of you have probably had to go to the hospital at some point. You've probably had your life saved by the staff in a hospital. You know people whose lives have been saved. You know people whose lives have been lost in the hospital despite all the valiant possible efforts that could have been made. And when our hospitals take the extraordinary step, even after not just 2 years of this pandemic, but ever that anybody knows about, to come tell us that they need our help, shame on us if we don't take that seriously, if we don't take them to mean what they're coming and telling us. They have absolutely no reason to be telling us this if it wasn't true, if they weren't experiencing the effects of a lack of capacity, lack of staff, being so completely exhausted, being emotionally burnt out, being morally demoralized by our lack of humanity. That's where our job is about protecting the public health. And it's not about tallying up every voter who reached out to us with their yay or their nay. They did, and we tallied it up, and we know, and we each got a bunch of yays and we each got a bunch of nays. And we're each going to piss off a whole lot of people in our districts and the county as a whole by how we vote today. But that comes with the job. And any of the 7 of us who came here expecting to lead have to take the good with the bad, including the bad that this COVID situation is crappy. We all wish it was over. Nobody wants to wear a mask. We're all sick of having these debates. There doesn't seem to be anything new to be said. So it's time that we all pull up our big girl panties. We do what we need to do, and we vote to protect the public health above every other consideration. I do want to also say the second factor that is most important to me, based on what one speaker said, children are the least at risk. And I just want to say, I found that statement outrageous. We know that the number of children getting sick with COVID via the Omicron variant is rising. We know that the number of hospitalizations of children, especially young children, are rising. We know of a young 4th grader, 10-year-old at Overlook Elementary in my district who passed away just last week from COVID. I've heard from other people very, very close to me this morning about alarming positive COVID test results in their very young children who can't be vaccinated. And I think we can't so callously say it's not a big deal for children to get sick. We frankly just don't know enough to even claim that. I want you to know I always vote my conscience. I always look at the facts. I always look at factors like causality versus correlation, and I try my best to have a thorough understanding before I vote. But when I vote the way I do because I feel I must. And that's what I'm going to do today. And I guess that's probably all I should say today. Thank you.
Thank you, Ms. Lacey. Mr. Pruski.
Thank you, Madam Chair, Councilman Andrew Pruski. I just want to thank everyone from the public that came to testify. I know it's been a long hearing and everyone, has different opinions, but that's okay, right? And we have that. What's in front of us, though, is a policy decision, and that's why I asked Dr. K earlier that if masks will help, and not just him, but the 3 doctors that we had here today from the hospitals that serve Anne Arundel County. But in addition, I think we also need to consider the facts. The facts are, again, that you have our hospitals have great concern, and if this is one way for prevention during a certain time period, I think it's worth taking that chance. There are discussions, though, that we continue to have. I would love to have the roadmap that said, when's this going to be done? Because I think everybody is tired of it. But at some point, we have to react to the way the bell curve changes. We have to react to public health because we are the Board of Public Health. There could be another variant. There could be another virus. We don't know. Nobody expected this one. We just don't know. And we have to act at the time in hand. And the time in hand is now. And as we know, there's critical care at our hospitals. That's a fact. There's no question about that. Question there, whether it's COVID, non-COVID, people being served. Of course, they're going to do their best to be served, but we need to keep that in mind from what's in front of us in the current bill. Thank you.
Ms. Pickard.
Thank you, Madam Chair. Allison Pickard, District 2. I believe the bill that had the most likelihood of getting a 5th vote was the bill that we just voted on. I don't foresee, because it allowed us to move forward in a responsible manner with masks without continuing the state of emergency. I know that had been a concern during the long enduring state of emergency in the county previously. Bill 622 also allowed us to come back with a vote, a supermajority vote, and extend in 3-week increments. So because that didn't pass, I'm fully expecting 722 is not going to pass either. I want to talk about a couple pieces of constituent testimony that came my way over the course of the last week. One was a small business owner from the Point Pleasant area who is finding it very difficult to keep their retail business staffed. They are all staffed as they work, but the customers they serve are not. And it is, this person, to be honest, sort of surprised me that they were asking the county government to mandate masks for all of their customers. That was compelling to me. Another constituent who actually doesn't live in my district, but reached out and we had an exchange, talked about leadership and talked about I tell versus we ask leadership. And he had a lot to say about it. But at the end of the day, what he said to me via email was, if businesses and other public spaces, if they kindly ask me to put on a mask, I will. Well, so we're putting the burden today back on our small businesses and our other public spaces. So when this 722, I fully expect it not to pass today. When it doesn't pass, as the hospitals have asked me and the hospitals have asked our community, I'm going to ask the community to wear your damn mask. I can't believe we're here today, but we are. And we do not seem to have the leadership needed to be responsible. I don't know what to say, but I'm going to ask, and I'm going to ask, and I'm going to ask. Please do this for our hospitals, for your neighbors, for our small businesses, for our students. Wear the damn mask, and let's get through the next 4 to 6 weeks. I will be voting yes on 722. I didn't think we had to because I thought we would get 622, but here we are.
Ms. Fiedler.
Thank you, Madam Chair. Amanda Fiedler, District 5. So I know we've already voted on one bill, but this, my comments apply to that and the vote we're about to take. I have to say that I do agree with Councilwoman Lacey, this is not a position anybody in this panel wants to be in. We have received over, I think, 1,500 emails, phone calls. There are very drastically different opinions in our communities. But one thing we cannot deny is that our hospitals are very full and their staff is very stretched. So I encourage everyone who is listening at home and who may watch this later to take these facts into consideration when you're moving about your daily life and the decisions that you make. Just think about it for a moment. For me, before I take this vote, I have to say it's not about the masks. It's about the mandate. Thank you.
Are there any other comments from my colleagues? Then I will take a moment to close here before we vote on 7-22. First, this is a message to our healthcare workers, our doctors, our nurses, our first responders, every person that steps foot in a hospital that cares for a patient, even police officers. I know you show up at the door of emergencies sometimes and respond and find out you're responding to a COVID case. Please know that 4 out of 7, it is still a majority of this council voted to support you in the best way we know how. Because this is an emergency bill, we needed 5. We didn't have 5, but the majority of this council still supported you, even though that won't put a mask mandate into effect, unfortunately. The vast majority of people who sent in testimony, I think it was about 4 to 1 who sent in testimony, and then maybe slightly less if we include the folks that testified here today. I didn't count up the folks with who spoke today, but I do recognize that the majority of the speakers today were opposed to mask mandate. Still, they did not outnumber the number of folks that supported a mask mandate. So know that the vast majority of people that care about this issue are on your side. I still, nonetheless, if it were within our power, I think a mandate is totally appropriate, because when it comes down to it, we choose to follow the law. The vast majority of folks in this county and across the country are going to follow the law. If the speed limit says 55, you're going to drive slower than you would if the speed limit were 65. If the light turns red, you're going to stop. If you come to a stop sign, you're going to stop. You're not going to cross over the double yellow line or the double line in the middle of the street, because that's how we do. That's how we function as a society. Yes, there will always be lawbreakers. And it was, to me, very apparent that there were some people, in fact, quite candidly said in their testimony, they were willing to break the law. But when we have the opportunity to pass a law, even if it's a temporary law, like a mandate, to ease the burden of an unprecedented stress, and I know everyone hates the word unprecedented, but it really is the case. Our hospitals are under unprecedented stress. And honestly, this affects me personally. I think it affects many of us personally. I have a relative who is direly ill and could need hospital treatment at any moment. I don't want that to be jeopardized or sacrificed because the hospitals are stressed. And I know I am not alone. There are people like me all over this county and all over the country that need reliable healthcare service, that need ER, that need the emergency rooms to be available when they need them for their family, for themselves. And we're jeopardizing that for the entire community. So I will ask that even though this mandate did not pass today, I beg of you, go look at the county health website. It is not a curve. We're not talking about flattening a curve at this point. We are talking, it is practically a vertical line of increases in hospitalizations. We have to squash that vertical line. It's not about flattening a curve. There's no curve. So please wear your mask. If you can, get your hands on an N95. Let it sit in the sun in your window between wearing so you can wear it a little bit more before you have to replace it. Wear a double layered fabric mask if that's what you can get, or a surgical mask. But please, please, for the sake of our hospitals, for the sake of your neighbors, because I know that even those of you that believe so strongly in freedom that you shouldn't have to follow a mandate, I hope that you are still kind people that care about your neighbors, and that kindness is going to be the thing that rules the day. So please be kind. And with that, I will ask Madam Secretary to call the roll on 7-22.
Mr. Volkey.
Nay.
Mr. Pruski.
Aye.
Ms. Fiedler.
Nay.
Ms. Hare.
Nay.
Ms. Lacy.
Aye.
Ms. Pickard, I'm sorry, Ms. Pickard.
Aye.
And Ms. Rathian.
Aye.
4 in the affirmative, 3 in the negative. The emergency bill number 722 has been defeated.
Is there any other business to be brought before the County Council at this time? May I have a motion to adjourn?
Motion to adjourn,
Allison Pickard.
Second.
Thank you. All in favor?
Aye.
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 Opposed? The motion carries. The County Council is adjourned until Tuesday, January 18th, 2022 at 7 p.m. We will be back in the council chambers for our next meeting. Thank you and be safe, and please wear a mask.